Hello, hello, hello. Good morning, everybody. We have finally made it to day 3. I hope we're all feeling good. I hope we've had our coffee, we've had our snacks, and I'm sure everyone's sleeping in a bit late again. But it's okay. Now, as we wrap up the day 3 of the 2.0 conferences, we are going to have a blend of pretty much everything. We've spoken a lot about mental health. We've spoken a lot about taking care of ourselves as medical professionals in the field, and of course, innovations that are heading our way. I was pretty mind blown by the brain clinic yesterday, how there were certain coils that they could do treatments for you that could cure OCD, could cure depression, all these things. It was very, very interesting for me. And we're just going to keep going with all of that. So a quick housekeeping note, remember to use the Health2Conf hashtag when you are posting on social media, when you're connecting on LinkedIn. Don't forget, when you are connecting on LinkedIn, make sure you tell people where you know them from. Oh, we were chatting for lunch, or we were chatting in the conference area, because we meet so many people that we kind of forget where or what we were speaking about. So yes, you could just use that hashtag, and of course, that'll spread the awareness for future upcoming conferences. Now, our first panel discussion today is going to be titled Physician as an Innovator, Navigating the Modern Healthcare Business Frontier. And our panelists are going to explore the challenges and opportunities of this dual role. We have got a moderator and 3 panelists, so please welcome to the stage Dr. Ali Tanazli, Dr. Kabet Shikuku, and Dr. Caroline Purvey, as well as Dr. Fahad Attar. Please put your hands together as our first panel is about to start.
Is this on? Can you hear me? Yes. Wonderful. Good morning, everybody. We've had a very interesting 2 days here, and moderating this panel, I think, is a pivotal moment. Why? Because on the front cover of this event is innovation. So if we don't take away the golden gems of innovation, and that affects everybody in this room, and anybody that will be listening in the weeks to come from this event, you're all having to think about innovation. We've heard some wonderful gems this week, and what resonates in my mind from yesterday is here and now. You are all here, and you're here to discover something that you can take away to support your work as a practitioner, and it's about being now. And you can't be now if your head's in the phone. You can't be now if you're looking at your laptop, because then we've missed the moment. So I hope we're going to make this a very lively and innovative panel session. And I'm going to start by asking Dr. Ali to introduce yourself and remind us, if we didn't hear you speak yesterday, where you're from and what it is you're currently doing.
Hello, good morning, everyone. Great to be part of this panel. My name is Dr. Ali Tanazli. My background actually is a PhD in biophysics. And I actually built in my past new businesses at Sony and HP in the US. That I joined a startup called LifeSpin. Yesterday I introduced LifeSpin. At LifeSpin, we are extracting a very exciting layer of information from blood. We are scanning human blood samples in a magnetic field with a method called nuclear magnetic resonance. This method provides us hundreds of metabolites, which can be translated into hundreds of clinical parameters, which then we use as part of our AI engine to build a general health assessment dashboard of the human body, which is being used in checkup medicine. And so basically, the part of innovation here is that you perform the testing basically in silico with algorithms, which is a completely different way how to do it. What excites me most, also with my background from consumer good companies, is that it's truly affordable and has really the potential to reach wide populations.
Thank you, Dr. Ali. Dr. Fahad. Dr. Kibet, sorry.
Yeah, thank you. Mine is Dr. Kibet Shikuku from Kenya, one of the leading countries within the region as far as healthcare is concerned. I happen to be, as medical specialist, I am a hematopathologist by training. But besides that, I've been teaching at the University of Nairobi. For those of you that may have had a chance to visit our country, that is one of the leading institutions, training doctors. And so I happen to have had the opportunity of teaching in this institution for the last 10 years. But besides that, I'm currently supporting a very unique facility as a CEO of our National Spinal Injury Referral Hospital, something that is completely off what I'm used to doing. But then I think that gives me an opportunity to look at things differently. But besides that, I happen to be the Deputy Director for a private facility, which is the Nairobi West Hospital, a facility that is championing care, moving care to the next level, and trying to change the dynamics around healthcare in Africa. Because I'll tell you, if you move around and see the variations in terms of care, really, those of us that live in this relatively endowed and resourced setups may always imagine that the rest of the world is at par with you until you move to our continent and you can see the level of care and the challenges, surrounding the kind of work that we do. So creativity then becomes extremely essential in the kind of things that we do. And I think we shall be sharing and seeing, how we manage some of the issues that we have on the ground and, apply whatever is possible, within our setups. But again, I look forward to having a good conversation this morning. Thank you.
Thank you very much. And Dr. Fahad Atua.
Yeah, good morning, everyone. Thank you for having me here. So I'm Fahad Atta. I'm an orthopedic surgeon by profession, specializing in sports medicine and sports surgery. And I'm also the CEO and founder of Regenesis Orthobiologics and CEO and co-founder of We Healthify, which is a health tech solutions company. So from a Regenesis Orthobiologics perspective, we've got clinics set up in the UK, which basically look to manage and deal with patients with musculoskeletal problems, so joint pain, joint stiffness, osteoarthritis, sports injuries, where we look to treat them from a very holistic, non-surgical way with a lot of multimodality approach to try and then take them forward to quick, speedy recovery. And we've got clinics set up in the UK, which we're looking to expand, and we're looking to bring that concept here as well to Dubai and to the GCC as a wider sort of margin. We're also involved in a lot of screening programs for patients to find the risk of osteoarthritis, risk of inflammation using biological aid, genetic biohacking. And we use this information again for holistic approach to try and get patients to avoid reaching the stage where they need a lot of interventions and treatments for their osteoarthritis management. So overall, from a health tech perspective, we're involved in finding solutions for a lot of hospitals, organizations that can help streamline their services. We have a lot of contacts from a global perspective in this sphere, and a lot of people onboarded with us. And from an innovation perspective, which is quite apt for our sort of platform here today, most of what we are doing and most of what we're all here doing is basically trying to push the frontiers and trying to provide best and improved patient care. Thank you.
Thank you very much. And last but not least, I'm Dr. Caroline Purvey, and I'm from the UK, but I have a global mission. 13 years ago, I discovered something quite empowering and have spent 13 years developing it, working with individuals. Who are my client base? Anyone with a psoas muscle. PSOAS? Look it up, because I doubt you know where it is. You might have an idea where it is, but it's not called the hidden treasure for no good reason. I don't do anything to anybody, but what I do through my expensive and extensive experiences of investing time and funds to discover the power of the human body to heal itself. Please don't be alarmed and think, well, so what are we doing here then? Everything is enhanced when we get, and we've heard it here, when we get to the root cause. And the root cause of trauma can go back to birth. So how do we, as adults, know how to talk about it? If we don't know what the problem is, because it's deep-rooted, but the body knows. And so in brief, I empower people to take responsibility for their well-being. Move away. I don't know what it's like where you're from, but in the UK, we were raised that NHS will fix us if we're not well. Actually, times are changing. And that's what we're here to talk about, changing times. Changing times. Let's take a step back in this discussion. And I'm going to ask Dr. Ali, because this is about, can physicians lead shift towards healthcare models and all that might entail? Well, how do we know what that is if we don't learn from history? And we live in very turbulent, changing times. And we have to keep up with it. Sink or swim, I think they might say. What was life like in your practice, your business of healthcare before COVID? And I think that's an important step back because it's not that long ago. So, Dr. Ali, if you'd like to share.
Well, before COVID, I think historically also AI was kind of still future or even science fiction. And it was still about individual IVDs. So I had background in vitro diagnostics industry. It was all one test, one disease, large analyzer. So basically, it was pretty much very traditional. And what I think, and this is correlated also with the fact that you always have to go to a healthcare provider to donate a blood sample, right, to get your blood sample collected. But I think what happened during the pandemic was that people got used now to provide samples, even at very unusual places, like in cinemas. So basically, you got some level of distributed care services during the COVID pandemic because of the testing and the vaccination. So what happened is basically people also on a societal level got more used to get samples collected pretty much everywhere, even in a shopping mall. And this is an important prerequisite because if we now speak about utilization of AI in healthcare, it means also that I should be able to access these new AI tools over the cloud, right? So basically, it's all goes towards distributed healthcare services. So basically, for distributed healthcare services, you need a distributed blood collection or sample collection infrastructures, and also the mindset of doing that. At the same time, we are benefiting from this because distributed care service enabled, powered by AI solutions, lower cost per se. It is much less expensive. It has to be. If not, something is wrong, I would say. So basically, the COVID pandemic was kind of a not so good time, but paved the way, paved the road for distributed care services, in my perspective.
Thank you very much. Let's move it. How was it for you, Dr. Kibet?
Yeah, I think pre-COVID care in my region, was based on, visits to facilities, interacting with the patient. We believe that as a doctor, if you don't touch the patient, or if the patient is not touched, they don't feel like they have actually been attended to. And people would go home quite dissatisfied. They would wonder what kind of care and what kind of a doctor you are. But post-COVID, things have changed immensely. The role of telemedicine now has set in. People can converse across boards. People can consult across boards. Care has really changed. And, I keep saying that we now have two different generations in my setup. We have the older folks and the younger folks. The younger folks have less to do with touch, contact. The older folks are still struggling, to catch up with changes. So I think pre-COVID things were a lot different from what we seem to see. And just to look at one particular scenario, and I guess I'll reverse this back to the AI developers. Pre-COVID, we have had a lot of issues in relation to information acquisition from patients. I happen to interact more with, children, mothers, babies, and a mother presenting, for example, with a child with gastroenteritis, diarrhea and vomiting, would potentially come with dehydration to the hospital. And in my setup, parents tend to use herbs to children. And so mothers have learned that if you asked them whether they had actually used herbs, the next thing is a bash. They would be bashed. The doctor would be quite upset. And so a lot of mothers then would not disclose use of herbs. But remember, if you get a dehydrated child who has used herbs, the type of dehydration is a lot different from one that has not. And so we realized that we were losing every month almost 15 children because of dehydration. And the cause of death was the doctor, not the disease, because our formulations for rehydration were a lot different. And so the question then became, how do we get appropriate and correct information from the mother? We had to use reverse psychology. You accuse the mother for not using traditional herbs, for them to admit that actually we used traditional herbs for you to manage the patient. So my question to the AI developers is the role of reverse psychology in AI use, whether that is a possibility to actually get information that then helps you now that we are transitioning from physical to other forms of interventions.
Thank you. So that's wonderful to know what it was for you before COVID. And so Dr. Farhad Atur.
Sure. So, excuse me. I've had the advantage of working in 3 different countries and 3 healthcare sectors, pre-COVID and post-COVID. So I've done a lot of work in the UK and Saudi Arabia and here in UAE as well. So before COVID, I think most of us were on autopilot, to be honest. So we used to deliver services, we used to deliver patient care without really thinking about most things that have become more relevant since COVID. So most of the practices ran as they did in all countries, but once COVID hit, something significantly changed. And the change was really what COVID did to different populations in different sectors of the world and with different comorbidities and different medical conditions. So people started looking into why people are behaving differently, why their outcome is different, what the impact has had overall. And hence came a lot of screening, and hence came a lot of blood testing tools. So I think post-COVID, people started looking more from a perspective of healthcare, which we didn't have before the COVID era, if you like. And as you rightly said, COVID was a devastation, but it's made and brought in a lot of different changes from service delivery, as well as from an overall healthcare package for the patients, concentrating more on areas that are more relevant to overall health than disease specific. Because what we realized is, before COVID, people's disease status was different, their health status was different, and COVID has basically shown a light on how you can optimize those things. Thank you.
Thank you very much. So before COVID, what was I doing? I was seeing people on a one-to-one. I was running workshops up and down the country, and I was witnessing the power of trauma leaving the body. Because when we let the body do the talking and get out of our headspace, miracles can happen. And working alongside other practitioners, therapists, it enhances their work. I'm very conscious that before COVID, I had a huge responsibility, because witnessing trauma leaving the body is powerful. Simple to activate the psoas. Could get a 10-year-old to show you that. But it's the missing piece of the jigsaw. We have lots of coping mechanisms to manage the impact physically, mentally, emotionally of stress and trauma. We've heard wonderful things from walking in nature, being in nature, breathing, yoga. I've been a yoga teacher for over 30 years. That's the only one thing I do. I gave up all other therapies when I realized the power of the body. But when COVID came, things changed in a way that I never thought was possible. Hold that thought. I'm going back to Dr. Ali. COVID came. What changed? What did you have to do to innovate, to become different and move your practice forward?
So basically, what I've seen in and after the COVID pandemic was a contraction in the diagnostics industry, because during COVID, diagnostic testing was at its peak. After COVID, testing became less and less. Even in traditional fields, even checkups became less, right? So basically, this seems to be a great opportunity to basically remodel and basically do it differently, to make testing in a different format, which is more comprehensive. Because what COVID also did, I think, was empowering of patients and consumers to basically take more control over themselves, which is, I think, an important prerequisite, because prevention is driven by self-consciousness. And this, I think, is the key thing, that people really got more self-aware and basically more open, because the average person, I think, is very open to new technologies, even in healthcare. The regulatory bodies not very much, especially not the US FDA, but this will change over time. But it's important to basically, as a sanity check, to see if your thesis works or not, if average people would basically like to do it once it becomes available. That's the key thing. And this awareness is there.
Thank you very much. Interesting time.
Yeah, so I think COVID did quite a bit for us, and I want to approach this conversation from a fraudster's perspective. You know, there's a lot of fraud in the medical world, and we picked this during COVID because what we noted during COVID was the most important result that everyone wanted was a negative result, not a positive result. So everyone was working towards a negative report. You know, you are COVID-free. And I guess majority of us seated here would have wished to see a negative report. And so one thing that we learned during COVID was we had permanent individuals resident within our facility to be tested. So if you needed to hire a subject for your tests to be negative, we had specific individuals that you could easily hire for a negative result. And they were going to be tested for you. So one thing that we had to do, and we've had to apply this, with our current practice within the hospital, is that we had to try and revisit appropriate means of patient identification. And we had then to install 3 different ways of managing and identifying an individual. One was, a unique identifier, which is serially generated using our system in the hospital. The next was we created what we called the eye of the needle. So we created a mechanism that could only allow an individual to pass through, one single individual to pass through a section to be taken a photo. So that simply meant you could not be 2 of you. It could only allow one person to move to the next phase. And that phase required us to take a photo. Okay? So that was our second identifier. But that was not sufficient because initially, after that step, the next step, which was the most crucial step that required us now to take a sample from you, is where the fraudsters could come in, these tricksters could set in. And so we could only allow that particular individual to move for testing, and that meant we were going to get a specific sample for that specific individual. But that was not sufficient. We generated a QR code to validate the exercise. And so we were able to use 3 different mechanisms to validate one single activity. And that has helped us a lot in minimizing, fraudsters and people who would otherwise take advantage of processes. And we've had to incorporate this in all our service points within the hospital. Because I remember at that time, we flooded Dubai with over 16,000 travelers with COVID. And I think we even ended up having, the government's taking, steps to just curb COVID spread.
Thank you for those insights. Fascinating. So in a way, it slowed everything down, all the processes.
Yeah.
Thank you. Dr. Fahad.
Sure. So I think COVID has actually changed a lot of practices, especially from a healthcare sphere. Before, it was unheard of not seeing patients face to face, and point of delivery and point of care have always been in the clinic, in the outpatients, in the hospitals. So what COVID has really pushed people to do is to innovate on quite a lot of fronts. And as physicians, being put in the seat where things that you're used to doing, you can't do anymore. Service you're used to providing, you can't provide anymore. The traditional methods of how you used to see patients, treat patients, that's changing. So it pushes you to try and innovate in ways and areas that you can still, deliver the services that you're used to. And a lot of people realized, a lot of health physicians, surgeons realized that patient care and contact could still continue through telemedicine. So we saw a huge shift in telemedicine consultations, huge shift in services which could be done from home, such as physiotherapy, rehab videos, online consultations, which was, again, a big paradigm shift really from what we're all used to, what's outside of our comfort zone. And with that as well came a big shift for people to start educating themselves and educating patients in what's available, what's not available, how you can do things differently. And those were all sort of game changers. And another big focus was data collection, trying to get as much data about your health status, because people started becoming aware. They started looking for areas where they can enhance their health, how they can improve their well-being. And from that perspective, data collection tools became, again, widespread. Now, it's good to have huge amount of data collected, but what you do with the data is most important. So now there's a lot of transformation services and products that are available where you're trying to use a lot of this data from a health status perspective to try and fine-tune patients' well-being, precision health, how they can age healthier, and how they can implement, change their lifestyles. Now, all these things really were not on the forefront before COVID. And I think that's made one big difference because people are a lot more aware of services that are available. They're a lot more aware of differentiators that are available now and how they can get these services. And what's available, we can actually streamline them to enhance and develop more patient care. Yeah.
That's wonderful. So we are seeing a lot of innovation going on through the different practices. What did I do? My son Daniel said to me some years previous, "Mum, you want to get your program online?" And I said, "Never." And I'm a great one that says to people, never say never. And it did. The one time I said it, it came back to bite me because COVID came, and it's like, wow, now what are we going to do? Anxiety and depression's going through the roof. They need what we have. And so because of my years of experience working face to face with everyone from cancer, Parkinson's, amputees, heart conditions, brain conditions, stroke, I worked with them all because they'd come to me and say, "Will this work for me? I've tried everything." And I say, "You live in your body, why would it ever take you to a place of harm?" And because of all that experience with Daniel, we worked hard and created a 4-module program that would provide education that in one day in a workshop, they take away in a booklet and they lose their booklet, they've lost it. And so it became a very powerful, innovative time to put a most empowering process together to ensure that wherever in the world somebody would pick the program up, they would feel safe, they would feel supported. And we measured through the forms that they completed where they were at the start and remeasured at the end. And during COVID, I invested in having our data from online clients analyzed by university. Because as much as I could say, "Oh, this works," that was me. I wanted somebody else to say it worked. And 2 key findings: physical, mental, emotional well-being improved 99%, and not by chance. High levels of anxiety and depression measured through GAD-7, PHQ-9 from police officers, down over 60%. For laying in their own home, in their own space, in their own time. So for us, it was very, very innovative period. But change has happened. We can't go back. We learned from what we were doing. But change is very difficult for a lot of individuals to swallow, particularly with health, when they're used to that sitting in front and having the time. How have we become innovative since? And where is that taking us now? Dr. Ali?
I think it's important to, when we innovate, to understand the value chain we're innovating in. So in healthcare, the healthcare value chain is quite complex. We have different constituents. We have the patient, we have the payer, which could be the insurance company, or the patient, or the government, depending on the country, on the system. Then you have the physician, you have the lab, you have the hospital, you have pharma, you have retirement homes. So it's crazy, actually. But I think it's important that when you innovate, it should be a tool, first of all, which improves efficiency. So basically, the way how we look at it is, what we are doing is to help the physicians, to help the clinicians to be, let's say, more comprehensive when they check up, when they test patients. So basically, having a tool which can be used on every patient, just like a stethoscope, but basically enhanced with an AI system which goes deep into the different layers of health which we have. So, but then again, the question then is, why should a physician use it? Even if they think it's useful, in order to implement it, they also need resources in their own practices. That means, how can I incentivize the physician? So basically, when someone develops a new lab test, right, then the physician's incentive is zero, because they just get $5 for the blood collection, and that's it. So basically, how to make the physician part of it. Now, when you look at it from a software AI side, there are different ways how to put the physician into the center in terms of using the software as a decision support system, for example, and then also incentivize the physician to basically look at it as some sort of telemedical services, right? Because once you have the physician gained as your ally, then it's much easier, first of all, to propagate it to patients, and then again, to go back to the insurance companies, to show insurance companies, look, we are saving money because of better downstream treatments which avoid unnecessary costs. So basically, making the physicians part of it, that's important, so that you should not look at it as a standalone technology insulated from the rest of the world. It's very important. Or also in other fields of healthcare, for example, during COVID, point of care was big, isn't it? But point of care, even if you have fast testing, if the logistical process is not fast enough, you have no benefit from a fast test, from a rapid test, because if the logistics takes 2 hours in a hospital system to communicate the test result, there's no value in a 5-minute test.
Thank you very much. Let's hear some more from Dr. Quebec.
Yeah, so, the way clinicians are designed is a little different. We tend to be factual, we work in a certain way. But I want to use innovation, technology, and just trying to think outside our routines for us to provide services back at home. And I'll pick one simple example of bone marrow transplants that we do in our facility at the Nairobi West Hospital. So remember, bone marrow transplants are relatively specialized services. Not every Tom, Dick, and Harry would access these services, and so majority of our patients have had to travel out of the continent, not even out of the country. A lot of times it's out of the continent. I think the closest in the continent may be the southern or the northern part of our continent. And so we thought outside the box, and this is one reason why our facility is trying to take leadership in medical care by applying all the possible mechanisms that are within our jurisdictions. And so we, created a multidisciplinary team. Again, this was just a team that was composed of fellows within. And we had engineers on board, we had various specialists on board, the biomedical team on board, and I happened to have been the team leader to start up this bone marrow transplant program. Just going straight to the issues that we then had to address was that how do we use technology to provide such a sophisticated service in an environment that is less exposed? And so we decided to employ multidisciplinary team approaches and telemedicine with various groups that had exposure and experience as far as bone marrow transplants are concerned. And so we were able to identify clients because, clients were there in plenty. We took information from these groups, discussed with various multidisciplinary groups virtually, sharing information across board. Certain decisions were made. I happen to have had some little exposure during my research work to manage stem cells. So I had the lack of managing stem cells or processing stem cells, in the laboratory. But using newer modalities of stem cell harvesting, I was able to engage companies that were able to provide equipment for us to harvest stem cells. But again, the question was, how then do we proceed in an environment where consultants or specialists who should do bone marrow transplants would assist us? We knew that the role of a doctor is to manage, prescribe, follow up, and we knew that we had this level of expertise. but then the specialized services were not readily available. And we engaged our colleagues across in India. We had other colleagues in the US, but we majorly worked with guys from India to prepare our patients for a local bone marrow transplant program. And trust you me, we were able to prepare patients locally, airlifted this consultant to come and help us with the initial bone marrow transplant. He stuck with us for another 2 days, flew back to India, and used technology to continue supporting our patients. And this far, we've managed to do 2 allogeneic bone marrow transplants and 14 autologous transplants. So technology, in my view, can be used to upgrade services across the world. We don't have to sound deficient. We don't have to sound desperate. I think we can all work together using technology to make care much more affordable.
That's wonderful. Thank you for that sharing.
Sure. So from my perspective, I think healthcare transformation is on the rise. And I think there's a lot of different changes coming in. And where I think the development going forward is going to be is in digitalization and building and improving technology and how we use that to deliver care. 2 things I'll talk about, which we've seen over the last 2 days, has been the focus of the meeting, is AI and how AI is going to impact how you use AI. Are clinicians, doctors, surgeons, physicians going to lose jobs over AI? Which sectors is going to affect? Now, AI is a very good tool, and a lot of people are looking in different industries to use AI for their benefit. And healthcare is the same. We shouldn't really see it as something that is going to start impeding and stopping us doing what we're trying to achieve and do. But I think the status of AI in healthcare has to marry up with the clinician expertise and experience to try and get the best outcome and output from it. So using a lot of data, using a lot of data sets with healthcare scenarios, you need AI to sort of process it quickly. You need AI to be able to give you some sort of a logistic answer, which you cannot on your own. Seeing multiple results, multiple reports across various different specialties coming through to you is very difficult. So AI can do that for you. But what you do with that then for patient benefit, patient care is the key. So you've got to then use that data to streamline and have more patient-specific treatment programs, patient-specific interventions. And at the end of the day, what you're trying to achieve is good outcomes. And for achieving good outcomes, I think you've got to use what's available technology-wise, but you've got to still fall back on clinical expertise and experience. And if you marry both of them up together, I think that's, you're on a winner then. The other thing is predictive modeling or predictive analysis. Now, again, there's a lot of data out there. If you can use that through AI to sort of say certain interventions in certain populations have certain outcomes, again, it empowers patients in making decisions. If they come in to see you and you tell them, right, from all the healthcare status that we've collected, all the investigations we've done, we think if you go ahead with this procedure, this is your risk, which is a lot more than a vague figure that we used to give patients because of the predictive analysis we have now. It empowers them to make a decision, and that's what we're after. So I think AI, predictive analysis, digitalization is probably going to be in the forefront, but you have to have work very closely with clinician background, experience, and expertise to deliver that. Thank you.
Thank you very much, and great tools to think about moving forward. What are we doing to move forward? We live in a global world. The world gets smaller. We have the innovation of technology. And what Daniel's creating is our program in multi-languages. Because the human body is the same wherever you come from. And the impact of stress and trauma is the same in different ways, but it comes from holding tension in the body. And so we're currently working with Malawi with their Chichewa language. I went to Malawi in 2018, taught 9 adults. They've reached out to over 6,000 children. They're open-minded. I call them the nation of inspiration. But they're loving it in their language because it makes it education. And let's think, education is key in this world that we live in. We cannot just sit back and do the same old, and think the same old, same old. And the health services in the UK and most likely around the world are drained and strained. We've heard on this stage how care workers, people in caring for others, are not in the best place themselves. Heal thyself, physician. And innovation for us, not just is working with multi-languages, but facilitating online, training facilitators with the project. So the one thing I have not heard a lot of this 2 days is the children. The children are our next generation. COVID messed them up big time. And we're seeing that everywhere. Children that learn our program, 4-year-olds, 6-year-old recently, his trauma had him wetting himself at school every day, wetting the bed every night, one session that his mum set him up for. No more bedwetting. Wonderful. How many years? Children carry their trauma into their adult life. Let's free up the NHS. Let's free up the carers for the serious diseases and accidents and injuries that need medical attention. But when the majority can free themselves up, have a prescription. That's how I see innovative. Have a prescription, go and do this program for 4 weeks, and come back and see me. You can't talk about the problem if you don't remember what the problem is, because it goes back years. So there's some great innovative opportunities. And when you're online with whatever you do to help people, even if you're a yoga teacher, you want to talk about nature, online programs reach out to the masses, and that is the joy of technology. So we have to embrace it. It's about education, changing mindsets, and breaking down resistance. Because when we can do that, we'll all be well, we'll all be happy, we'll all sleep, we'll have peace in our heart. Because peace comes from in here. Nobody can help you find it, but we all have the tool to find it. And then the physicians in the surgeries, the hospitals, can progress. Thank you very much. I think we could go on for a long time with this topic.
Sure, we can.
But I've really enjoyed hosting this and listening to the innovation that comes forth. Are there any questions?
Thank you for that. The reason why I came to this particular presentation is I'm involved in a startup with a physiotherapist from Australia and a general practitioner from England. I'm from Australia myself. My name's Clint, by the way. And upon talking to those two, they made a comment that it's a combination of what the health industry attracts in the way of individuals and the way health is taught, which is maybe somewhat counter to being an innovator or something like that. And when I was listening to you, I noticed things like the phrase I think was used to do. Fahad, you were saying like, people are used to doing it this way, and I heard somebody say the word never. But I did hear efficiency. I also heard the word we're very fact-based. What are your thoughts on that notion that maybe the way the health education system teaches, but also the kind of people it tries to attract, perhaps not having the disposition towards innovation, and if that is indeed an issue, what are your thoughts on how that can be corrected?
You want me to take that? Thank you very much for the question. So if you just go back a little bit to how all clinicians and doctors and physicians are trained, we're trained to be physicians. We're not trained to be innovators. We go through medical school or any other sort of fraternity. There is never a module which says innovation or what you can do to innovate, or if you have innovation, that is, what do you do? So this is something that's really not ingrained. So what tends to happen is when you start working and you're busy and you go through your lifestyle clinician-wise, you tend to be on autopilot. You do what you're taught to do, and you do it well because you gain that with experience. But it's only when you start seeing gaps in the place of work, gaps in the service delivery, gaps in what you're trying to achieve, that's when you start thinking, right, how can I do this better? And that's when innovation comes in. And I totally agree with you that at the moment, most healthcare facilities, healthcare practices, are not trained and ingrained to get people in who've got ideas, to nurture them, build them, support them, so they can actually reach an end goal. So hence, it becomes almost a solo effort from someone who comes up with an idea to try and push it through. They try and gain some momentum, they gain some interest, they push it through accelerator programs, they say this is a benefit, they get investors on board, and that's when it sees the light of day. But I think it needs to be more centralized. I totally agree with you. I think the concept needs to change, that you need to incorporate innovation, and you need to be looking for innovation in every aspect of your healthcare service delivery. And once you start doing that, you start improving services, you start improving delivery, you start improving products, you start improving implants, you improve global sort of, healthcare services worldwide. And if a lot more people start doing that as they work, and I think, it has a bigger impact. That's my view. I'm not sure if the panel agrees.
I think something has to happen on both sides. For example, now when you talk about AI, generative AI, multi-omics, let's say precision medicine, these are all very new fields, and you cannot expect from a general practitioner, for example, to be a master of all these areas. So basically, then the task is, I think, on the innovator side also to present it in a way that it's really insightful for the clinician and being perceived as valuable. Because if there's a delta in the output, I can have the most precious information, but if I cannot communicate it efficiently to the physician, and no one has to understand in detail how the AI works, because I think most people don't know how a car works, still people buy and drive cars. So, but there needs to be common sense of understanding what it is, and most importantly, what it is good for. And this, I think, needs to be 100% be communicated in the clinician's language.
Sorry, just to add to that, I agree with that, and I think there should be a lot more collaboration between physicians and industry, and also a multidisciplinary type approach. And I think, again, that sense is not there, and I think that sense is lacking, and I think that's something, again, everyone consciously needs to build and develop on. Having an MDT approach, a lot more links to industry, a lot more fast-track programs where you have discussions, where you can share ideas across the board, I think is the way forward.
You took the words out my mouth there, and I was going to say collaboration is important. We all need to work together, because even with the process that we have, it enhances the work that everybody else is doing, and they need that, the nutritionist, the exercise guru, the physio. And then they need to free up and move the next one in, because there are millions of people that need support.
And here the collaboration must happen, I think, on the level of innovator and clinicians, but on the other hand also internationally, because healthcare is something which impacts the entire humanity, right? And that's the beauty of new methods, that technically they can be globally accessible, and that's also the value I see in this panel and I see in this conference.
Thank you.
And just to add on top of that is, because I totally agree with the team here, having this multidisciplinary approach is extremely important. I happen to have been supporting an HIV program in my country, and we noted that it was almost impossible to determine the viral load in the far-flung areas, the unreached areas, and so we had to bring in engineers on board to try and figure out what tool would be sufficient for us as a point of care just to determine the level of viral load. And so working together, I think, in my view, is inevitable. And these silos that we've created possibly need to be done away with, so that then we can have a bigger conversation, as professionals.
Thank you very much.
Thank you.
Good morning. My name is Dr. Musa, for who doesn't know me. Thank you again for all the very valuable insights that you guys had. I had one question, standing here as a very humble doctor trained as a physician, who has particular interest in exactly what you're speaking of, in collaborating and combining the industry sense with, of course, physicians and the medical world. And I'm asking you this as the experts and masters, as innovators and physicians that you are, what were your personal greatest barriers in setting up your own industry kind of companies where you had to overcome them and you had to learn something new as an innovator that you didn't know as a physician? And I know it's a bit personal. Excuse me.
I'd like to start with that one, if I may, because my work's been very challenging. And years ago, I'd stand in front of people and say, you know what, when they first brought yogurt out, nobody wanted to know. We're the new yogurt. And more, we're looking for answers, not go round the same revolving doors. And I would claim to probably have met more resistance, more skepticism than anybody in this room, because everybody does something that is familiar with centuries of building through. But I love the words of Hippocrates, and I use it a lot. The best medicine is to teach people not to need it. And that's what my passion is, that drives me through. And if you have a passion for what you do, and you can prove that it works, then you stand in your shoes because you know, I know what I do is my life purpose, whatever that takes. Because I know something that the majority of people don't know. So whatever the challenge is, if you believe in what you're doing, do it. And keep driving forward. That's my message.
Sure, thanks, Dr. Omar, for that question. Whenever anyone starts up with an idea, an innovator, for example, who is a physician, you have a comfort zone of what skill sets you have and what you're comfortable in doing. When you have an idea, you're passionate about it, you have a vision about it, but what I think you've got to realize is you need a team. You need a team who basically buys into your vision, who sees what you are seeing, and they've got the skill set that complements you. So one of the challenges I had when I started off was trying to find that team. The key players in the key positions. You know, it goes to anything you do, right? From sport all the way across to management, leadership. When you've got the right players in the right positions, you will win. And that, I think, is the most challenging thing. And that's what I spent a lot of time doing. Because when you have a vision and you have people coming in, if they don't buy into your vision, they don't see the end goal, which is going to be a few years away. It's not a short-term goal, it's a mid to long-term goal. If they don't see that, it's very difficult for them to buy in and for them to invest into you, invest into your service, invest into what you're trying to achieve. So that's probably the most important thing. The second thing is perseverance, because you will fail. It's difficult, and it will be a struggle to start with, and I've been through that road. And you've got to keep picking yourself up. You've got to keep telling yourself the end goal is what matters. You've got to keep that at sight, and you've got to have people around you who support you, who have your corner, who have your back, so you can actually keep propelling yourself. So those are the two things I think from my side are probably the biggest challenges I faced. Is one is the team, getting the right people, and second is to keep going. You know, when you think, you know, I can't go anymore, you just got to keep pushing, and I think that comes down to what you said as well.
Yeah, I think for me, and again, I'll approach this from a totally different program that I've been supporting for the last 10 years. And this program happens to be a program that supports patients with bleeding disorders. So basically, one of the things that we had to try and do was to demystify, as I said, the boundaries that we tend to, you know, create. And so I started a hybrid program. I call it hybrid, and I still sell that program as such, where I have the clinician, the patient, and the parent together with any other stakeholder working together. Because unless you work together, unless you understand each other, you may not be able to achieve what you want. And just to stretch that a little bit, I realized that a lot of bleeders who have this genetic disorder, and I'll use one of the bleeding disorders called hemophilia, and I'm sure you know that, which tends to affect males more. And I posed this question to my team. Kenya, for example, is a circumcising country. 80% of our males are circumcised. And so the question is, if there is a bleeder, then most likely 80% of these bleeders have gone through a circumciser. And there are two types of circumcisers that I know. You're either going for a traditional process or you're going to a medical specialist for circumcision. So the question was, the medics could pick the bleeder much more easily. What about the traditionalist? Why have we left this traditionalist out? And so we created, a sensitization program for the traditional circumcisers. But for us to do that, we didn't call them traditional circumcisers. We called them traditional surgeons. We changed the designation. And trust you me, we had a whole, the entire hall was packed with the traditional surgeons. And so we communicated to them. We told them the things to look for in bleeders. And trust you me, when we were through with the sessions, we asked them, how many of you may have seen this kind of either patient or family? And we were able to use that information to do a trace back. And we were able to double our number of bleeders, within a very short amount of time. So yes, sometimes we have to be appreciative, even to those that we think are least, because they have the information with you.
And perhaps some last perspectives from my side. What's interesting about healthcare and physicians is it's so complex. So there's a saying in Germany, 2 physicians and 3 opinions. So for example, once I conducted interviews with about 10 different physicians. We asked them about a new technology which we have been developing. And you got the entire range, spectrum of opinions. From where can I buy it, that's awesome, to the opinion of no one ever needs that, forget it, right? And everything in between. So the question is, what is right and what represents the majority? And that's so interesting. So basically, you want to talk most likely to a couple of physicians to get a kind of average understanding of what may be a good product or not.
Thank you. We've pushed the boundaries. I know we have, and I'm sure there's
Thank you.
a lot of watch tapping going on here. It's a fascinating topic. I thank you all for your time. Do we have time for one more question?
Thanks for bringing this wonderful panel discussion. And I want to just understand that when we are agreeing all on the multidisciplinary approach and on integrative medicine, so my question is that if a modern medicine doctor is having some prescription and on the other side there are some traditional and ancient wisdom is coming in recommendation with some few herbs, how the integration and the contraindication interactiveness of these both pathies has been understood, and is it established that we understand that how, if for one concern one physician is giving one medicine, for example for a cardiac patient, one cardiologist is giving some blood thinner, on the other side in the home remedy the client is taking cinnamon also. So both are blood thinner. Do we know the efficiency, interaction and contraindication and how we control it?
Do you want me to take that? So thanks, it's a very good question. Now when physicians prescribe, they prescribe from an evidence-based, and most of the practice is recommended is from an evidence-based, so what is out there. Now when you have a multimodality sort of approach where you have, for example, herbal medicine coming in, you've got Ayurvedic medicine coming in, you've got various different sort of medications or natural supplements that the patient is taking. I think the multidisciplinary approach becomes even more important, because I think what you need to do is you need to sit down with all the stakeholders and you need to sort of come up with a personalized plan for that patient. And that will only happen is when you communicate, when you collaborate, and everyone's on the same page. Because, for example, sometimes in our clinic, we get people coming in, they say, oh, so-and-so has started me on this, so-and-so has started me on this. So if I say, no, stop that, take this, because this is, I think that doesn't work. Because you're creating barriers straight away, and you're alienating your other healthcare professionals. So the best thing to do is say, fine, let's sit down with these healthcare professionals. So you pick up the phone, you have a meeting with them, and you tell them, right, what's your rationale for this? Why have you started this? These are the results and data we've got. We think this works. How can you complement us, or how can we complement you? And when you start thinking in that sort of collaborative sort of format, I think the only one person that benefits is the patient. And that's what you're after. You're after enhancing and empowering the patient. So I think multidisciplinary team approach is probably much more vital now than it has ever been, for that same reasons that you've sort of said, because they come up with different medications, different natural supplements they're on. And the only way to sort of go forward is a joint collaborative approach that can address all of that, and then you will, be able to provide what you want for that patient. And the patient, again, is important because there are certain beliefs, certain preconceptions that they come with. So you cannot discard them. You have to take them on board, and you have to build your treatment plans, your programs, your personalized approach using that facet, because that has a psychological impact on the patient. They know, right, the doctor or the consultant who I'm seeing is taking this on board, which is important to me, not just discarding it. And that helps itself in, improving their outcome, improving their care delivery, them coming back to see you. And if they know everyone that I'm involved with is part of a team that's providing care for me, it's easier for them to sort of, take that on board.
And I think just to add on top of what he has said, because I totally agree with him, I think as doctors, we need to get away from this nice bubble that we've put ourselves in, where you are the know-it-all, and whatever you say, is the ultimate. And try to be accommodative, because culturally we have different practices. People are doing all sorts of things. We should stop being judgmental, because I think that is where we lose it all. We become so judgmental that the patient then doesn't give you sufficient information to make certain decisions. And I actually have a patient right now who has been on different combinations of drugs, and we only realized that this patient was on different combinations other than our usual conventional medicines. He's a diabetic when he went into coma. So, and apparently we had to pull out everything, only to realize that this patient did not even need medication. So, yeah, we all have to be accommodative and try to talk to each other as much as possible. Otherwise, there are no rights or wrongs, in this current, should I say, time.
Yeah.
And just very quickly, we have doctors, psychotherapists, therapists, counsellors that work with us. They are able to support their patients as they heal on different levels. But that's something I'm very happy to discuss further, because we offer facilitator training as well to do it in-house. So I hope that helps and
Yes.
answers your question.
Happy to hear you all, and I would like to add that along with the collaboration and setting the right set of communication, so I will suggest that we should document also the interdisciplinary medicine interactions, and so that we can all go away with more precision.
Yeah, I agree. Thank you.
Yeah, thank you. Thanks.
I don't have a question, but I have a kind of a confession to make. As I was sitting there, I was cringing in pain. While I'm enjoying what you're saying, I'm saying, what an act to follow. I'm doing the keynote next, and I was agonizing, how in the world do I have a fraction of the amazing content and presentation you all had, so thank you. But not being a negative person, I went the positive way, and I said, here's Dr. Carolyn Purvey saying, the value of yoga and holistic cleansing to help our bodies clean themselves and be better people, and that's crux of what I wanted to talk about in my keynote. And here we have Dr. Kibet mentioning medical fraud, which is such a pain in our lives. The most honorable profession. I grew up as a child worshipping doctors as God, teachers as God, and sadly both the professions are corrupt today. And you talked about collaboration between physicians and industry globally, multidiscipline. That is so valuable. Thank you for that. And finally, you said the best medicine is to teach people not to need it. Prevention is better than cure. Thank you for your wisdom. I think everyone here, I speak on behalf of everyone, we are extremely grateful for everything you taught us. Thank you.
Thank you
Thank
so
you very
much.
much. Thanks.
And ladies and gents, let today be the first day of the next day. Innovate, talk to each other, find out what's possible, because I truly believe the impossible is possible. Thank you for your attention. Thank you, gentlemen.
Thank you, everyone.
Thank
Thanks
you.
very much.
Absolutely valuable information. If I can just ask the panelists to take a step to the front of the stage so we can have a picture. Let's give them all another round of applause, ladies and gentlemen. All right, so that was definitely a very powerful opening for our day 3. Very grateful for all the expertise, and I also walked away with some valuable information. Now, our next keynote speaker, he kind of introduced himself, Mr. Krishnan, but I would like to explain what his topic is going to be about, because I think it's something that's, if it's not affecting you right now, it's going to affect you in the future for sure. This is going to be tackling the senior years, making them blissful and the best. So our keynote speaker is also our bronze sponsor from Team Upcore. He's going to share his expertise in creating blissful and fulfilling senior years. This session will explore strategies for staying active, maintaining mental health, fostering meaningful connections, and embracing technology to enhance independence. So whether you are a healthcare provider, a caregiver, or someone planning your own senior years, this session is going to promise some practical tips and inspiring insights. Please welcome to the stage Mr. Alan Krishnan.
As I mentioned earlier, that's a tough act to follow. I'll do my best. Now, the agenda today typically is I want to do an introduction on, I'm sure everyone here in some shape or other is very conscious of your health, and you do everything to stay in good health. And unfortunately, every one of us here, me included, is guaranteed to have a health condition for which there is no cure, there is no treatment, and usually no awareness either. And what I'd like to cover here is how do you prepare to prevent it? And I'm so glad the panelists said prevention beats cure. And I wasn't kidding when I said that's the crux of my program. Now, there are opportunities to be a part of the solution, and I hope to have a few questions and answers from you. And while doing it, we'll cover the final tips and takeaways. As I said, all of you have beautiful lives right now. That's why you're here. And this is something we hope we will continue to have for the rest of our life, and it'll always be there. And we all know hope is wonderful to have, but it's not a strategy. Hoping for something to happen, including buying the lottery ticket, gets us nowhere. And our own health is no different. And we need to do something about it. If I've made any of you nervous, please don't be. Because I'm not here a fear monger. I'm here to be a solution provider. I hope to be a beacon of light, giving you ideas and thoughts on how not to just make your lives better, but the lives of those around you, including some of the folks to whom you owe the most, your parents, your grandparents, and other elders in your family, how you can help them and make them enjoy the years and not suffer it like most of them are. Now, I'm not making idle thoughts. I have a mother who's 94 in January, generally independent, and she suffers from so many problems which are all not in her body, but in her head. And that's again, I take inspiration from our panelists who said that you should be able to cure yourself, stay healthy without medicines and drugs. First, a problem, forget you, forget old parents. Children today, I've seen 12-year-old girls in events I have attended saying the stress they are having and how stressed out they are, almost in tears. And what I shared with her is what I'm sharing with you. I promise you, if you do the serenity prayer, which is what's on the screen, you will forget stress in every aspect of your life. But because I like to say it so often, even though you can read it, I will say it. It's, Lord, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Later in the day, think about it and see, most of your stress comes out of things that didn't happen. And many of those could never happen, but you stress about it. Like, for example, you come to this event, you didn't carry an umbrella with you, and I have been in Dubai before when it's rained cats and dogs. I've been in Egypt where people were slipping and falling. They only have rain 4 days in a year, and one of those was when I was there in Sharm el-Sheikh. Now you can be stressed, oh my God, I don't have an umbrella. What will happen if it rains? What will happen in rain? Nothing, you'll get wet. Don't worry about it. I'm making it simplistic, but most times that's all it is. Most problems we have are not going to change our lives significantly, but we simply panic. And I said, I'm in a room of very smart people. We all know that. And we prioritize everything. Couple of things that we set aside and think we will do it later in life when we have time. And these are key in our lives. And trust me, when you defer it until you have time in your life, like when you're retired, it just will not work, because both of these things are challenging and need to be started from the time you're young and extremely busy putting food on the table. And I want to share something. This was on a t-shirt that a young woman gave it to me. And it says, we make a living by what we get, but we make a life by what we give. And please think about this. It's not just money. It's time. Time is the only resource that is limited. It's limited on the day you're born. It's destined when you're going to die. And therefore, if you give 5 minutes to help somebody, that's priceless. And only you can do it because you have the ability and you're there. And if you have a couple of bucks you can share with them, please do. And you'll be amazed. The good holy book says, it's more blessed to give than to receive. Trust me, there is no greater truth in this world. Now, one of the things we set aside is volunteering time, donating to a good cause, and more. If we do not start giving something to these causes today, you will find it's almost impossible to do it when you're much older and retired, because you're a professional, you're used to certain efficiencies, competences, which you'll almost never find in a non-profit environment. People have expectations, and doesn't matter what you give, they would want something more. So you should know how to deal with disappointments of people, and how not to let that negativity get into your life, because negativity is the one thing that is guaranteed to destroy you. And how do you stay positive when all around you there's negative? Like during COVID, it was crazy. There was more medical fraud during that time than anywhere else. There was false positives simply because it's a money-making machine. Now, if you lose trust in your doctor, how in the world can you live? And that's what was going on. So it's important that we do our volunteer activities. When you're extremely busy, do it 1 day in a week, 1 day in a month, half an hour, it doesn't matter, but do it when time is valuable. The second critical thing in our lives is gratitude and prayer. A lot of people, oh, I'm very busy, I can't do now. Once I'm 60, I'll say all the prayers. It doesn't work that way. You don't need to sit aside for 30 minutes and meditate and pray. No. While you're doing your normal activity, in your mind, thank the good Lord, all the people in your life who have given you something. All of us are high achievers. But let's not be stupid to think we did it all alone. There are hundreds of people in different phases who have impacted our lives, helped us in our lives. It could be a teacher, a mentor, a family member, limitless. Could be a total stranger. Let's think of them. Say thank you in your mind, and you'll find how your life will change. And this has relevance to where I'm headed. Okay, enough beating around the bush. Everyone in this conference and in our lives is guaranteed to suffer a health condition that has no cure. Science has not found a cure. There is no effective medication, and most of us are not even aware of what is waiting for us. What is this health condition? What is the treatment? What is the cure? Okay, is there a cure? I already told you there's no cure. So it might seem redundant why I'm asking this question, but I'm just being provocative. Because one of the joys, two of the joys in my life, the greatest joy is to spend someone else's money. The second one is to be provocative. So we have a good, healthy discussion, and a good friend of mine uses this all the time when we are driving. In the United States, when you drive, the roads are so boring, you'll fall asleep. In fact, a friend of mine once, don't know how we advanced about 200 yards. Both of us are kind of off. So this other friend of mine, when we drive, we argue, we fight. And that is being provocative and keeps us alert, and our driving is safe. The guaranteed health condition is old age. None of us wants to die young. All of us would like to live past our working phase and then do some fun things that we are not able to do in our working ages. But with old age comes loneliness. Being alone in the midst of many. I mentioned my mother. She is very, very fortunate. She is 94 years old in a month. Less than a month, actually. January 5th. She is almost exactly in a month. She is 94. She lives with my older brother and sister-in-law who are amazing children. They give her the best of food, attention. She has a full-time 24/7 attendant to take care of the needs which she has none, but my brother is paranoid about somebody should be there because if I go out for 1 hour and she falls, what will she do, kind of a thing. And she has others helping her, but she is so sad, so unhappy. You wonder, is she mentally something off? No, she's fine. Her sanity is good, her memory is reasonable, everything is fine. But the pangs of loneliness cannot go away. And it comes out of misplaced expectations. Now, do you want to see those suffering this guaranteed health condition? Just look around you to anybody there in your family who is old. Spend some time with them. Introspect what you are doing to help alleviate their condition at any time. What have you done to give them a bright spot in their lives? And most important, ponder for a moment. The older people in our lives are very fortunate and blessed. We are there. When we get to that condition, think for a moment, who will be there to alleviate your condition? Chances are nobody. Many of us have left our parents and run away. I ran away to Africa. I was there for a few years. And then I ran away to the United States. And my parents were alone. And at least we keep going. This is my 4th visit to India, and I'm coming back again in the end of this month. That's 5 visits in 1 year. I don't have expectations like that from my children, even though they live in the same country. And let's be honest, even if they come, I'm not sure what they can do to help me. Probably not much. So let's realize one thing. We have to find our solutions to make our lives better. So, what can we do from now to prevent this terrible health condition? And I will use the words of a very famous president of the United States. Yes, we can. Let's live with hope. Let's act on it, and we'll make things happen. We'll change the world. First, as I said, live beyond yourself. We are human beings. We are the highest form of all life. None of us has to be a Superman or a Superman woman. Just being human is super. Now, I have to confess, this is not necessarily my original statement. Somebody very illustrious has stated it. Some of you might have heard it. Now, every form of life, plants included, work, find or make food, they consume it, they excrete, they sleep, and repeat this the next day until they die. Are we not capable of doing more than this? I like to think we are, and I know we are capable of doing more. So first is start giving today. Time and money. How much you give is not relevant. Just experience the joy and benefits and the blessings of giving. Spend a few minutes with somebody who can benefit from it. It can be a child, old person, neighbor, staff member, it doesn't matter. Do something. You're in this hotel, it's got great staff. When you see any of them, just thank them for the great work they're doing. So many of them give amazing smiles that brighten our lives. Just tell them their smile brightened your life and it made the workplace better. You'll be amazed how happy they are. Because most of them are assumed to be taken to be like part of the furniture. Why do you need to thank them? They're doing their job, they're getting paid. No. You're thanking them so you will feel better in making contribution in improving the life of another. I mentioned earlier the serenity prayer. Please recite it once a day in the morning when you wake up and once before you sleep. And then do something that helps someone else in an area they need help. Now, this is something you have to be very sensitive and cautious because a lot of people think they're helping you, but actually they are agonizing you, aggravating you, and you want to say, can't you just shut up? I don't need this. And you have to control yourself not to say that because you're trying to be polite, which will cause its own stress and other factors in your life. So you don't be a cause for that. You be sure that you tell them, help them only what they need. Another thing I would strongly emphasize is think about and practice what Rotarians world over talk about. Rotary is one of the oldest community service clubs in the world. Every country in the world has it. And they live by the four-way test of everything we think, say, or do. First, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? If the answer to any of these questions is no, please reconsider whether you have to do it. If the answer is a resounding yes, jump for it and do it. You will really change your world and the environment around you. Now, there's one very, very critical reality, which is mindful living is critical in our lives. It does not happen automatically. It has to be practiced. And again, I'm so glad our panelists before me spoke about meditation, yoga, and allied practices. That's the first step. It's promoted a lot these days, and that is really a true blessing for us. I hesitate to say, but I believe yoga is practiced more in the United States than in India. Because they recognize the value and they jump at it with a passion. In India, it's more people who are enlightened, spiritual-minded, educated who go into it. But there is things beyond yoga and meditation. There are forces like chakras. We have that from our abdomen to our head. We have aura and more. That require advanced, specialized help and a device to manage frequencies and energy in our life. Some of these are genetic and inherited from your parents or grandparents. So you don't pay the price for just your crimes and deficiencies. Your life, our life, is impacted by our ancestry, our parents, and some of these transform from one generation to the other. Negativity should be removed from your life. Positivity should overflow every moment of your life. Now, how do you do this? One of the ways you can is, and one of our panelists was from Germany, which is truly validating, is in Germany there's a company called Healy, and they've made a little device. I have it here. It's really, really little, tiny. But what it can do is amazing. my colleagues who are there in my counter at the team up table can sit with you for 2 minutes, take a picture of your eye, scan it, put it through the system, and send you a detailed report on how your body is at present and what areas you need to focus on. And how you can do it is something you can learn more. And this is a true success story. It's in hundreds, thousands, tens of thousands of homes and people. And it's in, I believe, 150 countries or something like that. And it's made in Germany. It's US FDA cleared, European CEII, CDSCO cleared, approved. So this is truly something that is good. You may reach out to me at any time if you want more information. My colleague Lena Roy is right here in the first, and she can give you my card. I will have my information, but if you don't want to write it down or don't have enough time, you can get the card, reach out to me, and I'll do everything I can to help you. Now you have options. Practice these principles wherever you live today, doing the things you do to put food on the table and enjoy everything you do. As you grow older, prepare to move into a multi-family, multi-generation community, which is my fancy word for an apartment complex, except that it's designed by me. And here what you'd have, in my vision, a third of it will be older people, a third of it will be young professionals, like many of us here, and a third of it will be community workers like school teachers, policemen, firemen, clerical staff of the government who cannot afford to live in the community they work in. We need them amidst us. So I want to provide them subsidized housing where they'll pay maybe half the market rent for the apartments, but they'll be able to live. And incidentally, many of them being young will have little children who will come back from school and provide the older people an opportunity to spend time with younger people, help them do homework, prepare for something, advise them on something else, teach them a skill. And the best medicine you can have is working with younger people. I have probably 3 times, 4 times as many friends, much younger than I am, than friends who are around my age. And I think that's the secret of my strength. So the one request I would make, and please forgive me, it's a little presumptuous, please forgive me, please do not move into a traditional senior living facility or community. For a simple reason, it's most wonderful. I know people 55, 60, oh my God, I don't have to pay my electricity bill, I don't have to sweep, I don't have to shovel the snow. These are things many of you may not experience because you live in communities where you have others who do it for you. But I live in a community where most of it I have to do myself. And what I see, they forget. What's fun at 65 is torture at 85. Every day you see somebody going out to a hospital care, they come back or don't come back, and every day you're reminded, when is it my number? Just thinking when it's your number will depress you and impact your health adversely. Now, if the right community does not exist where you live, please start one. It's very much economic, commercially viable project, and I'll help you to do that. When you decide to do something, get in touch with me, and I'll help make things happen, just the way you want to. Now, there are investment options. If you wish, you can participate in what we are building in the United States. It's incredibly commercially viable. I'll make a personal confession. My net worth today is completely of money on which I've not paid a penny in taxes. Whatever I earned, whatever I paid taxes, all blown in my life, educating 2 children through college and private universities. I have no money from my employment. All the money I have is only from investment on which I have not paid 1 penny in taxes, not 1 red cent, and when I die, my children will inherit it without 1 red cent. That's because of the American tax system. If I sell the property today, I'll pay hundreds of thousands of dollars in capital gains. But when I die, my children will inherit at market price and they won't pay a penny in taxes. So these are strategies which are good for people in the United States. Other countries, we have to find other options. So thank you very much. Please ask any questions you may have. The screen has my contact information. If you can see it, you can write it down. or take a picture now that cameras do everything. And if you want a hard copy, my colleague Lena is here. She'll get that from you. So we have a few minutes for questions. And once again, I want to express my gratitude to the panel because they really, really set the foundation for what I was talking about. And that is providential. And in my life, everything is providential. So thank you. Any questions?
I really enjoyed that, your early message, and this is why collaboration is important. I'd like to ask you a question. What's old age?
Sorry, could you repeat that?
What age is old age?
That is a priceless question. And the answer is very, very, very simple. It's in your head. If you're 14 years old, 40 is old age. I know young people, oh my God, I'm 30, I'm now old. Most of you probably can't guess how old I am. And I can tell you 20 years from now, I'll still not be old age. I think I'll still be young. And I hate to say this, but my energy level today is about twice that of my children. And I say that not because of my being energetic, but because it's such a sorrow. If my children at half my age or have half my energy, God save them when they come to my age. If they're lucky, they'll die before they get as old as I am. That's the hope.
Thank you. And as a yoga teacher, I say you're only as old as your spine feels. I guess when it comes to age and what I do, you can strip away your years. If I was to say I should have retired, 15 years ago? I'm running marathons when I don't run. Because, like I said, all things are possible. But collaboration can do wonders for the human race. And you mentioned loneliness. Why do we get lonely? Because we're not happy in here. And we can find that happiness. When we're happy with ourselves, do you know, we enjoy our own company. And I just share that as an observation because I think, you know, what we were seeing, it's simple, it's true. And I really enjoyed it. Thank you.
Thank you, Doctor. You brought out something very profound and very important, something I didn't mention. Those of you who have an Indian culture or Indian friend, they are firm believers of rebirth and the curse of being rebirth again and again. And most people say, oh God, please save me from the cycle of birth and death. I just want to go and come to your lotus feet. My prayer is, please God, don't take me to your lotus feet. I'm enjoying life too much. I want to be reborn again and again and again so I can continue to enjoy my life and doing good in the society.
My name is Sanjay Ghotikar from India. And first of all, let me thank you, Mr. Alan Krishnan, for being here all the way from US and giving us so much wisdom. I know you, a few years back, you recently celebrated the 10th anniversary of your 16th birthday, so I know your age.
He's giving away my secrets, but it's okay.
Okay. I have one question. See, this is a common challenge everybody has to go through if they live long enough. Why nobody thinks about this? I always tell people, nutrition being my core business, I always tell that aging is natural, aging healthy is optional. Why people don't spend their energies on staying healthy? What is your take on that, please?
Amazing question. One word, conditioning. Again, I go back to our amazing panelists who said, hey, we are doctors. We are trained to take care of people. We are not trained to innovate. In all my education, I didn't have one chapter, one class on how to innovate. And coming from the US, where I've been in many hospitals with different patients, including my wife who had leukemia, and I was there for several weeks over a period of time, They follow protocol, which means A, B, C, D, E, F, shut up, just do it. Don't think. So there would be people who walk into the hospital, they'll put a disposable gown, put disposable gloves, stand 5 feet from my wife, talk to her, walk out. Before they leave, strip the gloves, strip the gown, put it in the trash, and walk out. I would cry at the amount of plastic going out there. Now, I was with her, and we have a toilet, and then I wouldn't use it because it's patient hygiene and so on. So what I would do is I would strip my gloves, keep it inside, strip my gown, keep it inside, and walk out without anything, and come back and put this back on. And they thought I was crazy. If any of you do me the honor of visiting me in the United States, I'll show you the amount of hospital supplies in my house. Because when we vacate the room, everything is pushed into the trash. So instead of throwing it in the trash, I would take it home sometime, somewhere I can use it. The most painful to me was this. One of the nurses came in, checked my wife's heart, all good, took the stethoscope and put it in the trash can. Hey, what's going on? She threw a stethoscope in the trash can. You know what her answer was? Oh, that's a disposable stethoscope. I never use it a second time. You're touching a patient through the clothing. In the worst case, you can apply something to sanitize it, but no, they throw it. But due to this paranoia on hygiene, the United States provides the healthiest hospital environment where hardly anybody catches infections. You know, in the rest of the world, your hospital room is a pit full of infection, and you're almost guaranteed to come out with more than what you went in, with a new disease or some infection. So it's conditioning. We are not conditioned to, hey, old age, come on. Old age for you old guys, not for me, I'm still young, is the mindset.
So thank you, so nice of you, and I always remember one of my mentors saying, a man is not known by how many years he lived on this planet, he is known by how many lives has changed because he lived. And I know you would be touching million lives. Proud of you.
You're very kind, thank you, sir. Still have 49 seconds if you have any other questions. And if there aren't, I thank you for your patient hearing. It's very inspirational to see all of you, and I was looking, most of you seem to be not falling asleep. So I'm glad that I was able to keep you and hold your attention. And I do look forward to speaking with some of you, all of you, or any of your friends who might be interested. And those of you who are smiling, truly you're brightening this world, and I have to thank you. It's very inspirational and keeps me going, and that's what really keeps going me by the smiles that I see. And I would, before I leave, say one word of thanks to the entire team of CXO 2.0. They are fantastic. They are so thorough. They remind you, prompt you, follow me, follow up with you to do things. So I'm very, very grateful for all they did, and it's such an honor to be here amidst you. Thank you. Enjoy your life and make a difference every day. Thank you.
Thank you, Alan. That was really an enlightening session. And thank you for reminding us that aging can be a beautiful thing. Thank you.
And you control your head, you will never be old. I can assure you, I will die young. I'll die as a teenager, guaranteed.
I love that. Thank you so much, sir. Thank you. You can just drop it. Isn't he a delight? Yes, he's a delight. Everyone, I think so far, day 3 has been the best. From our first panel discussion to Mr. Alan Krishnan, I think everyone it's feeling a little emotional. Yeah, it's hitting inside, which is exactly where we want to be. Yes or yes? You see, no is not an option. Yeah. All right. So, ladies and gentlemen, it is time to bring on our next keynote speaker. And if Mr. Allen thought that was a tough act to follow after that, I think you've got also quite a tough act to follow. So, in an age where we are constantly connected. It's easy to feel overwhelmed by the digital world. But how can we find balance without completely disconnecting? Now, families are coming up with really cool ways. You know, I don't know if you've seen the boxes that they put on the dinner table. Everyone, throw your phones in the box. You're not allowed to touch it. Kids go a little bit crazy because they have screen dependency syndrome, and we constantly blinded by screens. So the next speaker and the next topic is going to cover things of how we can disconnect without completely disconnecting. And it's called Balanced Living in a Hyper-Connected World, Mastering Digital Habits with Moderation. So with that, whether it's setting boundaries, leveraging technology for good, or simply just taking a digital detox. This session is packed with actionable advice for navigating today's digital landscape. Please put your hands together for our speaker, Shrihari Prahalad, founder of Spry Solutions.
Hi everyone, thanks for coming over. I appreciate that. Just as I was about to start, there's a technical glitch. My clicker wouldn't work. Welcome to reality. A lot of amazing discussions here today. I got to meet a lot of amazing people today. The topic I'm going to talk about is going to be, does it work now? Okay. All right. The topic I'm going to talk is pretty heavy. Before I start the topic, I'd like to take my phone and put it away. And I'm doing this as a demonstration of how you could do that as well. Captain, your phone. So how you could do it as well. So that means you're also paying attention to me. And that also means you're not insulting my intelligence. Yeah? So I'm going to take my phone. Put it inside the box. And I am timing it to 25 minutes is what they have given me. And I tap, and the phone gets locked for the next 25 minutes. There you go. The only way I can take this phone out is to break this box. All right, so now that I am free from the phone, now let's have some conversations about digital habits. How many of you think that you are addicted to the phone? All of you. Okay, you just made my job easy. Except all the ladies here. None of you are addicted. One of you is seeing the phone. I understand that. That's all right. That's all right. But you ain't addicted, are you? No. All right. So by the end of this talk, I'm going to prove that you're all addicted. All right? Okay. Digital habits are seeping into our lives in a very subtle manner. And I'm here to talk about how it is seeping into our lives. And what can we do about it? The first step is to recognize that it is seeping into our lives. So I'll take some examples of what digital habits actually are, right? Internet browsing, social media, emails, streaming content, right? Gaming, fitness tracking, virtual socializing, messaging apps. This list can go on and on and on and on. Make no mistake, I'm only showing you about 10% of the stuff that we are used to looking at our phones for. This list is pretty long, and it doesn't take long for those 10 hours that you're awake and your mind is active. You give away 6 to 8 hours to these screens, right? This is a nice graphic here which talks about how couples met from 1930 all the way to 2024. And I want you to notice something right on top there. So their families and friends was about the only connection point that we had back in those days where you would have met your wife or your husband, your previous wife or your previous husband, the current wife or the current husband, whichever phase you are in your lives, right? It used to be friends and co-workers all along. Now, there is something very interesting that happened as soon as we hit 2005 and 6. A gentleman called Mark Zuckerberg came into existence. And when Mark Zuckerberg came into existence, he had the power of God. And he could turn the whole wheel around like God could do. You know, I've been watching this series called Lucifer. How many of you have seen Lucifer? Okay, there are a few hands. Yeah, I feel like Lucifer. So what he could do, none of us could do. He swapped the whole thing around. Now people, 60% of them meet their companions online. I am not standing here to say that's a bad thing. That's an absolutely good thing. You are meeting people of different cultures, which otherwise you wouldn't have had an opportunity to meet face to face at all. So it's absolutely a good thing. But what is the flip side to it is what I'm here to talk about. Digital habits are creeping in. They are subtly creeping in, but they're definitely creeping in. So what's in play here? What I'm going to talk in the next few minutes are very, very, very compelling insights, and they are profound and have shaped the evolution of Sprian, which is the company I've founded, to try and get children away from their phones and adults equally away from their phones. So the brain is a predicting machine. I'm going to play an audio clip. Could you maybe just raise the volume on my laptop? I think the previous one didn't have enough sound on it. If you can just raise the volume a bit, as soon as I click, it's going to play the clip. It's an audio clip, and I'm going to prove to you that the brain is a predicting machine. When I say the brain is a predicting machine, it's not giving that kind of, it doesn't have that gravity, because all of you think, yeah, brain is a predicting machine, fair enough, right? But I'm going to try and explain to you the gravity of the statement here, which is the foundation of the firm, right? Now just hear closely, if it's possible, for the volumes to go up. Welcome to Sprian. You probably didn't hear a lot. That's because the audio is crappy. So I'm going to move on. Let me move to the next clip here.
It's a bizarre effect. Remember, the only
What do
sound
you
you're
hear?
hearing is bar with a B.
And now?
What's
And now?
remarkable about this illusion is even knowing how it's done doesn't seem to make a difference.
So when he's saying ba, 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 you guys heard ba, right? Right? What are you hearing when it goes back to this part? Ba, right?
It's a bizarre effect.
Now what are you
The
hearing?
only sound you're hearing is bar with a B.
What are you hearing now? Va, va, va. Is that right?
What's remarkable
With a
about this
V,
illusion is
right?
even knowing how it's done.
And what you heard earlier
seem to make a
was
difference.
ba with a B, right? Now, the surprising fact is, it has always been ba. It has never been va. Since you guys are all sitting so far away, I don't know if you can see this, but if you look at the mouth of someone speaking, that's an additional input to your brain. Your brain synthesizes that input in spite of hearing ba, because the brain sees the lips going inward, it assumes and presumes and makes the sound va in its brain, which is non-existent outside of the brain. Now, there's going to be 2-3 statements I'm going to make right now. First of all, the brain is sitting inside your skull, right? Right now, I have so many lights hitting on me. The brain is sitting in a dark place. Do we all understand that? It's sitting in a dark place. If you open the skull right now, there is no floodlight there. There's no stadium, there's no stage, nobody is performing, right? Nobody is talking on stage. But how is it that all these lights that we see here is perceived by a brain? Because the brain is constantly predicting what is the next thing that is going to happen to it based off of the inputs that it gets, even though the inputs outside are completely the opposite, just like the ba versus the va. They don't exist outside, but your brain predicts. Now, it not only predicts just what it hears, now here's the best part. It predicts emotions. Now let us say we hear a big bang right now. As I'm talking, there is a big bang outside. Okay? What do you think it could be? Just take guesses. Sorry? A gong? The gong? A lightning strike? They dropped a bottle? What else could it be? A car accident? Fair enough. What else could it be? Have you been in a car accident before? Okay. But it's an important point. I'm going to bring that out. What else could it be? Cutlery dropping, absolutely. I haven't heard anybody here say it could be a gunshot. Exactly. Exactly, Krishnan. You don't expect that, right? But could it be a gunshot? It could be. Why aren't you predicting it? Why isn't your brain predicting a gunshot? No, it has a contextual input that you're sitting in Dubai. It does not happen here. Right? That's a contextual input. She went with an accident because she's gone through an accident. If you haven't gone through that experience, your brain doesn't have a way to predict. Now let me move it further. Your brain predicts emotions because if you thought it was a gunshot, you would have fear rising out of your gut right now, which none of us have, even though it could have actually been a gunshot. Right? There is a profound insight here that your brain, the only easy way for your brain to work is to predict what's happening next, including your emotion, including fear, including anxiety, including anything and everything your brain produces in itself. And because it does so, habit creeps in. Now I'm coming to this point. All of you have been to a magician show? No? Yeah, you guys must have seen. The rest of you who haven't seen it, I'm sure you've seen it on YouTube or Instagram, right? Ironically, yeah. So, because I haven't seen a magician show in the recent past at all. Since the time of advent of social media, magicians are out of job. They don't work anymore. They're not getting paid anymore. In this conference, they didn't call a magician to perform, right? But each one of you that spoke here, Krishnan, everybody, are a magician in your own rights, right? Now let me explain. What is so unique about a magician show? Magic. What is unique about magic? Why is it captivating you? Yeah? Right. Absolutely, Sultan. You don't know what is coming next. All of a sudden, a bunny comes out of a cap. Right? All of a sudden, poof, a beautiful lady, scantily dressed, comes out. Right? And all of a sudden, the dress changes. When you're watching a magic show, you want more of it, yes or no? Because there is a sense of awe. There is a sense of something that you're expecting out of the ordinary, right? What is happening when you scroll through Instagram? Sorry? You are expecting something new. Every time you scroll, a new video comes up. What if the video, I don't know of any celebrities to talk about, but what if, by the way, my Instagram account was opened 3 months ago because of my marketing team. Otherwise, I never had one. So I really can't talk to that. But way I see people talk, what if I lose out my favorite character coming up and saying something, right? And there's a name for it. It's called FOMO, fear of missing out. And now I'd like to call FOGO. It's called fear of going out. You know why? Nobody wants to go out of their houses anymore because they have a world in their pocket, right? So the FOGO has to change to JOGO. You need to have a joy of going out. You need to find the joy of meeting people. That is why the digital habits are creeping in. The reason being, it's a literal magic show in your pocket. Every time you swipe, there is something new. Your brain is anticipating something that it is unable to predict that emotion. When your brain cannot predict that emotion, your brain is constantly being filled with dopamine, and all of you think dopamine is good. Yeah? Does anyone know evolutionarily why dopamine came into existence? Evolutionarily. Does anyone know? Any ideas? Sorry? Yeah, but evolutionarily, yes, sir. Which are good for our survival. That was the point that I was looking for. Evolutionarily, dopamine neurotransmitters in your brain is coming out so that it is signaling to the organism that, hey, you have done something that I love. Keep doing more of it. Here's some dopamine. Take it, right? And you do it again, here's some more dopamine. And you do it again, here's some more dopamine. What is the definition of tolerance in addiction? Can anyone tell me about that? Alcoholism, you take a small peg, you feel the high. After 1 month, what happens? You need 2 pegs to feel the same high. Third day, what happens? You need 4 pegs to feel the same high. What really is happening? You're pushing your tolerance limit to a higher and higher level. That is exactly the definition of addiction, right? If you are not getting satisfied with one swipe, you keep swiping over and over again because your tolerance levels is going up. And this is nothing but akin to addiction, right? Oops. So self-reported, so social media proliferation, blah, blah, blah. I don't want to talk a lot about it. These are all the sad stuff, but someone told me put all the sad stuff in the form of statistics, otherwise nobody in the conference will hear you. They will think you're here to sell your company, make money, and therefore you talking to your competition, nobody will talk. I was told a lot of these things, but then I said, all right, let me still include a statistic slide anyway. So 60% of the people admit to being addicted. In this room, I think this number about is right, because a lot of you raised your hands. It should probably be between 60 and 70. The rest of them are just not admitting because you're in a crowd. You don't want people to know that, phone is so important to you. Depression and heavy internet use. There is a very high correlation. I'm going to spend a minute about this. There is a medical concept, again, whatever the DSM manual, is that right? Are there doctors here? Yeah, okay, so you have a DSM manual. So right now, within DSM 6.0, 6.1, whatever the DSM version is, for those of you that don't know, even I don't know about it, it just means that it is a term which goes out there in the United States, and once it goes out there, the rest of the world will say it is a disease. If it doesn't go out there, it can still be a disease, but nobody will do anything about it. No money will be put on it. The rest of the doctors have to fend for themselves. All right. So in DSM, there's a term that's gone in. It's called Facebook depression. So you might be wondering, what has depression got to do with this? Do you know the source of depression? Comparison. Absolutely. Every time you go on the phone and you swipe, what is that self-talk on the back of your mind happening. Be very honest. They have a better life than I do. More likes than I do. They have more friends than I do. Guess what? This guy studied with me. Now he's talking on Health 2.0 conference. Albeit the fact that I might have paid for it. But guess what? What goes out on social media is just the stuff that I want you to know, and I'm trapping you so well in it that all of you fall for it, and you think I have a fantastic life. Come to my house. Right? Okay? Where I'm not wearing the coat. Where, exactly, where I'm not holding my tummy in so tightly so it looks like this in front of all of you. Right? Where I'm able to put up a jean and tuck in and still not let my curls come out because I have the suit to cover it up, but it's all curly behind. Right? So I'm covering, the suit is a good cover for me. Whenever I go to conferences, I love them because I can eat a lot and still cover up how much I've eaten. Workspace digital overload, that is way, way too much. Vacation and stress. A lot of people take vacations now, not because they want to, but because in social media, the friend went there. Now I need to go there. That's a fantastic destination. All of you have been posting about Dubai. People have come from the US here, right? What are you doing? You're creating a FOMO to your friends back home. Oh, I came to Dubai, conference was a swish. But guess what? I went to Burj Khalifa. And then you have so many photographs of that, right? And the more and more you post that, why are you posting this stuff? Really? Why are you posting this stuff? Let's bring some seriousness to the conversation. Why? Is it to boost yourself, Krishnan? Any other answers? Playing catch up with whom? Lucifer? Your peers. So you are putting, so it is a response to the comparison in your brain. Absolutely. The only reason we want our private lives to go public is because we want someone else out there to say, wow, this guy is beautiful, right? Nobody puts a social media post of them crying, or nobody puts a social media of somebody insulting them, or nobody puts a social media where I'm standing here and talking and half of the seats are empty in front of me. But am I going to project that? I'm not going to project that. No, because the camera there is projecting me live, but it's not showing who's sitting in front of me, right? For all I care, I might be talking to chairs. I was just telling Sultan about it, yeah? But my motivation as a speaker comes from you guys who are willing to listen, right? All right, so why is it important now at this day and age? Just a couple of slides and I'm done. It's important now because for my age, though Alan told that age is in the brain, what you think, but nevertheless, there seems to be time passing. If I consider all of the passage of time, there are 2 or 3 different categories of people. So we have the lost generation. Lost generation are dead and gone. These are the mummies in the pyramids, yeah? Then we have interbellum, the greatest generation. I don't know why they call that the greatest generation, maybe because they suffered the most. Then comes the silent generation. They call them the silent generation, maybe because that was a World War time. There was so much of noise. And then there's baby boomer and Gen X and Gen Y. So I am somewhere in Gen Y, Gen X and Y. So I'm a cusp, right? And then comes a very interesting generation called Gen Z. And there is also a very interesting generation called Gen Alpha. And I'm so happy to find one Gen Alpha in my crowd. I want all of you to give him a round of applause. Thanks for coming by to listen to this talk, right? Gen Z and Gen Alpha, they are called digital natives. And it's important to draw out this distinction because in Gen X and Y, we were brought up with what I like to call play-based learning. We would go out and we would play. When you play, there are numerous aspects of behaviorism that falls into play properly. For example, I don't know, a lot of you might not know cricket, but that's what I played when I was a kid because I'm from India. If you were from the States, you would have played, what, football or baseball? There's one more sport where you hit each other up like really bad. What was that? American football? Yeah, whatever. Yeah, so while I played cricket, you know what used to happen? I always liked to bat because you want to whack the ball away. It's like baseball, right? Now, when I try to take batting, I get out. I will never give the bat to anybody else. Even though I get out, I will bulldoze people. I'll bully my way through. I will keep the bat going. I will say, this is mine. I'm not going out, blah, 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 blah. Similarly, like me, there were other people who would do the same thing. What did I learn in the process? I learned negotiation. I learned bullying. Very important skill. I learned how to get my way done, which is helping me now to run companies. All right? I learned the art of influencing people because when I'm a fielder, I would always like to be the fielder closer to the batsman. If somebody puts me way out in the boundary, I wouldn't go because I know I am far away from the batsman, which means I can't run from there and take my turn again. Which means I influence, particularly my girlfriends back then, I would influence them and say, you know what, you're supporting the sport. Why don't you stand there, far away, and when the ball comes there, you can pick it, right? And that's called influencing skills, right? And a lot of these, it's important to try and name them, by the way, yeah? And that's why it's important to understand how digital natives are. They are coming up with something called as screen-based learning. It is not play-based learning, it is screen-based learning. And when there is screen-based learning in play, none of these come out to the fore. You are so easily going online and saying, oh my God, you're fat. It doesn't matter. You can actually make that statement as a comment because nothing's going to happen to you. You are not realizing what is happening to the other person because you're not even seeing him. But if, oh, by the way, my box just opened up, which means my timer is done. All right. So you're not even seeing the emotions of the other person. When you don't see the emotions of the other person, that means you don't let your emotions play out. And if you don't let your emotions play out, there is no learning in the process at all. I still am debating why it's called screen-based learning. It must be called screen-based pastime. You're passing your time until you age, to a point where you have to meet Krishnan for investments. All right. So, unfortunately, another point I want to touch before I call it off is, we don't have role models. We did a study with about 600 schools back in India, spread across different categories, rural, urban, all kinds of schools. Met up with over 1,500 students, got an NGO to do this work, and asked all the students, why do you go to the phones? And majority of them came up with a surprising answer. When I go back home, everybody's on the phone. If someone tells me, how can I live life without being on the phone, maybe I can try it out. And we asked the kids, what about your parents? Well, they're on phones. The father is on the phone while eating. The mother is watching YouTube and preparing food, by the way, because her favorite cook came up with a new recipe, right? So now what? So the kid is sitting there wondering what to do. Most of the time, the parents goes out to partying. The kid is given the phone, and I call it a digital babysitter. Because you hand off a screen to the child keeps quiet. That is sad. Okay? And it couldn't get any more serious than this. We are coming up with a generation for which we're going to have to build many more healthcare conferences like this because all these kids are going to fall sick pretty soon in their lives because they just are not aware of what it means to get out there and be there, whether it is mental sickness or physical sickness, either ways, right? Every time I talk about this topic and I show the detox box to people and I put the phone inside, there's always laughter around me. And I like it. Yesterday I was telling this to someone that when we laugh, we don't do anything about it. Somehow, we don't do much about it because we laugh it off, right? So that gentleman corrected me and he said, no, this is not laughter out of joy. This is the laughter out of my nervousness and anxiety. That, my God, this is so true. What am I supposed to do, right? I have a lot more to talk about. I have very little time. Spryan is the booth. We are right outside here. You can come and meet me. There are lots of products that we can show you how to break this habit and how you could try to live life beyond screens. In fact, I should change the motto after this conference. I should be saying, leave screens because there is life. Something like that, yeah. All right, so I'm just gonna take 2 minutes for questions, if that's all right. Anybody has any questions? You can ask without the mic. You don't have to walk up there, Christian, and just ask me. Unless you want to be on social media, all right.
Well, I'm a loudmouth, but not loud enough for everyone to hear, because I believe my question is relevant.
Okay.
We attributed credit to Mark Zuckerberg for 61% social media, Facebook, dating, etc. I see teenagers, 20-year-olds,
yeah,
out in a fancy restaurant, and both of them are looking at the phone. Why couldn't they just do a take-out and eat it at home and not waste their money? You come to a restaurant, enjoy the ambience, the culture, compliment the staff, which I often, oh my God, your smile made the food taste better.
Yeah.
Which it really does, because
Yeah.
my attitude goes up.
Yes.
They just look at the stupid bloody phone, forgive
Yes.
my language, and eat like how those parents were doing in front of their child.
Yeah.
So, thank you, sir. That was amazing, that parents not being a role model.
Yeah.
And I think that's the greatest tragedy of today.
More than, to just add on to that, Mr. Krishnan, a lot of people that we're talking today with, they bring their child. We work with NIMHANS, we work with a lot of clinics on this. They bring their child. The problem is never with the child. The problem is with the parent. So we started the firm to help children get away from screen time, and now we are ending up with helping adults get away from screen time. Because that's the only way the child is going to learn. Child never learns by telling him what to do, but you got to show him. Unfortunately, that's the case. And to your point of restaurants and all of that, Mr. Wood spoke to us about something similar, where you could put these detox boxes in restaurants and get people to put their phones inside and give them a discount.
That's an awesome idea. And you talked about this. Dogs.
Yeah.
I don't know how many of you have trained dogs? The dog is never trained. You are trained on how to work with the dog.
Absolutely.
That's what we are reducing with our children.
I love that. With your permission, I'm going to use that for my next talk.
Yes, sir.
Yeah.
And you said, are you from Bangalore?
Yes.
Confession, I lived close to Bangalore. I studied in Bangalore, the Institute of Management. He said NIMHANS, which is a very, very important institution. It's National Institute for Mental Health.
Yes. And
NIMHANS.
sciences.
And sciences.
Yeah.
That is more desperately needed today than ever before, because I see 11, 12-year-old children saying how stressed out and depressed they are.
Yeah. And they get those words from social media.
Yes, sir.
Yeah. Yeah, go ahead, Sultan.
Okay, hello, ladies and gentlemen. Thank you, Mr. Thank you, Mr. Shri, for this presentation. I have a question which is related, I think, to all of us. So, you know, there is a problem in children because of the clip thinking. Yeah. You know, they are scrolling TikTok, they're scrolling Reels, yeah. And there is a problem of memorization because they don't.
Oh yeah.
They cannot memorize things.
Yeah.
And this is, I think, the huge problem in education.
Yes.
Actually. And is there maybe any way
Yeah.
how to be a good learner
Yeah.
with like very small memory, you know?
So
How we can help our children, our maybe little brothers, sisters,
yeah.
in
So
education.
we are a sum total of all the memories that our brain makes. We are nothing but memories. If someone comes and takes away my memory, Sri Hari doesn't exist anymore. Right? It's so true.
Yeah.
Because that's the only thing that keeps us going, right? So there is no way you can learn if you can't memorize. That's a short answer.
Okay.
Yeah, you cannot. You just cannot. Because you can't put everything up in a diary and suddenly lose the diary, and then what? You lost internet connection, and then what? It's like the Legend movie where everything goes down, a single man is alive. Could you build a car? Okay, let's not talk about a car. Could you build a fan? Okay, let's not even talk about the fan. Do you know how a lock works in the door?
Yeah. No.
Do you know how the key works? Do you know what the ridges in the key means? Do you know why every key has... We're going far, far away, and we are embracing professions that are far, far away from fundamental sciences today. Far away. I even heard radio jockey is a profession. I thought it was a hobby. And then I met a gentleman in an event the other day. Oh, this is my full-time job. Oh, I was shocked. I said, I thought you guys are just doing it for a year and then, you finish your college studies and do something else. No. He even alluded to me there is a certification in radio jockey. I'm not, with no offense, guys. Sorry. I didn't mean, if there are radio jockeys here, I just don't mean any offense at all. But all that I'm trying to prove and say is things that are getting glorified today, we need to change the subject of glorification. We need to glorify people that are standing up and doing the right thing for themselves, not for social media. It's a tough ask.
Okay, thanks.
Thanks a lot. Yeah, Heather. Yeah. 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 Yes. Yeah. So the only thing that has seemed to work, Heather, is starting things at home. I don't have a better answer for this. We've dealt with so many corporates. You cannot make them not do something at office and go back home constantly sitting on the phone. Just doesn't work. It's Dr. Jekyll and Mr. Hyde. So you're promoting dual personalities, which again, some doctor will be very glad to treat later. But end of the day, we cannot have two personalities at all. So all that corporates are trying to do is to prove a point for just those 6 to 8 hours the employees spend the time with them. But in return, the guys go back to phones so much when they go back home because they couldn't see it at office. So it's a fundamental thing. We're always asking people to change it from home. Start the activity from home. The detox box works miracles. There are 4 times in the day when you accumulate screen time. Before you go to sleep, after you get up from sleep, when you're literally crapping. How many of you take the phone into the bathrooms? Yeah, okay, all of you do. It is bad. It is terribly bad. On an average, you are increasing your crapping time by 60% because you're waiting for the next scroll. Yeah. Yeah, absolutely. You're right. Just for those of you that didn't hear, Krishnan said the crap you read makes the real crapping worse. Yeah. So, and some doctor told me about RA issues because of extended periods of sitting in the commode, and those RA issues are coming because these people are watching the phones. So they are keen to respond one by one. Yes. Yeah.
I'm sorry I missed the beginning of your talk because I had an interview, but I'm glad I caught the key messages at the end.
Yeah.
And for my own message, this is why collaborations are important. And what you're saying here, we say in our business, where are the role models?
Yeah.
The role models teaching the children how to manage their stress and anxiety, which incidentally is fueled by the telephones.
Yes.
Who buys the telephone? The parents. And we've seen it many a time in restaurants, all sitting around the table, and I say, where's the social interaction going on here? Right? They don't know how to socialize. You're absolutely right.
Yeah.
But if we're going to change the world for the children, adults have to stand up
Yes.
and look in the mirror and say, what am I doing
Yeah.
to inspire my child or the children I teach
Yes.
how to live their best life? Because become antisocial with the phone.
Yeah.
How do mum and dad deal with their stress? They get angry, they throw their fists around, they swear.
Yes.
They switch off from the rest of the world. They drink, they eat, they take drugs. We've seen it all. And so I think it's a fantastic mission that you are on.
Yep.
And I hope we can talk about collaborating because the children need us
Yes.
more than they ever did.
Yep. And I'm actually starting in a very, very small way, because the last 3 years have taught me that adults won't listen. I mean, right now, I have people on the phones right now, right? It is never gonna work for them. Because somehow their rational brain wakes up to defend themselves. Their rational brain doesn't wake up to understand the problem, but it wakes up to defend themselves, to say, hey, if I don't look at the phone, maybe a patient will die. Come on. It's never happened before. It's never going to happen now. But anyway, coming to that point, what we're trying to start is a very small objective of saying that we want 1 million people to keep their phones outside their bedroom. That's a start. So I'm just going to launch a website and get people to pledge to that and say, guys, keep your phones outside your bedroom, because yesterday also we were talking about the importance of sleep. And you are completely taking away the quality of sleep when you're on the screen before going to sleep, and you get back on the screen just right after you wake up. And even worse, charging it right next to your head.
Absolutely. And, you know, it's breaking the mold.
Yeah.
And absolutely, there are ears switched off.
Yeah.
And we all need to open our minds and think about the next generation.
Yes.
And become an inspiration for the next generation.
Absolutely.
By leading with example.
I love that.
Thank you.
Love that. Thanks a lot. Yeah. Yes. 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 Yeah. No watches anymore, yeah? Yeah. Yeah. It's a computer. Mm-hmm. Yeah. Correct. Yeah. I agree. I agree. There was once upon a time, there was a toy invented by the Chinese. It was called, whatever it was called. The toy would talk to you. Yeah. Yeah. Yeah, get it. Yeah. Yes,
Hi.
Captain.
Hi.
We'll do the last one and I'll pass it on. Yeah.
Yeah. Morning, Shrihari. I must compliment. I think everyone would join me in giving you congratulations to you on a brilliant, brilliant talk.
Thank you.
Thank you very much for that. Thank you. So my question is, as far as social media, etc. is concerned, why does it appeal to us? Is very vividly brought out by Yuval Noah Harari in his book, Homo Sapiens, where he talks about this concept of objective and subjective realities and mass communication, etc., like social media coming in at intersubjective realities.
Yes.
So no matter what you do, there is a significant amount of appeal there.
Yes.
That's definitely there. So there's going to be a pull.
Yes.
I personally feel that if you only address the problem of not accessing it, the pull continues to remain.
Yes.
That's one thing. And another thing I want to relate to this is something like the concept of global warming.
Yeah.
You know, in the early
Oh, yeah.
1900s, when petrochemicals were discovered and cars went out, and nobody bothered about global warming till 2010 probably,
Yeah.
till the first Rio conference, 110-year past.
Yeah.
It was staring us in the eye, but nobody bothered about it. But here, when it's affecting the next generation much, much more that is ever going to affect us, the problem is going to be that much more snowballing,
Yes.
a lot more magnified.
Yes.
So I personally feel great companies, private companies like yours who are coming to this space can do a great thing.
Yeah.
But I personally feel there has to be regulatory compliance and frameworks
Absolutely.
as far as uploading content on social media is concerned. Because as of now, if you start regulating it, it becomes a problem against free speech.
Yes. Yes, you're right.
So governments have to be, we have to now make a movement where governments have to probably non-incentivize a part of the portion of content that is being uploaded on these documents, on these websites, and therefore, over the long term, reduce the exposure towards it.
Absolutely, absolutely, Captain. I think the policy changes are quite essential. This is the sad truth is, everywhere I go, I'm alone. I don't get support.
I know.
Because the person that's supposed to support is on the phone. So it is the reality of the day. But I'm doing what I can to raise awareness.
I think you're doing a brilliant work.
And that's it.
Really, really good work. Thanks
Thanks a lot. Thanks a lot.
Continue doing good work.
Yeah,
Thanks.
will do. Will do. All right. So the organizers are going to beat me up. Thanks a lot. I appreciate your time. I'm going to take my phone away with the box. Thank you very much.
Thank you, Sahari. Definitely a conversation that can continue forever and ever and ever, because everyone's got their own opinions about social media and how young the kids should start. You know, I think another question for the parents is, at what age do I let my kid have a social media account, right? Because you just don't know how to keep the kid happy because their friends have it. You know, it's just something that's going to continue forever and ever and ever. But now it is time for our recognition session, the part that everyone's been waiting for. Yeah. So for this recognition session, I'm going to invite Paul Bacano, the Global Channel Marketing Manager at Instructure, to come to the stage and help me hand out these awards. Paul, are you in the room? Paul? Paul's not here? He's here? There he is. All right. So, if you are receiving an award, if I can ask you to make your way to the left side of the stage, collect your award, take your picture, and you can exit on the right side of the stage. Hi, Paul. How are you? Yeah, very good. Yes. All right. So all I'm going to ask you to do is stand in the center. You're going to be, your cheeks are going to start hurting after all the photos. All right, so for our first award for the day for excellence in healthcare, I would like to invite Amita Vyas to the stage. Amita is the CMD and co-founder of APAC Gen Technologies, has built from ideation to creation. She is a born leader, visionary, and passionate person who has left no stone unturned to lead EPIA national and international fronts. Thank you so much. Up next for our Health 2.0 Conference Excellence in Healthcare Award, I'd like to invite Amitabh Vartak to the stage. Amitabh is an Executive Vice President at Fusion CX. Amitabh, are you here? No? We'll skip over that. Maybe he's gone to the bathroom. For the next award for excellence in healthcare, I'd like to invite Dr. Heinrich Zimmermann. Dr. Zimmermann is the CEO and senior scientist and coach at Zimmermann Research GmbH, combining insights from psychology, music, neuroscience, and mathematics to develop new approaches to stress regulation. He has also invented a system for sonifying biological rhythms.
Thank you very much for this incredible honor. Receiving this award motivates me greatly to continue to push the borders of my work. My mission is to further develop a system, an ecosystem for the regulation of stress. In this innovative system, audio signals and light effects are used to synchronize bodily rhythms, like the beating of the heart, breathing, as well as brain waves. And also physical movements, like from the walking to the dancing to the shivering even. And this will help to regulate the stress in a person. This is not only important for one person, but for the whole society. And I think that stress regulation is an essential pillar for overall health and well-being. Thank you very much.
I think we could all do with a little stress relief. We'll never say no to that. For our next award for the Health 2.0 Conference, Excellence in Healthcare, I'd like to invite John Mulder to the stage. John is the CEO of Diagnostics, is a seasoned marketer with a penchant for innovation and in healthcare. With a diverse background spanning across various industries, he brings a wealth of experience to his role. His passion for leveraging cutting-edge technologies to revolutionize diagnostics sets him apart, making him a driving force behind diagnostics success. Thank you so much, John. Up next, for excellence in healthcare, I'd like to invite Karna Schinde. Karna, are you in the room? No, we'll skip over. For our Young Achiever Award, I would like to invite Maria Karina Diane Jalandoni. Maria is a head nurse and head of aesthetics at Sundari Polyclinic. She has 16 years of experience in nursing practice and is a nurse with exemplary experience in dermatology and the aesthetic field. She holds a laser technician license and is a proud international member of OSHI as a safety officer since 2018.
Good afternoon, each and everyone. Is it okay? I actually prepared a speech. First and foremost, I would like to thank you. I'm truly honored and humbled to receive this Young Achiever Award or Leadership Award, to be recognized for my efforts, and especially among such a talented group. It's very inspiring. And also, I would like to say thank you to my family and my mentor, Dr. Cindy Rambo. Thank you for pushing me to be to be me, to accept whatever challenges lies ahead. And I just want to say one more thing. I would say this is a thought to ponder for everyone. Prioritize your mental health. Prioritize your mental well-being. By doing so, you tend to influence, inspire, and spread possibility to people. This is one way of showing your craft and your abilities. Thank you.
Thank you. Congratulations. Up next for our Excellence in Healthcare Award, I'd like to invite Dr. Nazat Ahsan to the stage. Dr. Ahsan is a neurobiologist and an ambassador of the Royal Society of Biology. With a strong background in molecular and cell biology, she has ventured to drive impactful projects in medical diagnostic device development as a scientist in the Quantum Biphotonics division in the Quantum Lease Laboratory LLC, Abu Dhabi. Aiming to revolutionize healthcare and diagnostics and therapy, she's committed to advancing scientific research and promoting community engagement, exemplifying her dedication to improving healthcare outcomes.
Good afternoon, everyone. I stand here in a moment of deep gratitude, and not just gratitude, but it is a moment of reflection where I feel that the recognition which you receive is not just a reflection of your work, but it's a reflection of the shared commitment we have towards advancing to a better and a brighter future. So this recognition is not solely mine. It belongs to the Almighty, my family, my son, sitting over there, and of course the guardian angel, the invisible angel which remains with us, guiding all the way through. So what I believe, for me, research has not always been about data, the science which I am doing. It's about people with whom you connect with compassion. So what I believe is that while doing your work, do not just nourish your own dopamine levels while getting others trapped in a cycle of chronic cortisol. So you have to balance your personal growth with compassion for those around you. And that's how we truly progress towards a brighter future. And that's my message for you all today. Thank you, Health 2.0 Conference, for this incredible honor. And it gives me a renewed purpose. I am receiving this at a point of a career transition, I would say. And while I do not see it as a setback, but I see it as a renewed purpose. And thank you all for giving me this honor. Thank you.
Up next for our Excellence in Healthcare, I'd like to invite Dr. Omar Musa to the stage. Dr. Musa is the MD of OM Med. Through his PhD, he bridges the expertise of Amsterdam UMC with Harvard's Massachusetts General Hospital to set new standards in holistic reconstructive surgery. His work aims to improve healthcare outcomes globally through comprehensive AI-driven care models that can address patients' biopsychosocial needs. Grounded in entrepreneurship, visionary leadership, and interdisciplinary collaboration, he fosters partnerships with creative, lateral thinkers, affirming diversity as a strength.
Thank you. I'm gonna keep this short. I want to thank everyone of the organization by creating this opportunity for all of us as health workers, actually giving us a place where people like us that are giving a lot from our own personal lives to help others get acknowledged. Because I think in the international healthcare world, we don't get acknowledged as a lot of you people actually deserve. Thank you for everyone making this possible, including my teams, of course, over in Harvard, but also in Amsterdam. Thank you.
Congratulations. I think next we need to bring the governments involved in the conferences. All right, up next for our Visionaries Award, I would like to invite Percy Gaswala. Mr. Gaswala is the founder trustee of the Gaswala Visions Foundation, whose mission is to restore vision to the poorest of the poor in 4 states of India since the past 22 years. He has established an alternative sight restoration model where it can be replicated anywhere in India. Percy holds a master's degree in science from the University of Mumbai and the fellowship of International Federation of Eye and Tissue Banks in Baltimore, USA.
Let me ask you something. We enjoy the decor, the lights, the beautiful ambience that we sit in this ballroom. My question is, what if you could not see? What would happen? There are plenty of people back in India who do have a chance to see, but they can't. So that's where our foundation kicks in. We restore vision to the underprivileged, to the abandoned poor in 3 states in India using the alternate sight restoration model. With all this technology and AI and all that kicking in, what we need to remember is empathy. And empathy for fellow human beings where we can make a difference. So this award endorses the fact that you can have alternate models, you can establish them and use it for betterment of society. There are a lot of people I have to thank, my trustees, my interns, my surgeons, my volunteers, but most of all, there are 2 important people sitting in the audience. That is my son and my daughter. And thanks to Health 2.0, it gives me, it's a very humbling experience to receive this award. Thank you so much.
Thank you for all your hard work. Yes, sure, come. We're getting the whole family involved. Up next, we have an Outstanding Organization Award, and this is awarded to PH Diagnostics. PH Diagnostics is a trusted name here in Dubai, offers advanced diagnostic tests with JCI-accredited labs, reliable services, and accurate results, known for innovation and affordability. On behalf of the organization, we have Dr. Hemant Doka, who is the Managing Director, to receive the award. He doesn't want to say anything. He knows his work is amazing. All right, for our next award, Excellence in Healthcare, I would like to invite Prithviraj to the stage. Prithviraj is a certified sleep technologist from the Indian Board of Sleep Medicine and is currently the VP of Business Development at South India's very first private sleep study center. Sleep Med Solutions, it provides diagnostic treatment for the support of people suffering from any sleep disorders. He has more than 15 years of experience handling sleep and respiratory care patients. Just look at her. How is her sleeping? She sleeps? Yes? I mean,
I would like to thank Health 2.0 to identify me for this award. And I have to thank a lot of people to be here. So first of all, I'll thank myself because whenever I have failed, I have bounced back. And this is a startup which again, I have bounced back from the failure which I had done. And second thanks is for my wife. She's always been supportive. And she always been a motivation for me also. And whenever I have failed, she was like standing there and told, no, you can do it and you go ahead. And again, thirdly is my team, which is working a lot, compromising on their sleep. They have been supporting for me in and out, and they're busy out there handling a lot of patients from last 1 week, and I was preparing for this. And lastly, my customers who are very tough. Always they question me and challenge me a lot. So that keeps me again motivating and keep innovatively thinking and address their issues. And again, in India, when it comes to sleep issues, what they do is when they go to sleep, they have a problem. They'll call me up and then ask, this is happening, that is happening. So we keep addressing them, even late night calls, which is actually compromises on our sleep also. So this is how the entire sleep industry works there. And a lot of things I learned from this conference from most of the panelists and here. So we all are working on something like, which is like, see here I see two groups, which is one digitally they are working to enhance the well-being, and the other one is focusing on the well-being of individuals. Like we are trying to target the basics of human beings, like sleeping, physical activity, staying fit, Ayurveda. So these are the very base things we are targeting, and this is a great platform to see most of us being here and taking these awards. Thank you. Thank you.
Our next award is for excellence in healthcare, and I believe she is watching online. So she's not here to physically receive it, but we're still going to give her an applause. This is for Roa Al-Jarahid, lecturer at Saudi Electronic University. Roa is dedicated health informatics lecturer and system analyst with a strong academic and healthcare systems development background. She is passionate about bridging technology and healthcare, specializing in electronic health record systems, system integration projects, and digital health innovation. Her research delves into the impact of digital space on mental health, reflecting her commitment to addressing modern healthcare challenges. Congratulations, Roa. For our next award, Excellence in Healthcare, I'd like to invite Nishan Ali to the stage. Nishan is the CEO and founder of Neurologic AI LLC, a company pioneering AI solutions in healthcare and robotics. With 9 years of experience in data science, including roles at United Health Group and leading startups, he's developed impactful AI and ML products Nishan holds 2 US patents and has been published in a top US health journal. His expertise spans machine learning, computer vision, and scalable AI architectures.
Hi everyone, very good afternoon to all of you. Especially big thank you to Health 2.0 for recognizing us. This not only gives us a lot of confidence, it also encourages us to, do more and step up even further to achieve more in life. A really strong testament to the efforts that our team has already spent, and they have been pushing the boundaries every now and then for us, and really, really thankful to them. And it's been a great honor and privilege standing here, and have been interacting with a lot of you since last few days, and have been a really great experience for me in terms of my own learning, expanding the horizons, and thanks so much again.
Our next award is for Outstanding Organization, and I would like to invite Dr. Kibet Shikuku to come and collect this award. The Nairobi West Hospital has over 30 years of expertise in Nairobi's healthcare sector, is recognized for providing affordable, high-quality healthcare through its 24-hour ultra-modern facility. Upholding the principle healthcare at its best, the hospital's dedicated staff members ensures a safe environment and exceptional care for every patient. I'm going to be keeping Aditya on stage as he will be collecting on behalf of his grandfather for excellence in healthcare. Dr. Sani is the chairman and founder of the Nairobi West Hospital, established level 6B quaternary care hospital over 4 decades ago, transforming healthcare in India. Kenya, not India, Kenya. Sure.
Good afternoon, ladies and gentlemen. It's an honor for me to receive this award on behalf of my grandfather. If I were to describe my grandfather in just 2 words, there would be a selfless visionary. Coming from very humble beginnings, he decided very early on that he wanted a better life, not just for himself and his family, but for everyone around him. Every step of his journey reflects this unwavering commitment to lifting others up. He began his work with nothing more than a small garage, treating patients while my grandmother prepared home-cooked meals for them. From those modest beginnings, he built what is now a cornerstone of our community, a hospital that has touched countless lives. But even as his achievements grew, his focus never shifted from people. My grandfather is the kind of man who would rather sponsor a local football team than buy himself a new car. He would gladly sacrifice his own comfort to make sure the other person is happy, anybody, regardless of who that may be. He never wants anybody to see the hardships he once faced, and he tries his best to make sure that doesn't happen in any way he can. What truly sets him apart is this unwavering willingness to help anyone and everyone, whether it's a member of his staff, a neighbor, or even a complete stranger with a noble cause, like someone wanting to build a school but lacking the necessary funds. My grandfather has always been there. His door has never been closed to those in need. He will always make time for you. No matter the person, their background, or their circumstances, if they come to him for help, he will find a way to support them. His generosity and kindness are not bound by obligation, but by a deep-rooted desire to make a positive difference in the lives of others. For our family, he is so much more than that. He is the cornerstone. For his children, he has built a foundation from which they can see a world that he could only dream of. For his grandchildren, including myself, he has been more than a role model. He has been a friend that you can turn to when you're feeling down, a friend who offers unwavering support during the hardest times. When answers seem out of reach and the weights of the world feels unbearable, he is a friend like no other. His wisdom and guidance transcend material wealth, wisdom that no amount of money could buy, and that I believe we could not get anywhere else. His life is a shining example of what it means to live with purpose, generosity, and unwavering determination. He has shown us that true greatness is not in what you acquire, but in what you give, and in how you inspire others to do the same. So on behalf of all of us, thank you for everything, Nanu. We love you deeply and are forever grateful for the life you've built for us and so many others. Thank you.
Thank you. I guess because this afternoon we've received 2 awards, one for the hospital and one for our chairman. And on behalf of the hospital and the entire fraternity, mine is to thank the organizers of Health 2.0 for giving us recognition for the kind of work that we do. And I believe that this achievement is because of the leadership that we have. Our chairman, our senior leadership, and the entire staff of the Nairobi West Hospital has determined to take leadership in the region so that we can provide care, not just to Kenyans, but the people within the region, and we believe that our success shall transcend to support and change humanity. Thank you.
Congratulations again, gentlemen. Keep up the amazing work that you do. Up next for our Excellence in Healthcare Award, I'd like to invite Valerie Melcha to the stage. Valerie is a health nutritionist, chef, CEO, and co-founder of Sailing to Wellness. Valerie founded the organization to combine health and well-being with nature's serenity. As a manager and certified nutritionist, she's passionate about educating others on the power of good food and the benefits to the body. You're welcome.
Now, I just wanted to thank you so much for the recognition. And yeah, I always wanted to empower people to reconnect to nature, to themselves, and to nourishment that truly nourish your body. And Sailing to Wellness combines the healing power of the sea with mindful activities and local produced food that we prepare on the boat. And with this combination, I really want to have a holistic view of well-being for body and mind. And I think we just heard like 60% say of people that they do not really relieve from stress through traditional vacations. So maybe this is the one that you want to try out. And I do want to say thank you to the whole organization of the Health Conference 2.0 and all of you that I met. And I really, really nice experience meeting all of you and connecting. And yeah, I guess I'm not gonna go home only with business cards here. So thank you.
Sounds lovely. The sea and food. I'm all about it. All right, so for our next award, for the Young Achiever Award, I'd like to invite Yi Ling Chiang to the stage. Yi Ling is the founder and CEO of Be My Side, an online emotional support platform operated by trained listeners, which offers non-judgmental space for people worldwide. She launched the platform at only 19, recognizing the vital need for self-awareness and self-compassion, often overlooked by similar services. Her mission is to spread compassion by encouraging safe emotional expression and and fostering new perspectives.
Thank you to PIO Conference for this incredible honor. I couldn't achieve this without all of our volunteers, support from my team. And today, we have helped over 700 volunteers of these individuals with our remarkable team of 50 volunteers. And this reward truly belongs to our amazing By My Side team. Thank you.
Just wow, and congratulations again. Now, before I hand out the next 3 awards, I'd like to backtrack. Amitba, are you in the room? No, still not. And Karna? No. All right, so for the next 3 awards, because we cannot all run away from our responsibilities and come to a conference, some of us are stuck in other places. So the next 3 award winners will be accepting their awards virtually. And up first is Dr. Ben Sabilala. Dr. Sabilala is a clinical academic supervisor and specialized rehabilitation hospital. From pioneering digital healthcare education to revolutionizing clinical training programs, he has redefined excellence in healthcare leadership. Armed with a doctorate in nursing management and triple master's degree, Ben's innovative approach to have earned him the consecutive recognition as the Filipino Times top healthcare professional and the prestigious IHSAN award. Let's watch a video from Ben.
Good day, distinguished guests, colleagues, and friends. It's both an honor and a humbling experience to be here as a recipient of the Health 2.0 Conference Excellence in Healthcare Award. To be recognized among such an esteemed group of healthcare professionals and organizations is truly a privilege. This award is not only a recognition of my work, but a reflection of the incredible support I've received throughout my journey. For the past 16 years, I have been deeply committed to clinical education and training. As a clinical academic supervisor, I have had the privilege of guiding countless healthcare professionals, sharing my knowledge and experiences, and learning from them in return. Education has always been my passion, because it is the cornerstone of progress in healthcare. But it's not just about knowledge. It's about translating that knowledge into clinical practice and improving patient outcomes. Every piece of learning, every certification, every piece of advice shared has one ultimate goal: to make healthcare safer, more efficient, and more compassionate for those we serve. I regret that I am unable to accept this prestigious award in person, as I'm currently engaged in a speaking engagement here in Brussels, Belgium. However, I am deeply grateful for this recognition and for the opportunity to address you virtually. While I cannot be there physically, my heart is with you all as I share in this incredible moment of recognition. I believe that education is transformative. It empowers individuals to reach their full potential, whether they are nurses, doctors, or healthcare administrators. Through education, we can create an environment where innovation thrives, where decisions are made with confidence, and where each patient receives the best possible care. As we look to the future, let us remember that healthcare is not just about technology, systems, or protocols. It's about the people. It's about the patients we serve, the teams we work with, and the communities we build. Let's continue to be the lifelong learners, pushing the limits of what we know and working together to deliver the best possible outcomes. Thank you once again for this incredible recognition. I am truly grateful and excited for what lies ahead.
Our next award is for excellence in healthcare, and this is awarded to Kamal Shabalat. Mr. Kamal is the trauma-informed coach at Effortless Effective Coaching LLC. He's a passionate and highly skilled EMCC and ICF certified MCC coach with extensive experience in mentoring, coach supervision, trauma-informed coaching, family relationship coaching, and business leadership coaching. Mr. Kamal is dedicated to empowering individuals, groups, and teams to achieve their full potential by uncovering their why and helping them to move forward with confidence. Let's watch a video.
Hey, my name is Kamal Shabalu. I'm part of the Effortless Effectiveness Coaching Organization, and I am deeply honored and humbled to accept the awards for the contribution of the organizations in terms of helping people's well-being and mental well-being, if it's couples, if it's first responders, if it's educational providers, or the protectors of countries. It is my honor to support them, and I'm deeply humbled to accept this award for supporting them. Our work will ever and forever be expanding, and I hope to be there for everybody for all individuals and organizations that are working towards investing in humanity and building humanity and success in so many different ways. Thank you again. Thank you for the organizations of the health conference as well. I appreciate every one of you. You guys supported me so much. And I know I've created a family and brothers through this experience. Thank you.
He seems lovely. I would have loved to meet him. And our final award is for excellence in healthcare, and this time it is awarded to Vidit Atul Panse. Vidit is an accomplished clinic director and physical therapist at ATI Physical Therapy. With over 7 years of experience, he's recognized for his outstanding contributions at clinic management and patient care. Again, we have a video.
Hello everyone, my name is Vidit Fans and I am here in the United States working with ATI Physical Therapy. Our aim and motto is to make every life an active life. My apologies, could not be there in person, but hope everyone is having a ball of a time and enjoying the conference. Lastly, thank you Health 2.0 for this wonderful award. Wouldn't have been possible without the support of my beautiful wife and my lovely kids. Also, big congratulations to all the awardees, and everyone have a great day, happy holidays, and happy New Year.
Let's give him a round of applause. All right, and finally, I'd like to thank Paul for helping hand out the awards. And of course, if I can ask all of my award winners to please make your way to the stage for a group picture. So everybody who has an award, please come up to the stage. In awkward silence. There we go, yay! Yes, bring your family. Once again, a big congratulations to all of our awardees. Oh, we want one more? Yeah, sure, why not? 10 more. It's all right. And I'm going to say thank you for all your dedication that inspires us to push boundaries and continue striving for a future where healthcare is accessible, equitable, and innovative. Congratulations once again, everybody. All right, everyone, I think the other awardees got a bit hungry because it is lunchtime. So we are going to have a break for lunch. So please make sure at lunch, sit with someone that you haven't connected with yet. Make sure that you are making a new connection today. I know it's day 3 and we all know each other by now, but go find that one person who's shied away and just ask them, how are they? How do they feel about the conference? Did they win an award? Yeah? All right, so we'll be back here at around 1:30, all right, for a 1:40 sharp start. So enjoy your lunch, and I will see you in a bit. Hello, hello, it's me again. And everyone got lost coming back. But that's okay. So I hope everyone had a great lunch. The food today and every day, it's been really good. We kind of get lost in it, especially the desserts and stuff. Always nice little treats. All right, so we are going to be starting the afternoon session with a fireside chat. And this topic is going to tackle navigating trends in ortho. What is on the horizon? We'll be looking at emerging technologies and regenerative medicine, all of which are revolutionizing how orthopedic care is delivered. Now, our speakers will also touch on the challenges of making these advancements accessible to all. So please welcoming back to the stage two gentlemen, Dr. Fahad Attar and Dr. Omar Musa.
Hello, everyone. Thanks for being here. Omar, do you want to start off, or?
Thank you, everyone. Of course. First of all, my name is Dr. Omar Musa. I was born in Egypt, raised in Amsterdam, got my MD from Amsterdam, and then just 1 year ago I moved to Boston, MGH of Harvard, where now I'm currently doing my PhD in focusing on the reconstructive surgery in holistic approach. Please.
Hi, I'm Fahad Attar, orthopedic surgeon by profession, and also CEO and co-founder of We Healthify, and CEO and co-founder of Regenesis Orthobiologics. So we concentrate on regenerative orthopedics and precision health provision, and we're currently set up in the UK, and we're looking to expand to the Middle East and the GCC. Thank you.
So what we wanted to do today is actually make it a little bit more engaging, since of course it's the last day and everyone wants to enjoy everything of this last part of this wonderful conference. So we would like to encourage everyone that's here to actually ask any questions or that has any notes to come up to the microphone in between, to make it a little bit more dynamic for everyone and to keep it in a more comprehensive perspective with all of your experiences and insights, and hopefully make this as fun as possible. So what we wanted to do, Fahad, we wanted not to specialize and go into the weeds with everything that we focus on in orthopedics. What we wanted to do together is actually bring it a little bit more alive by bringing other insights to our specialization while we go through the process of the caregiving pathway. So that would mean we start with everyone that also does screening or also does something in predictive models, go through diagnostics, whatever any comments or insights people have can of course add, and then end with not only treatment but also the part of like the vision on the horizon and where we want to go with not only orthopedics but also with the caregiving professions that you guys would hope to share with us. If that sounds okay?
Yeah, I think that sounds like a good plan. And just to reiterate as well, anything as we're going through, if someone has any questions, just get onto the mic or raise your hand, and we can have sort of a lively interaction as we go along. I think that'll be good.
Perfect. So, I was looking forward for a long time for this. You have so much experience and so many things that we can all learn from. Please, could you tell us something about the first stage, when someone comes, or even before they come? What is your current practice doing for them, and how are you seeing it evolving?
Sure, it's an interesting question and a very broad one. So I'll sort of break that down into what we used to do and how it's changed to what we're doing or what we're recommending clinicians and physicians to sort of do. I think a lot of the time, most people get focused on the disease and on the condition, And every time a patient walks into clinic, either to see us or any other physician for that matter, you get very tunnel visioned on what you're trying to achieve, what you're trying to treat. And although you've probably got a lot of experience and a background in treating and approaching that, you tend to focus only on that aspect, just the one aspect. But I think what has changed now is when we actually see people coming in, we know they've got a specific complaint, specific condition, specific problem they're coming in with, but we tend to sort of look at a little bit more of the broader picture. So we've got some treatment options that we know will help that specific problem, but what we actually do as well is to try and realize that there's lots of different facets that are contributing to that problem, and there's a lot of different modalities of treatment that'll help what we're trying to address and what we're trying to achieve. So from that perspective, we don't just look at the problem now. What we actually do is look at the patient as a whole. So they get seen by the specialist, they get seen by a nutritionist, they get seen by the physio, they get a full analytics done on their initial investigations, they have a genetic screening program, they've got a biological age test done, and all this information that we gather from all these different areas helps us streamline a personalized plan for that patient. Because if we just concentrate on one disease, one condition that they walk in with, you may be able to get them 70% there, but you're losing out that 30% of the periphery that you're really concentrating and you need. So now with this approach, what we're recommending is we can look at a full 360-degree view of the patient, what's missing, what's lacking, what they need, what we need to supplement, how we're going to address them, what personnel we need, what MDT approach we need, and we sort of tie all that together. So at the end of the day, what we're doing is working with like-minded clinicians, like-minded specialists in various different facets and modalities to help the patient.
That sounds great, because what is happening in the same time from a care provider as a physician's standpoint, what we're trying to do, and we've been trying to do that for ages, is see a patient in a holistic, comprehensive approach. The thing is that normally it would take so long and it would take so many different facets to first go through before you can actually go and assess the patient themselves in clinic. But before COVID, and we talked over that this morning, before COVID, that just didn't seem feasible. It was something that wasn't possible, actually, in this world, where we have gone through a digitizing kind of revolution, and now all these things are possible just by everyone getting acquainted by it, getting tests done before they actually see a doctor and everything beyond that. So at this point, how I also see it is we all are having the tools that we can actually use to go through a very efficient and effective kind of way, using that 360 approach and all that data that comes with it, streamline it just like you said in a funnel, which all could take 5 minutes. And that is thing where, of course, we are enabled now by things in great digital revolution, where Niels there would like to ask a question because he knows way more about this than me. Can we get a microphone, please?
Test, test. Yeah, okay, thank you. I was actually wondering, you talk about a 360-degree view on the patient's life. Are there any certified or tested models that you guys use to get the same conversation going with every new patient? Or is it more like a way of feeling how the conversation with the patient is going and then adapting to what they're explaining?
So that's a good question. And I think every time a patient comes in, what we're now training our staff and all our sort of receptionists and even secretaries now is to try and do a generic screening form where they don't just get asked about an initial problem that they're presenting with, but they get asked a few questions about, not detailed history, but a few questions about various different aspects of their health, what they're doing, health status, their height, weight, BMI, because that then starts putting in our mind a program for them who they at least need to see. So we have about 3 or 4 touch points for them then when they come in to see the relevant people based on the initial questionnaire. Now, based on those initial investigations or initial consultations that they have, we may realize that there may be 1 or 2 more things that we need to do, or 2 more tests we need to do, and then we that sort of tie that in. The other thing we try and do is have a in-house all services incorporated sort of setup, because what we don't want is to people to keep coming in and out, going to 10 different places to get the same thing done. So we're working very hard with and collaborating with various different sort of specialties and clinicians to have an in-house service. So when we know that these patients are coming in, we have those facilities available in-house. So they come in, they spend about 2 hours, get seen, get the investigations done, get the tests done, and then, you know, they go. And then they come back for a follow-up again when we have all the results and reports and a personalized plan for them. Just to sort of expand that question, is if we've got sort of a protocol set which is more globally followed, answer to that is no, because I think this is still in its infancy. And I think a lot more people trying to get into this approach and trying to do some studies and data publishing will help that. So at least you get some sort of generic pathways, and you think if they're coming with this condition, these are the barrage of consultations and tests you need, and with these results, these are the investigations you need. So at the moment, we're not yet reached that stage from lots of sort of sectors, and even I speak to my colleagues in the US who are in this sort of regenerative field, and everyone seems to be doing something from their own perspective. But I think the focus is to try and get a general sort of provision, if you like, from a diagnostic perspective and treatment perspective for certain patients, and profiling certain patients and also conditions.
Yeah, exactly. And in the Netherlands, we've just started to use the model of Machteld Hubert, which we've also talked about in our presentation. And it kind of enlightens, I believe, 6 dimensions within a patient's health. And it helps clinicians like yourself focus on certain areas within the patient's like complete being, so to say. But it's good to hear that you're working on that.
Let me go into depth. Exactly what you're talking about in US, how we use this in my current practice in the US. In MGH in Boston, I'm working in a kind of multidisciplinary team that is called the Interdisciplinary Network of Amputees, where we have a specified multidisciplinary team who has every team member that should be in there for all the lower extremity kind of patients. When a patient comes in, before any consultation, assessment, whatever has been done, they go through all the specified team members, and they all just put in their part based on the Huberman or like Huber dimensions that were before of the WHO. And it was actually published, I think, in 2011. It was like way before, but until now, it's a miracle that a lot of people are still not putting it into practice. Where a lot of other places are, of course, I'm very proud of the Netherlands doing so, but at the same time, we should be collaborating more. While, of course, WHO should be one of the top leading organizations leading this, we are actually focused, and my thesis currently is focused on setting more benchmarks like these, more criteria to actually first define what we're doing in our centers, then make that more universal to the other similar centers, which is also like through survey studies that I'm doing and all those other things, then set some benchmarks nationally, go internationally back to Amsterdam for my instance, and then also with, of course, all these centers there to have one general universal definition, benchmark, where we can all put our great minds together and think about the best possible outcomes that we should collect, but also see how we actually should put our interventions for those specified kind of problems these people have. And at that moment, we can also even try to translate it to the less abundant kind of places where you can try to translate the models that you create to more socially vulnerable patients. So we're also doing a lot of studies where the insurance is not the greatest in the US, and people have more social vulnerability, which can be objectified in different measures like the area deprivation index, for instance. And when you could take those kind of models, you can actually try to put that in a very less or high, low socioeconomic system, and make the best effective use of those cost savings that you had from higher uptakes in those places, and the same models for the lower ones, and eventually, hopefully, put the models in like the right places over the whole world. But we wouldn't go to like the horizon kind of ideas yet. Thank you for your input.
Yeah,
Oh,
sorry,
no,
just,
thank you both
just
for
to
the
add to that, I think one of the other problems or the hindrance is cost and
Yeah.
accessibility. So even though you've got a good model in place, is trying to put it all together is expensive. And how accessible is it for people from a clinician perspective, specialist perspective, and also from an equipment and service line perspective? So I think that's one of the hindrances when I speak to a lot of people. That's one thing they always come across, say, yeah, we want to do it, but these are the sort of stumbling blocks or roadblocks that we come across.
Yeah, and there's the problem of scalability, because for a few people who are maybe somewhat more wealthy, this shouldn't be a problem. But to enroll it across a mass of people that don't have the funds, then becomes very difficult to have an MDO multidisciplinary team available for those patients. So then you need to rely, I think, more on what the patient itself can do. But very interesting, your answers. Thank you.
Thanks.
Thank you. And not only that, to add upon that, the thing that we should also do is take a very good control of what we're actually doing with AI at this moment. Everyone's talking about it, everyone is using it, but we're not really talking about the injection of data. What are we training our models with right now? Everyone's just individualistically talking to it, using it to their own needs. But what we also should be really careful with are all the specific lower socioeconomic status people who are not having their data assessed, and is eventually creating a very major bias in our models and what we're doing. So I think one of the main things we should be doing is also trying to find those specific needs for these patients and try to get that data from a beginning, or even make it universal from a very starting beginning, to actually try to mitigate that risk of bias. We'll never remove it, like any bias, but at the same time we should be very aware of it, because at this point it could be a very great disaster if we're just trying to see patterns in things where we have only been imputing it with the 10% that is wealthy in this world.
Yeah, I agree actually, because I think data really is king, but you need a good spectrum of data from various different populations and spheres. So obviously, like I said, if we can train them, then you can predict a lot better with overall global data at different levels of social strata rather than just the upper levels, because then it just becomes a service and a provision for the wealthy, which it cannot really translate down to people who need it really.
Exactly. Can you tell me and us a little bit more about how you're currently integrating that in your practice?
So at the moment, what we are doing is collecting, obviously, a lot of investigative data from patients who come in.
Yeah.
And we obviously have models being made either from the companies we're collaborating with who've already got preset databases that we use. And we try and use them at the moment to try and fine-tune predictive modeling. So we try and do something like, if patients come in with this condition, with these risk factors and having this procedure, what are the success rates, what are the disadvantages, what are the risks, how long they're going to stay in hospital, what are the recovery patterns are going to be like. So most of that can be forecasted to a certain degree with the data sets we've already got in place. So we're using that just to give us an indication and to give the patient an indication, to sort of empower them to at least know we've got this information, from us, sort of thing. Now, going forward, what we tend to do is, obviously, as these get built up and everyone is doing it around the world, you can collaborate them and, and you can share data, which I think is going to be the strength with these models. And when you have that scenario where you've got a lot more data that you're sharing, and you've got a lot more data from various different social strata that is being inputted into it to train your model, you get more specific, you get more refined in what information comes out and how you're going to use that information. So that's what our focus is at the moment, is to slowly build and obviously collaborate with like-minded centers, like-minded hospitals who are doing similar sort of things. So we try and get a better, broader perspective.
I think the right word to say that is building systems, or the right way. And that is great to hear. Exactly what we're doing right now in my research is setting those benchmarks, also seeing how we can collaborate more by seeing the different perspectives, but also from different populations, how the differences actually align, and how we can see the discrepancies, but also see things like risk factors. So everyone's talking about, of course, predicting, but even as we all know, in research before AI, we've been building creative and very nice predictive models. Now you can't, of course, call logistic regressions as an AI model, but some people are trying to do that these days. Where at this point, we just have to be really careful about how we're using which tools and actually be more conscious about what the fastest way is to get to the place where we need to be, and not just throw AI to it, but just think about it first. Do we have to sit together, put different perspectives in first, have some kind of institute before we collect data? Or what everyone now is doing, just collecting data and then not really looking on their shoulder, like to their side, and then eventually, of course, getting surprised. Oh no, you're doing something else than I am. Oh no.
Yeah, just to add to that, I think that's important because, yeah, everyone's collecting data, but I think you need to do it, as you said, try and get to a place quicker, but I think also safer.
For sure.
So we need to be there quickly and safely, and each country and each healthcare system has got its own regulations and directives. So again, it's important to make sure that you're aligned from that perspective. But I think at the moment, probably what's happening is a lot of people are collecting a lot of data sets, a lot of data points, a lot of touch points from patients. But what do you do with that data, and how do you process it, and how do you get it out into a format that's going to be understandable to the clinician, to the patient, to the health facility? Exactly. And how are you going to add value? Because all systems now are moving towards value-based healthcare. Now, value clinically wise for the patient, and value from a monetary perspective for the healthcare sphere and healthcare sector and clinics and hospitals. So for a win-win situation, I think you need to have some sort of a regulatory system that when you're collecting the data, what is going to help? Because some of it you may not need, and some of it will be very, very important. Exactly. So you need like systems in place that will track that and that will fine-tune that system. At the moment, I don't think there is. And I think that may be one thing to sort of develop and work on as we go forward.
Exactly. I would actually want to bring up a just recently published paper in JAMA, just last month or a couple of months. It was actually assessed how the efficacy is for a AI without doctors and an AI controlled by a doctor. And what we see is that the difference is actually not superior for the doctor reasoned control group, where it is actually defined now or clarified for that the doctors don't know how to use AI properly. We are not prompting it in the right way, because eventually it's just a weapon. It's two-sided, right? Where when you look back at Japan and you see all those nice samurai swords that we see in movies, you need proper technique to use that sword in an effective way. And that is exactly where we stand now, where everyone is getting like a very nice sharp blade and is just like swinging it against trees, where eventually we need to learn first how to handle it so that we don't cut ourselves. And that is something that's not, I think, at this point very aware or universally understood, where we should try to get more in these steps in the future. But just with my eye on the time, we should, I think, go on to the next treatment decision-making kind of chapter. Is there anyone in the room right now that has any comment or questions that we should speak of? No. Okay. Then going into, I think, the treatment part with also looking towards the future. How are you envisioning what we're currently doing in decision making, and also what we're going to do or should do if we would have done everything that we just spoke of the right way and we can move forward?
So I think decision making involves a lot of different sort of facets. One is obviously information gathering and investigations, which we will have that information from, and using that information to basically make patient-specific plans, because I think the way now is going towards is personalized health, personalized treatments, patient management plans that are specific for the patient, the condition, their background health factors in place. So I think the decision making is going to go more and more in that direction. And I think that is the best way, because I think you do need to involve various different aspects of a patient's health for an overall progress. And this other big sort of buzzword at the moment is longevity, which everyone is trying to sort of, push and say we need all of this. But I look at it more than longevity is more healthy aging. I think healthy aging is probably a better word to use. And once you've seen a patient who's come in and who's had that initial problem sorted out, I think optimizing their health based on other small areas that you've picked up will help that journey towards healthy aging. So you don't just close that chapter there saying, we've sorted you now, off you go. Because there's a few other things that you've picked up. So that's why personalizing the healthcare plans for patients, moving them across this sort of journey for a more holistic way, from a more personalized way, with a healthy sort of aging way, I think is the way forward. And I think that's what is going to be the next focus going ahead.
Putting it in more practical perspective again from clinic, I've been working before with a lot of reconstructive patients, so also burn patients with a lot of trauma, not only physically but also mentally, with sometimes also social vulnerability. And what you see is that you really need a very good, trained, and efficient kind of multidisciplinary team looking at that. What I think will happen also with the decision making and also following these patients in the future, hopefully, when we have the right data set and we can actually screen the right patients out of those patients and getting like more of a 6-dimension idea or profile, as you may call it, of every patient, you can actually adapt the team towards their specific needs. Where currently it's more done in like physician kind of feeling that someone might need something, but we're currently also under a lot of strain where we're all biased. So I would personally believe that if we would have the data making those dimensions for us, the models, we can actually adapt the team, maybe even by automation, making our schedules or whatever, and then we can actually do whatever we want to do with the patient to make them feel better or more or increasing their longevity in the long term. And what I think will happen is hopefully when everyone has this right profile on their phone or anywhere they go, is there whenever you or your body actually needs the specific care you have, let's just say you went through an injury and after you've been helped and treated in a hospital for all your biological kind of problems, you will still have this overcoming moment of mental stress and mental burden that comes after it. And at that point, when you're home and you think you should be healthy and not feel sorry for yourself, not many people will go to a doctor. Where at that point, these systems can actually signal it for the right patients that actually need it and just say, okay, his heart rate increases, which could be aligned with, I don't know, post-traumatic stress disorder. So go back to the doctor just for this specific patient, not 20.
Yeah, I agree with that. I think most of the drive forward will be based on outcomes, and you need to be able to gather these outcomes from patients because, yeah, they'll get over that specific injury treatment and they will have their outcome scores sent across. But if you can monitor them as they go along, you can pick up problems beforehand, preempt them, and intervene. So if they've got like scoring systems in place and outcome scoring systems in place that can do that for you, they can even prompt, like I said, on an app or something like that to say, I think, you need to go see a doctor. This is the time to go and make an appointment. And I think that will help. And again, that's very personalized to the patient, personalized to them and their situation, which again is important.
Yes. And also, if anyone wants to ask any questions, please feel encouraged to come to the microphone again.
It feels like I'm part of the discussion now, but no, what we see is that a lot of nations still pay doctors by the production that they do and not per se the outcome that they realize. So for instance, you get reimbursed by placing a new knee without checking if the patient can actually walk further than he could before. Is that something that you guys take into consideration when you reach out for the outcomes like you just said, Dr. Fahad?
Yeah, I think that's important actually, because outcomes is completely different, and you got to make them more objective and make them more validated. Because when a patient comes in following a procedure, let's say a hip replacement they've had done, you look at the x-ray and we say, x-rays look great, x-rays look fine. You turn around to the patient and say, everything is fine, off you go. With the patient, yeah, I'm still complaining of a little pain, I'm uncomfortable. But you say, well, the x-rays are fine. You know, I think it'll be okay, and off you go. So that's not really objective, and it's not really caught that patient episode properly. So I think if the patient walks in and has done an outcome score to question and say, right, I'm finding difficulty going up and down stairs, this is my score for that, I'm having difficulty getting up from a sitting position, and they're looking at a graph which shows their outcome 6 weeks, 3 months, 1 year, and the clinician can see that and the patient can see that, you can make a more of a conversation with the patient to say, right, yeah, you were doing well for the first 3 months, now you've dipped, so what has changed? What is different? They'll say, oh, I stopped going to physio. You'll go, okay, so that's the problem now. So let's readdress that. So it makes it a little bit more objective, and it also gives the patient the satisfaction that they can track their progress as well. So I think outcomes is very important. And I think the more and more people start using outcomes for decision-making, joint decision-making with the patient is valuable.
And then, can I add one triggering question? Are you willing to make a cut in the pay that you receive if the outcome is not what we had hoped for?
I think it should be. What's value-based healthcare? Value-based healthcare is you get paid for your outcomes. So which means if your outcomes are not where they should be, you shouldn't be paid for that service, or the department shouldn't be paid for that service. It's a bit harsh, singling out a consultant or a physician to, for that.
I didn't mean you specifically.
I hope not. No, but I see what you mean, and I think it should be. It should be value-based driven. So what they say is, if your outcomes are very good, then you will have a supplementary benefit, because obviously what you guys are doing in this department is great and is shown by your outcomes. Because till that happens, we don't know. And also tracking financials to the outcomes is important to say, right, okay, so if you're spending so much money and these are your outcomes, what is the value you've added based on these outcomes? And that's a very important conversation, especially at hospital clinic management levels, because they've got to make a decision on what services they want to continue, what they want to stop, how they want to change, how they want to divert funds. So if you haven't got outcomes, and if you haven't got quantitative data to say what you're doing is adding value and what you're doing is saving money, then it's a very difficult conversation to have.
And I think that actually circles back to exactly what we were talking about before. I know I'm beating it over that horse here, but it's all about benchmarking and setting the universal criteria first, because the PROMs, the patient-reported outcome measures that Dr. Fahad is talking about, right now, currently, when we're talking about the reconstructive patients that I'm working with, we have, I think, maybe 15 PROMs, different kind of outcome measures that we're all trying to use. And every center is using different ones. So what I am currently trying to do is unify that to all using the same ones, and that is just a baby step in starting to do it all on a national level, and then taking it again, bridging over the gaps towards other places where eventually, hopefully, we can gather all those outcome measures, and then start to think about systems where we can use the outcome measures again to make a better place for everyone and help the patients that actually need it most. So to close it off, I would like to make a call to all care providers to also look to their side, to the other people around them, to see what their vision is, what they are using, and hopefully just throw a ball in the air and make some kind of connection to think about what we should use together as a system, so we can all step forward in the right lane together as the system that we are, of course, as human beings. Thank you for your time.
Thank you very much, everyone. Thanks a lot.
Thank you, gentlemen. If I can just ask you to stand up and take a step to the front of the stage to get a picture. To the front of the stage. Yes, exactly. And the lighting. We have to get the lighting just right. I'm sure it can be arranged. Thank you so much, doctors. Thank you. All right, ladies and gentlemen, I hope everyone is feeling okay. I hope everyone is feeling good because the next panel discussion that's going to happen is something that I've been looking forward to. And it's something that we need to bridge in a way that doesn't offend, or I don't know how to put it in other ways, but basically it's bridging modern medicine with traditional medicine. And the topic for today, for the next session, is, are we building bridges between the two, or are we building walls? So this is something that we're going to have 3 experts in their field come and talk about. So everything from herbal remedies to alternative therapies, our panelists will be sharing insights on how we can create more inclusive healthcare system that honors the wisdom of both of these worlds. So I would like to invite Udit Sansangi, Dr. Nathan Bryan, and Dr. Kibet Shikoku. Please put your hands together for our panelists. Udit? There we are.
So let me take this opportunity to welcome all of us to this conversation this afternoon. I'll be the moderator for this conversation, and I think all of us are called upon to make your contributions because it's a relatively interesting discussion. And with me are very able gentlemen coming from different parts of the world to share their experiences. And I'm happy that we are discussing a topic that, in my view, has always been perceived to be a common practice in our setup. And I didn't know that the rest of the world was struggling with it. So I'll let my colleagues introduce themselves very briefly, tell us who they are and what they do, and then we can pick up this conversation. Let me start with Dr. Nathan from my left.
Hi, good afternoon. My name is Dr. Nathan Bryan. I spent 20 years in academia as a professor of molecular medicine. We made a lot of discoveries in the nitric oxide field. And then I turned from academician into serial entrepreneur. Today I'm the founder, chairman, and CEO of Bryan Therapeutics. And we're a clinical stage biotechnology company that's involved in novel drug discovery, specifically focused on nitric oxide. Nitric oxide's it's a gaseous signaling molecule. It's a vasodilator, regulates blood flow, mobilizes stem cells. And so our claim to fame is we've made a solid dose form of nitric oxide gas that we're developing as novel therapeutics. We've got drug programs in ischemic heart disease, really overcoming the tolerance of organic nitrates, the cornerstone therapy. We've got a drug for Alzheimer's, which really gets to the root cause of Alzheimer's, which is low blood flow, cerebral apathy or atrophy, inflammation, oxidative stress, and immune dysfunction, and insulin resistance. And fortunately, nitric oxide corrects all of those. And then we make a topical product for non-healing wounds, diabetic ulcers. Nitric oxide's antibacterial, kills the infection in a non-healing wound, and then causes a hyperemic response to induce tissue granulation and wound closure. But a lot of my time in academia, we were uncovering the mechanism of action of many traditional Chinese medicines and some Ayurvedic. But the reason that has never penetrated the US market is because the one drug, one target model doesn't work for traditional medicines. It's the synergy of the different extracts and components in there that provide the therapeutic benefit. But we know these are time tested, they've stood the test of time. They're not only safe, but they're very effective. So if we could figure out what the mechanism is, or one of many mechanisms, then we could gain more insight and more properly dose and advise patients on not just dosing, but interactions with other medications. So I'm happy to be here.
Thank you, Dr. Nathan. And I think that will be the gist. You know, dealing with medications or drugs that in our view are either unregulated, unrefined, nobody seems to know what the dosing should look like, and yet we still use them. So this will be a very good conversation to have this afternoon. And to my right is Mr. Odit. Possibly you can pick it up from there.
Thanks, Dr. Kibet. Good afternoon, everyone. My name is Udit, and I'm a functional medicine health coach from Mumbai, India. I think I'm at a very enviable position with respect to this topic over here because functional medicine is a branch of medicine which actually picks off where East and West converge. So the lens that we use in functional medicine is pretty much of the Eastern sciences of root cause medicine, which we can give examples of in Ayurveda, traditional Chinese medicine, where we try to go below the symptoms and understand why the dysfunction is actually taking place. And we absolutely use the modalities of the West. We use drugs when required. We use high-end diagnostics. We use GI maps, which is a gastrointestinal map, and we use everything from CGMs, which are continuous glucose monitors, to really a high-end organic acid test as well. So I do feel that I'm pretty much at the convergence of modern medicine with traditional medicine, and I'm a strong believer that our paths must and should converge to provide maximum value to the people. I'll pick up from the last panel discussion where Dr. Musa kind of ended off with that we need to look to our left and to our right and see what the other person is doing and how we can contribute to what the other person is doing and bring them together to increase and improve patient outcomes, to make it a better place for all of us. So I think collaboration and convergence is the way forward, and I see a lot of modern medicine and traditional medicine in my country in top-end hospitals coming together, and I'm looking forward to discussing this with the both of you.
Thank you, Mr. Odit. And I think the question is, where is the convergence? Is there room, first of all, to even consider traditional medicine? And I think for me, coming from Africa, it takes me back during my early days as a young doctor when I was requested by one of my professors to be seconded to a facility, a herbal clinic, that was actually, providing what we thought were herbs, only to realize that they were actually combining herbs with modern medicine. And so the question was, what out of these two, or which out of these two, is actually providing cure? And that was a question that none of us could answer. But there was a difference between the kind of patients that we were seeing visiting this particular facility and those that were visiting our routine hospitals. We were seeing patients trickling from our routine hospitals to these herbal clinics. So the question is, where did we go wrong? Or where have we gone wrong? Is that something that we need to rethink? Where should the convergence be? And I think just coming back to Dr. Nathan, being a cardiologist, looking at various products, I don't know what your experience is and why do we fight traditional medicine? Is there any reason why we fight traditional medicine? Or why are we, a lot of time spend time criticizing traditional medicine? Is there something that we aren't doing right?
I think so. I think once you understand, and spending 20 years in academia and training future physicians, you realize that, at least in the US medical system, I think we do a good job of teaching the basic sciences, the physiology, the biochemistry, the pathology. But then it's never translated into patient care. And the epiphany for me was that medicine is a business. Medicine is not the altruism of what's best for the patient as it was 100 years ago. And remember, the number one rule of business is never lose a customer. And when you've got traditional natural medicines that you can get over the counter that aren't patentable, and it takes away from the market share and actually get patients off of prescription drugs, then it impedes upon the market of the big pharma and big business. So it's a threat, it's an imminent threat to big pharma and the business of medicine. And And I think that's been the disconnect. We have to get back to root cause, which I think is a consensus theme here at this conference, because our body's never missing a synthetic compound that inhibits cholesterol synthesis, a statin. Our body's never missing a synthetic compound that inhibits stomach acid production, PPIs, but yet everybody's on these drugs. And for me, understanding the biochemistry and physiology of basic chronic disease, including heart disease, it boils down to two things. People get sick for two reasons and two reasons only. The body's missing something that it needs, or it's exposed to something that it doesn't need. So if you detoxify the body, replete missing minerals and nutrients, the body heals itself. And again, we're never missing a synthetic compound that inhibits a biochemical reaction. And if it comes from earth, comes from nature, if it's a natural medicine, then our body can respond to it because it's something that's naturally found in nature and not man-made in a lab.
Wow. So there's quite some serious amount of work to be done because you're competing with big boys and big girls.
Yeah, no, it's been. I mean, those Schopenhauer quote from 400 years ago that fundamental truths are defined by three stages, right? First, they're ridiculed. Secondly, they're violently opposed, and then third, they're accepted as being self-evident. So I've been ridiculed by my academic colleagues. I've been violently opposed by big pharma. But I think the tide's changing, especially in the U.S. with the election last month. American people are fed up with regulations, with big pharma, continuously poisoning the American population with food, with drugs. And I think under this new administration, there's going to be a new way forward with safer medications, more kind of stress on big pharma and making sure that the drugs are, number one, safe, number one, do no harm, but make sure that they're also efficacious.
Okay, so chances are we might also be trying to discuss regulatory issues, the role of various respective administrative structures, and trying to see whether this contributes to either building bridges or, adding more walls to the use of traditional medicine. To you, Mr. Audit, you talked about trying to close the gap, create some level of convergence. You talked about drugs, traditional medicines that you get from China. I don't know, how much exposure you have to other traditional forms of medicines, and what your practice has been while you're coaching, especially, the kind of outcomes that you see, your own experience, and if there's anything that you would like us to share based on your own experience.
Absolutely. I think before I proceed with answering that, I'd really like to laud Dr. Nathan for actually being so vocal against what is actually happening in the United States and most of the world, that big pharma, along with its consortiums with all the politicos, is keeping us on a treadmill of constantly needing drugs to sustain ourselves. Once we get onto the treadmill, it's very difficult to get off. And to speak up, to be vocal about it, I think takes a lot of courage, especially being a medical doctor from conventional medicine himself, from modern medicine, and manufacturing drugs which are with a profit motive. For him to be so vocal and speaking up against these practices and the big pharma, I think takes a lot of courage. So really kudos for that. To answer your question, Dr. Kibet, first of all, let's also define what traditional medicine is. Traditional medicine is herbs, it's supplementations, it's the traditional Chinese medicine which you might get, and it's the Ayurvedic herbal supplementation which you might get. But what else is traditional medicine? Traditional medicine is also, it could be movement. Traditional medicine could also be, something like sound healing, which is medicine, sound medicine. Traditional medicine could also be manipulation of the breath. It could be breath work, which comes again very deeply from yoga and Ayurveda, called pranayam. Traditional medicine could also be, practicing mindfulness, which is a movement which has come out of Buddhism as well. So medicine should not be only seen in terms of herbal supplements or drugs or things that you ingest into your mouth. medicine is also what we receive. What is cosmic nutrition? We get cosmic nutrition through sunlight. It's nutrition. We get nutrition through a good night's sleep. That is a form of nutrition. We get nutrition. We get nutrition through meaningful connections and relationships. That is nutrition. So our traditional methods and traditional medicine didn't only promote ingesting herbs, supplementation, and drugs, but also all these other forms of medicine which are actually so vital. Now, why I think traditional medicine is actually imperative and is, in my 2.5 years of practice, has been very effective in patient outcomes is primarily because it deals with the whole person. Pharma and pharmaceutical drugs often, has a lot of biological changes in the body, and there's a lot of chemical manipulation, whether it's with respect to providing insulin to your body, or whether it's providing statins to your body. But does it really address the person who we're talking about? 10 people have elevated cholesterol levels, you'd probably be giving the same statins to all of them. But are they the same person? Is that the root cause of why the cholesterol levels are elevated? Have we even looked into what they're eating, when they're eating, how they're eating? What is their lifestyle like? What are their stress levels like? What are their relationships like? So, this is what traditional medicine really emphasized. It emphasized, we talk about Ayurveda, for example. It comes from my country. And we have a system of diagnosis in Ayurveda. It is called Nadi Pariksha, which is also known as pulse diagnosis. This requires for the practitioner to go into a state of centeredness before he takes the hand of the patient, and literally diagnoses the patient from the pulse, which gives them not only an idea of what is physically happening in their body, what is happening at deeper levels psychologically, what is happening in the subconscious mind, and even gives you insight about, probably some karmic patterns. This is well documented with Tibetan and Ayurvedic medicine. So we need to start looking at the whole person, which is what holism is all about. I do believe healing happens when we look at the whole person, and that is the advantage that a lot of our traditional medicine methods, whether it's from the Red Indians in North America, whether it's from the plains of Africa, whether it's from China, whether it's from the India, we really need to see and learn from what these civilizations and traditional methods of healing have to offer.
Thank you. This makes this conversation relatively complicated because Udit has ended up, giving a better definition of traditional medicine. It's not just about the herbs. It's not just about the various products that we use. He's added some cultural practices, different types of activities that we undertake to support the body in its healing. And while he was talking about this, I asked myself, what would the younger generation be saying? How would they define the Generation Z? I don't know, I think there was a newer generation. How will they be defining traditional medicine in the near future? And chances are that they'll be looking at the practices that were being utilized previously. Those of us who've lived in this era may be practicing medicine a lot differently from those that will be coming in the near future. And so their definitions will be looking at newer ways of managing conditions. Whether technology, for example, is advancing and moving away from what was traditionally being practiced into possibly newer ways of managing ourselves. So you took me back to relook at what the definition of traditional medicine to a younger generation would look like, and I think chances are that they'll be completely different. But having said that, I wanted to ask Dr. Nathan, what he does especially, with this misunderstanding that traditional medications, for example, or products that we use, either to some have not been validated, they have not been assessed. What are we supposed to do to then create confidence so that, the people we discuss with, the people that we talk to, can believe that there is something in traditional medicines that we use, be they through products that we use or, through the various practices that we undertake? What exactly do we need to do to change this perception, especially to the society?
Well, I think it's necessary. It has to change because in the U.S., at least, 70 to 80% of the U.S. population takes some form of dietary supplements. So, I mean, that's far more than the majority. And it's the wild, wild west in the U.S. There's thousands of companies out there selling thousands or tens of thousands of dietary supplements, and obviously there's a hierarchy of quality. And the cheapest product is typically not the best product, but most Americans shop on price. There are many forms of magnesium supplements, for example. There are hundreds of so-called nitric oxide products, which is a market that I compete with in the consumer division. But none of these products actually do what they're designed to do or say they're going to do. So there's a disconnect between the deceptive marketing and trade practices of the companies and actually what the products are actually delivering. And I think, again, there needs to be, these companies need to be held accountable. And mainly a lot of funding now toward dietary supplements, saying, okay, which form of magnesium is actually the best? Which forms of B vitamins and things like that are the best? And again, I think it comes back to personalized medicine and epigenetic regulation and nutrient deficiencies and personalized medicine, nutrient analysis, micronutrient analysis, and figure out, because my nutrient requirements are probably going to be much different than anybody in here, and our microbiome is completely different. So how we metabolize these products. So I don't know if I have an answer to the question posed, but clearly there's a problem and there's a disconnect. And again, these are for-profit companies that are out there that really have no regard. Most companies have no regard for their end consumer. Just how do I continue to sell them more product?
Wow. So I'm sure the audience, possibly might chime in if they have any inputs. But before we get to, our colleagues in the room, mine to Udit is, you've been coaching. You gave us a testimony that you had some serious medical challenges and you tried modern medicine. You didn't seem to have gotten an outcome. You attempted to use a combination, and I don't know what your experience is. What would be your advice, to either the doctors or the medical fraternity, and how do you think we can work together to possibly, function in a manner that enables all of us to appreciate and understand what we go through?
Thank you for the wonderful question. I think it's a brilliant question, and I think if I had to respond to that in a very succinct and brief manner, I think it's very simply to see the person behind the patient. It's about the human touch. I remember having a conversation with you last afternoon post-lunch, and we talked about what traditional modern medicine was like and what the modern medicine is like today with the intervention of technology and virtual consultations and seeing the patient over a laptop screen or a TV screen. You did mention to me that in your hometown and in your country, how a patient feels they've not even seen a doctor if they've not had a physical examination. So my brief answer is human touch, but I would like to ask you also a question, Dr. Kibet. What do you think my response of the human touch, how important do you actually think it is in the healing story, in the healing process of the patient? And I think this was also addressed last evening in the last panel discussion where, I think someone asked, would you trust an AI doctor who might be smarter than the human doctor? And most people in the room actually said, no, we would not trust an AI doctor. We would prefer a doctor who is less smart, but we have trust and confidence into. So my answer, as I have said, is definitely the most important thing is the human touch and seeing the person behind the patient. I would like to now pose this question to you. What have you seen over the years with respect to decreasing patient-doctor, patient-practitioner interaction and more virtualization?
That question is a double-edged sword. On one end, patients want to be seen physically. A lot of our patients in our setup would like to have a touch of the doctor. And I think there are various reasons why traditionally that has been the case. Because then you're looking at this individual holistically. You are not just looking at the headache that they may be coming with. When you listen to them, you are looking at their body language. There is so much that you are trying to pick from the client. At the point of examining, you are not just examining one specific area, you are looking at various parts of the body. The aching head could just be an indication of something that is further down in the foot. So the role of that physical interaction, touch, makes a whole difference. Vis-a-vis someone who is extremely endowed, with innovation, they can be able to Google things within the fastest time possible. And I was actually seated with one of my young men in the room, and I asked him, how do you remember things? Do you memorize? And he said, no, I don't memorize. I have my phone here. It does the jigs for me. So even for them, when they are prescribing, I remember when I was doing my fellowship in South Africa, a lot of my colleague doctors were not bothered with specific doses. For me, I could remember them offhand. For them, they had to Google and see, what the dosing would look like. Were we practicing the same medicine? I guess the answer was yes. The approaches were a lot different. In my country, if a patient saw you Googling, checking on doses, chances are they are gone, long gone. So, but is that moving away from technology? Of course, there are other technologies and innovations that would add more value. But again, I think just trying to move away from that physical component, I think, is where we all have to reconsider and see in which scenarios should we be physical, when do we go virtual. So as I said again, it's a double-edged sword, but it would have just been nice to know from your end what your thoughts would have been, especially when we are looking at the various components that we use, to support care. As Dr. Nathan mentioned, we have a lot of supplements moving around. We hardly take time to see what the interactions look like between these supplements and the modern medicines that we use. Is there something that we are missing out? Is there something that we are not asking ourselves as regards to the various products that get into our bodies and possibly either make outcomes impossible to achieve? And if you remember Dr. Fahad saying, if through this interaction with a client, you don't achieve an outcome, are you going to release back the monies that you may have taken? Or will you retain the proceeds? So I think this is a conversation that possibly needs to be stretched a little more. And I wanted to ask this question then to my two colleagues. Is there any role that our various governments possibly should participate in ensuring that possibly we relook at traditional aspects of medicine compared to the conventional methods? Because I know people are now moving into highly refined products, highly refined. And I think I was sharing this with the colleagues yesterday that I used to get products that were relatively broader before, and I could kill very many disease entities with one single, drug. But lately, the products are highly refined. I have to struggle running around. And so care is becoming even more difficult and more complicated. I don't know, Dr. Nathan, what your thoughts are as far as the role of our various governments would be as far as traditional medicine is concerned.
I think several decades ago, the National Institutes of Health started a new institute called the Institute of Integrative and Alternative Medicine. Because, again, 70 to 80% of the population has taken this, so there needs to be some rigor into that. So this institute within the NIH actually funds research for alternative and integrative type of therapies. But all you have to do is look at the data. I mean, the data clearly show that, at least in America, Americans aren't getting better. We spend billions of dollars a year on cancer, cardiovascular disease for the past 50, 60 years. And yet cardiovascular disease still remains the #1 killer of men and women worldwide. So that approach doesn't work. There's no arguing that if the model was working, people would get better. And I think we've been misinformed and misguiding, because in the 1980s, it was declared that cholesterol is the enemy, right? And so with the invent of cholesterol-lowering medications, the American Heart Association made a prediction in the late 80s saying, if we can get everybody's cholesterol under control, cardiovascular disease would be eradicated, and the need for percutaneous coronary interventions would go away. And if you look at the data, again, going back to the 80s, from a 6-year period from late 80s to early 90s, there were about 1,700 PCIs in the US. And now over the past 40 years, in 1 year, there are now over 6,000 PCIs. And yet the standard of care is to put everybody on a cholesterol-lowering medication, whether they have normal cholesterol or high cholesterol. So it's the wrong model. It doesn't work. It's a huge economic burden on most world economies in treating patients. But the only people it's good for are the people that are stockholders in the big pharma, because it's a great financial model, but it's the worst model for the inpatient. So I think when it collapses, it's not if it collapses, when this model collapses, there has to be a system to fall back upon. And what's that system? It's the system that's been in place for thousands of years.
Thank you, thank you. Because I know time is really moving, and I would wish that we have also sufficient time for question and answer session. I want to ask Udit, you have tried products, and I'm asking myself, what is it that we are looking for in a traditional product that would make you accept a product? If you came to Africa and I told you, oh, we have this traditional medicine, what would it take you to say, yes, I think I should be able to try this product? Is there anything that you are looking for in particular that would then make you say, go for it? Or would you say, no, let me try this one that has been tested? What is it that you would be seeing in this traditional product that would attract you, towards that particular product?
Thank you for your question. I think, as Dr. Nathan said, one of the greatest instillers of trust in any product is standardization and rigorous testing by accredited bodies in the country or worldwide health bodies, testing and providing standards for the quality of that product. How you have a lot of supplementation, which Americans take, whether it's magnesium, zinc, other forms of supplementation which are required. There are traditional medicines produced in India, in Ayurveda, where the biggest barrier to trust in those medicines is adulteration. And how can that be dealt with? How can that be dealt with? The only way to deal with that is to have accredited bodies, whether of worldwide repute or whether of national repute, to be testing and rigorously providing studies on their safety and efficacy. That is the only way that traditional medicine will be seen at par and with the same amount of trust and faith that you have in your pharma generic drugs. The reason we have so much faith in, as for example, in India, we have a lot of faith in the supplements coming in from the West, not because you have better raw materials, but because your standards of testing and accreditation are way higher than what we have over here, which is why some people are willing to pay the extra buck to get it flown down and to get it shipped all the way to India. But you got to be very careful. So I think what is absolutely key, and where the government needs to get involved with this, the policymakers, is about getting traditional medicine to the fore, but also creating bodies and transparent, reputable bodies testing and standardizing those traditional medicines. Whether it's ashwagandha from Ayurveda, or whether it is magnesium from naturopathy, or whether it's a homeopathy drug from Germany, you need good reputable bodies testing and standardizing them. I think that is absolutely essential, and that will go a long way in bringing I will not say traditional, but integrative medicine into the mainstream.
Wow, quite a bit. And I guess that leaves us with a lot of work to do. And, we are talking about processes here to make this product generally acceptable. And I don't know whether that, by extension, then gives you an outcome that, from a cost perspective, may not be able to compete with the modern medicine. Speculative statement. I don't know, Dr. Nathan, now that you've been using products, traditional in quotes, what is your experience in terms of, let's say, costs in providing this kind of care vis-a-vis use of modern methods? Is there any comparison? Is there any variation? Is it something that we could look into? And if that is the case, what should we do?
Yeah, I think the problem is when, and you mentioned this, when the products begin more refined. When we published our seminal paper in 2009 on the nitric oxide activity of traditional Chinese medicine, we became very famous in China. And I flew to China, and I think I gave 6 lectures over 7 days in 5 different cities. But I went to these pharmaceutical manufacturing facilities, and we took the raw material, like this high brix concentrate of Dan Shin and all these other traditional medicines. And I brought some back with me to the lab, and I tested, and it was it was very potent. But then they gave me the finished product after they got done refining it and putting in a pill form. And there was no activity in that finished product. But yet, that finished product, the cost of manufacturing and all that is more expensive than just getting the natural product. And again, you lose the efficacy because there's synergy. When you do extractions, you lose a lot of the synergistic properties on that. But I think to make money on that and get a finished product, because as you guys know, most of these natural products don't have a very good taste profile. And at least in America, Americans want to take a pill, right? They don't want to change their diet. They don't want to exercise. They want to pop a pill. So it's a consumer demands, but you lose the efficacy of this. So I think you just have to get back to what works. And as there's more rigor put into these products and the finished products and understanding at each process in the step, what are we losing that's contributing to the therapeutic value of that product?
Thank you. So before we open this to our colleagues, I don't know what your parting shots would be, Mr. Udit.
I think my parting thought would be that medicine is not just what you put into your mouth. I think medicine is anything that heals, that makes you whole again. Something which we're implementing in recovery. It could be, it could be pet therapy. It could be singing bowl therapy. It could be supplements. It could be the traditional herbs. It could be a pharmaceutical drug if and when required. And it could be human presence. So we need to really embrace and open our hearts as practitioners and open our minds to other forms of healing while cherishing our own traditional methods and bring them into the fore in a very integrative way. The more we do that, the more they will be in the mainstream, the more standardization there will be with respect to all of these, the more studies there will be on interactions between herbs and drugs, and I think the more safer and better it will be for the end patient. So I think these are my parting thoughts. Don't just view medicine as what you put into your mouth, but medicine is anything that heals.
Thank you, Mr. Udit. Dr. Nathan?
Yeah, I think my parting thoughts would be to go back to the statement I made when we started, that people get sick for 2 reasons and 2 reasons only: nutrient deficiency and exposure to toxins. And people aren't getting better because drug therapy addresses neither one of those. In fact, it contributes to the toxicity because most drugs are toxic. So I think in this era of personalized medicine, we have to do micronutrient analysis, amino acid analysis, and replete to the human body what's missing. And then, like organic acid testing and looking at latent viral infections that become active, or bacterial infections, or detoxify from things that are making the body sick. And again, if you remove the toxins, replete missing nutrients, then the body heals itself. And if you go back several hundred years, that was the basis. Most of these natural products contain vital nutrients, trace minerals, trace nutrients. In the US, since the 1940s to the early 2000s, there's a 78% decline in basic micronutrients in the food grown in America. So we're a nutrient deficient. 95% of Americans are deficient in iodine. 75% are deficient in magnesium, selenium, chromium, all these basic micronutrients that are required for underlying biochemistry. But yet there are symptoms that manifest as a result of that that are being treated by a synthetic compound that treats a response to that deficiency. And biochemically, it makes no sense, but that's the practice of Western medicine. So I think you have to get back and understand the individual patient. Again, that patient in front of you, treat that patient, not the number.
Thank you. And I think I won't take too much time. Mine is just to, mention that I think we are getting into a relatively broad, open conversation that still requires a lot of thinking. But I think the bottom line is that while we think our patients are on medications, they're on more than one particular product. And I think it would just be nice for us to broaden our minds, open our arms, and broaden the conversation so that then we can see how best we can support our patients regardless of whatever product they are on. We have less than a minute, ladies and gentlemen, to bring this conversation to an end, and I wouldn't mind if we could pick a few questions.
Okay, hopefully this will be quick given we've got 1 minute. When I first came to this particular discussion, I thought it was going to be more of an issue of epistemology, where you have different definitions of knowledge and what makes for good knowledge and bad knowledge. But the entire panel seemed to support essentially the scientific method or evidence-based practices, which I guess in a sense is actually quite traditional because it's literally thousands of years old. But as I was listening to you talk, it seems it's maybe more an issue of free market versus what's good for us. Is it perhaps, and I'm not trying to put words in your mouth, I'm actually putting this forward as something to consider, is it perhaps that the free market just isn't that compatible with good societal health?
I think that's certainly the main driver is profitability and not what's best for the end patient or the consumer. But again, I think that has to change because the data are the data and you can't ignore the data. In America, and I think in most westernized, industrialized nations, the general population isn't getting healthier. We're seeing a decline in life expectancy and the quality of life. The health span is certainly declining. In the US, 9 out of 10 Americans are metabolically unfit. That's now a national security issue in the US because most people aren't even fit to serve in the US military. So I think as these growing pressures on the pharmaceutical companies to deliver safe and effective therapies or get back to the root cause and change the way we practice medicine, I think the pressures will force this.
And do you think it is only the pharmaceutical companies? Because I've heard people say it's, they call the term big food. A lot of food producers out there are
no, it's
equally
big food,
guilty.
it's big pharma, it's the payers, it's the insurance company, it's a funnel. And people in that funnel are making an enormous amount of money at the expense of our health.
Gotcha. And so from that, do we think maybe we actually need more regulation to prevent some of these things?
I think there needs to be more oversight. I'm not a big fan of regulations. I'm I guess, capitalist at the end of the day, and I want the freedom to operate my businesses and do what's best for society. I don't need government telling me how to run my business, but I think there has to be oversight and a divorce between politicians and people running big pharma and funding those decisions and legislations in the U.S. And government is a stepping stone to high-paying jobs in pharma. All former FDA officials become multi-million-dollar employees for big pharma, and that's about to stop.
Thank you.
Thank you for that question. Yes.
Hi, Dr. Priyanka. So, as we are discussing here how we can make the traditional medicine to go with the modern medicine, and we have seen that nowadays for the cosmetic products, for example, the hair oils and the skin products are being promoted as per the body type, right? Okay. So, do you think that there is a requirement for the supplements and also for the other functional medicines to be segregated as per the body type? Few people have very cold body, few people have, like in Ayurveda we call it Vata, Pitta, Kapha, and we can mention it like a very cold body, hot body, or very dry body. Okay, so if you have any thoughts on this, please share.
My response in one word is absolutely. I think we are in the age of personalized medicine. To mainstream produce products with body types is one step towards it, but I'm all for it. That is one step closer to personalized medicine. I think that is the direction that we should be all going towards. Yes.
Sure. What you will say?
I would agree too. Everybody's different. You got to look at the Constitution. You got to look at, your metabolic requirements are much different than mine. Men, female, your skin tone, type, color is different. Skincare products have to be personalized. Supplements have to be personalized. Drugs have to be personalized.
So what are the ways are these being taken in the modern technology where we are distributing the kind of like magnesium and zinc? Are there any criterias that this body type shouldn't take it or this body type definitely should take it?
I think the answer comes in testing. I mean, you have to do personalized testing and figure out what exactly is your body missing, what does it need? Because again, these companies are mass marketing. They want to sell everybody their product, whether they need it or not, or whether it's good for them or not. And I think that's where the personalized medicine and nutrition aspects of it and treating you versus treating me. There's not a one-size-fits-all in supplements or drugs.
Yes. So
Yeah. Also, in my experience in functional medicine, when we prescribe supplements, for example, I'll take an example of magnesium. Magnesium is one of the supplements which are very required because of the depletion in the soils over the last 70 years. In USA, also in India, magnesium controls more than 300 enzymatic functions in your body and is responsible for energy production, for relaxation and all of that. So I think personalized medicine is also being practiced right now in at least the circles that I practice in. To give you an example, if a person has IBSD, more tending towards diarrhea, we would not suggest them magnesium citrate. We would probably tell them to go with another form of magnesium, maybe bisglycinate or another one. But it is already in variants of supplements being produced. We're already very aware, like as an Ayurvedic doctor, you would keep certain Ayurvedic herbs away from a certain body type. Like if I'm high in Pitta, you probably will, control the amount of Pitta-causing herbs which you prescribe to me. So I think that we're always already moving towards that, and any step towards more personalization is welcome.
yeah, so we have noticed that in the Vata conditions, the dry conditions, mostly the IBS is very common and it's better to give the probiotics. Though the people who have the IBS due to the stress maybe, and that can be the Pitta condition, their probiotic can be harmful.
Absolutely,
So I think
absolutely,
yeah,
absolutely.
sure. Great.
Yeah, so we have different dietary recommendations for different conditions in functional medicine as well, and I think that's very welcome. That's the way forward.
Thank you.
Oh yes, hello, hello, ladies and gentlemen. I think my question is kind of personal, but I also interested. So we have a team of software developers. We creating applications, mobile web applications, and we intended to do some product in health tech. We already have clients in a health tech sphere, but as an outsource company for delivering development, right? And we wanna find, exactly want to find some maybe issue, some problem in health tech in order to do some product. And I'm kind of researching now the field, right? And when I discussed with other doctors, other persons from this field, especially in our country, I'm from Kazakhstan, especially in our country, there are many like so basic problems actually. For example, there is the lack of the gloves in clinics, you know, like gloves, you know, and the lack of ordering gloves, and so some basic problems actually. But we wanted to create some innovative product. And how do you think actually should we focus on something like innovative, create some new great thing, or we should just solve these basic problems? How do you think? Does that make sense?
I mean, for a company standpoint, companies do well when you solve a problem.
Yes.
If you're selling a product that doesn't make someone's life better or solve a major problem, you're just a Me Too technology. And successful companies think differently and solve big problems or make life easier and make life better. So I think it depends upon your bandwidth. But if you can solve a major problem in healthcare, then you'll be very successful.
Yeah, mine is
if you
just to,
want to.
yeah, so the way we function in our country is that you look for specific problems and try to get specific solutions. As an IT person, I think the question is, how would you utilize IT either to tease out specific issues or get solutions out there? So it's all dependent on what your technology is interested in answering. If the question is to relay information or communicate, then the issue would be, what are the questions, what are the issues, so that then you can inbuild in your software, and you can then be able to use the same software either to get back to the general community, or you are using the software to relay certain questions to the community and get back answers that would then help, be analyzed and help you make certain, policy decisions. So it's all dependent on what you want to answer. But of course, as Dr. Nathan has mentioned, the more specific you are in your software, the better for you, because then you get much more refined, answers. You're not getting responses that you wouldn't be able to know where to place from an analytical perspective. So again, the more specific you are, the better for you in terms of answering some of the questions.
Okay.
Yeah, I think I'd go with Dr. Nathan to very briefly just reiterate what he said. I think you've got to look at what the problem is, how you plan to make it better, and what your core competency, your ability to make that better is. So you got to look at the environment where you feel the problem is, and you got to see what it is that your core competency is, which you can actually offer to make that problem better, and then arrive at something as basic as gloves or something as innovative as a technology.
Okay. Thank you, gentlemen.
Yeah, thank you very much. I think that would be it. Oh, sorry. I hope that is the most burning question or comment.
Hi, Andre Youssef. You mentioned during the discussion about AI that cannot replace doctors and this stuff. In my life, I have a health issue, and I rely a lot on AI. So ChatGPT, any other AI sources. So do you think I should keep going, take advices from AI in daily life, for myself, for my kids, for anything, or that we should not rely a lot on AI, knowing AI is taking a big part of daily lives in all business. Thank you.
Well, I would just comment that you have to be careful, and it's probably very dangerous because the information that's out there is highly biased. And media controls the messaging, pharma controls messaging, and they feed AI what they want AI to regurgitate. And again, we've been misinformed and misguided on the treatment of chronic disease. And so I think there's still no better treatment regimen than to find a functional integrative medicine doc who can spend hours with you, not 6, 7 minutes, because you can never get a full patient history in 7 minutes and figure out the root cause. AI cannot replace that.
And I think mine is just out of experience. I've actually helped in designing some AI tools that we are using. And as Dr. Nathan mentioned, it's highly targeted information. You are throwing out this question, and this is a possible answer because it's guided. It's moving you in a certain direction. And I think that is a challenge. And you can't replace the brain, for example, with a tool that has been designed. The brain can move in whichever direction you want. If you had this, you're likely to engage in this particular direction. Just like I did mention, you can actually, instead of asking questions directly that would give you a positive answer, you could use other approaches to get responses that would help you make certain decisions. So I think it is a combination, and we have to be careful and cautious on how we utilize some of these technologies. Where you think it will apply and help you, well and good. Where we think it may not, then I think the appropriate thing is to do a physical.
I think I agree completely with my other two panelists. I think utilize it, but with discretion.
Thank you very much.
Thank
I'll
you.
leave it at that. Thank you, ladies and gentlemen.
Yes, let's give them a round of applause. And gentlemen, if I can ask you to step to the front of the stage so we can take a picture. Great. Thank you so much, gentlemen. Thank you, doctors. It's always insightful, always learning, always learning. Now, we've all heard it before, and the watches on our wrist always get excited when we hit that 10,000 step mark, right? When you reach that 10,000 steps, you get a little notification or a firework on your wrist saying, yay, you've reached 10,000 steps. Well, our next set of speakers and panelists are going to be asking the question, is 10,000 steps enough? Is this all we as humans require? And it's titled Wellness in the Modern World, Time to Go Beyond Those 10,000 Steps. So part of this panelist, we have Mudita Arora, the CEO and founder of Posh and LLC. We also have Valerie Melcher, CEO and founder and health nutritionist and chef of Sailing to Wellness, as well as Dr. Dipali Gupta from iCore Pilates. Please put your hands together for these lovely ladies. All right, the ladies are here. So once again, let's put our hands together for Mudita Arora, as well as Valerie Melcher and Dr. Dipali Gupta. Take it away, ladies.
Good evening, ladies and gentlemen. Thank you for being here for our panel discussion titled Wellness in the Modern World, Time to Go Beyond 10,000 Steps. So when we think about the title of this topic, the 10,000 step count was truly not based on any scientific research or data. It was mainly a marketing tactic from a Japanese company that created a pedometer called Manpo-kai, which means 10,000 step meter. Perhaps because of the Japanese character for 10,000 kind of looks like a person who's walking or running. So that's where this concept of 10,000 steps a day came. So from this, I would like to have our panelists, Valerie and Dr. Dipali. We'll go with a round of introductions first, and then we'll kick it off from there. So Valerie, would you like to introduce yourself?
Yeah, hello everyone. Thank you. Very excited to be here. So my name is Valerie Melcha, and I started sailing to wellness business a few years ago. Actually, it's now in the 4th year. And the meaning behind was I always wanted to empower people to kind of reconnect with themselves and with nature and a balance between like physical and mental health. When I grew up, I was very fortunate to experience the power of like harvesting fresh food, living together with my family. I was very often in nature, and I now see like how like really simple practices can lead to mindfulness. I think during the pandemic, I witnessed it how isolation and stress deeply impacted our society, and it became very clear that people needed really more than just a break or just something that tell them where to go or what to do. And they needed tools to rebuild their connection to themselves and to the environment. So this was actually my starting point to also create this business, blending nature, nutrition, and mindfulness into a holistic wellness journey. And yeah, I'm very happy to talk about wellness in our modern world now with you guys. And yeah, thank you.
Thank you, Valerie. Dr. Dipali?
Yeah, thank you so much for this, and it's such an honor here to speak third time on stage and with you lovely ladies over here. I'm Dr. Dipali Gupta. I'm coming from India, Pune, and I'm basically an MD homeopath and a counseling psychologist. And I'm a Pilates Ambassador Asia for India. Almost for 20 years, I have been practicing Pilates and homeopathy with minimal medicine. I believe in minimal medicine and holistically treating the patients. So Pilates has been a cornerstone of treating my patients, where lifestyle diseases is the thing that I like to, change and advocate specifically changes in this sense. Over the years, I've seen that when I see a patient, it's very important that we look at their mental makeup, not only the symptoms. So this has been the very essence of my practice so far. And over these years, I have now transitioned to become a Pilates educator globally. And I have had a chance to empower almost 300 plus students globally who now stand a chance to open their own Pilates studios, which cater to not only, everybody thinks of Pilates as a celebrity workout or a workout where you're just, getting fit for athletes, but then we take it one step forward in integrating it into rehabilitative space. And I've had the chance to mentor almost 300 plus studios worldwide, few in Dubai. The lady who accompanied me on the first day was one of my students who started her studio in Dubai. So that is the testament that we have this system working beautifully and creating success stories. and I'm here to propagate holistic wellness, and that's about me. Thank you.
Thank you, Dr. Dipali. Last but not the least, I'm Mudita Arora. I'm a registered dietitian nutritionist from United States. I've been practicing for about 20 years. I started my career as a neurology dietitian and moved into the hospital administration, leading the clinical nutrition departments and patient food service systems management. I am a CEO and founder of a curated nutrition company called Poshan. I'm originally from India, and Poshan in my native language, Hindi, means nutrition. So I believe nutrition is not a cookie cutter approach. The nutrition assessment and the dietary plan for each one of us will look very different. So that's where the concept of curated nutrition company came, because we have a lot of advances in science and technology with the advent of AI now that I would like to incorporate more in my company in the future. And that's the main reason that I decided to come to this Health 2.0 conference, to learn from the best and also to network with them. So having said that, we are going to kick off our panel discussion. And my first question is from the panelist is that why do you think that 10,000 step goal becomes such a universal benchmark for wellness? Do you think it's helpful or it's misleading to the world?
Yeah, thank you. Great question. I do think it's a very helpful starting point, but in general, I also see it that it's missing to a complete picture. So it really risks reducing wellness to a number, even though I see people nowadays do maybe more activities through it, but it does neglect the importance of various movements and awareness about mental rest, proper or clean nutrition, and a deeper connection to body and mind's real needs.
Dr. Dipali?
So how many of you wear this watch? Most of us have had that watch sometime or the other during our lifetime, right? And we have counted our steps to be completing 10,000. But then we have to remember that this was a marketing gimmick in 1965. I'm not saying that was a gimmick because it helps. It helps. If it helps people to move, it is a good move, definitely. But then people relying solely on that 10,000 step without understanding, if you've completed 10,000 step, but then, oh my darling, what about your stressed shoulders? You're still not feeling good about yourself, even after completing that 10,000 step. So is this really a good marker of, what's your health status? No, it is not. While technology has penetrated deep inside our health statistics today, we should understand that these technologies are double-edged sword, and we need to use it in a way where it is a tool and not a rule. So we need to understand from where it is stemming, and we need to understand and not overgeneralize towards 10,000 steps, because there is much more than just these metrics to it. There is quality, there is not quantity that we are looking for, right? When we're talking about health, we are not talking about quantity, we are talking about quality. Because after all, well before the biomarkers in our blood, we ourselves intuitively understand that we are not feeling well. So definitely we need to focus more intelligently on our internal intuitive self rather than on the digits.
I would just like to add this, that in the Journal of American Medical Association in Neurology, they found a possible link between walking 10,000 steps daily and a reduced risk for cardiovascular disease. So like Dr. Dipali said, that this is definitely, if anything is getting you moving, it's great. So having said that, Valerie, I would like to ask you that what role does mental health play in overall wellness, and why is it often overlooked in discussion about fitness?
Thank you. Good question. So I do think that like physical activities or exercises, they play like a very important role, and I think you just mentioned it. It can help to relieve like symptoms of mental health conditions. Also, beside that, like depression, stress, and anxiety. But yet, already I said, like fitness culture also nowadays, it very often focus like solely on like outward metrics, and I think this is like a big discussion in all our whole society. And now we are talking about it. Yeah, what role does mental health play? And I think it is very important to create this mental health, or to use mental health as something to implement it in these physical activities. So my aim a little bit is to create like wellness experiences, for example, that prioritize like emotional well-being, like let's say, like also mindful activities, like I don't know, fostering a deeper connection with people, going out and yeah, kind of integrating this into fitness, and not only solely focusing on these physical metrics.
Excellent. I would like to ask Dr. Dipali, going back to your comment on the learning from the internal intuitive self, um, I would like to ask you that many people rely heavily on the fitness trackers and apps, like you were talking about the Apple Watch or the Fitbits. Now, how can they shift from being dependent on metrics or numbers to developing a more intuitive connection with their bodies?
That's a lovely question because it is the essence of today's living. We need to have alignment. I simply believe that we need to have alignment of our body to the mind and the mind to the soul, so that we can go ahead and achieve the purpose of our living. The highest purpose of our living can only be achieved when we have good alignment. And for that matter, interconnectedness with the mind and the body is the first step. We stay in disconnected bodies. We stay in bodies which are no longer connected. We don't know how do we feel. Every morning when we are getting up, we are just ignoring whatever we are feeling inside and getting distracted by those 10 seconds, 5 seconds reels or that Instagram swipes that we are, doing all the time. The technology is playing a huge part in, adding fuel to this already distracted mind. And as it goes ahead, it's very important that we empower people to get connected with their mind, so that we start our path towards, connecting the soul, and hence getting to our purpose of our life. So yeah, it can start with mindful living, like very simple steps, like, when you get up in the morning, you can have a positive affirmation, you can have journaling, meditation, water bathing. You can walk on green grass, where these all are going to do what? They're going to switch off your stress mode off, yeah, in your body, which is your fight and flight mode, and switch on your parasympathetic mode on. Breathing techniques, like when you breathe fully, how many of us I see this all the time in my clinic. When we have people coming in, young desk workers who sit for 8, 9 hours a day. When they come in, they're hardly breathing like 10% into their lungs. When we ask them to, okay, can you breathe? And they are just breathing to the top parts of their lungs. Our entire corpus of our lungs lies to the side and back of our chest, and the breath needs to reach to those parts. And what are we doing? The way we are leading our life, we are entering more and more into stressed muscles, into tensed shoulders, into neck forward postures. What is it doing to our nervous system? It's kicking it off into stress mode. We are switching on the button of stress mode, what it does to our body. Shallow breath. What was it supposed to be like? In the ancient world, whenever we saw any danger, the stress mode was supposed to be protective to us, and that would last not more than 5 to 10 minutes. And now, by the way we are sitting, the posture hunch, the breath shallow, we are signaling our bodies that we are in danger. And what does that do to our body? It literally shuts off your rest and recovery mode and will kick all the genetic pool that your body has, all the diseases which are there in the genetic pool. It will switch on all of those one by one, because this is what it's in the inflammatory stage, it's in the fight and flight stage, right? So we need to understand this very basic thing. So I totally believe that empowering people today just with simple breath work will really lead them to take health in their hands, empower them to lead their life in a way which they would thank themselves or ourselves, to us as well, later in life. So yeah, we all, as ambassadors of health, we need to start propagating these measures where they get connected to their body with their mind. These simple steps, even journaling for that matter. All of these things we hear and we just leave it, but then these are very, very important practical steps. Just 5 minutes of each of these will definitely lead us to a place wherein we want to be and we dream of.
Well said. Thank you. Thank you, Dr. Dipali. I remember Nate from yesterday's panel discussion. He actually made us take a deep breath and in and out. Like, that's so true that we do not breathe properly nowadays. Like, we are just going in with the rut of life and just, flying by the seat of our pants. So taking that time for yourself is very much needed, and some of the steps that you said connects you back to the nature, which sometimes we'll spend a huge amount of money after being stressed for 11 and a half months. Then we'll take 5 days off, to go connect to the nature, and we feel great about it, but then we come back to the same rut. I always say, this is coming from the nutrition background. I always say that, we take a lot of pride in physical possessions. Like, we have possibly, somebody has multiple homes, multiple cars and all that. But I always say that, the most important real estate you will ever own is your body. If you do not take care of it, rest doesn't matter. If you are not able to, if you are not keeping that health and wellness check on your body, then no amount of money can make up for that, the things that we are losing there. So having said that, I would like to ask Valerie that, disease often starts long before the physical symptoms appear. So how can people become more attuned to these early signals from their bodies and minds?
Yeah, thank you. And I think you said it very well already before, both of you. And I think I just can just rely on that. I think that we forget very often the connection. Like, many of us have lost touch with all these subtle signals our body actually gives to us. Like, what we do, we go around, we are sick or we have a headache, we take a pill. Like, we don't really think about it. We breathe very clear, very shallow, and we don't even think about breathing. I mean, it's like something that came to us the first breath, and nobody, like, in our daily life, like, we don't really reflect on that. And I think actually the body tells us very well what is needed, but we don't really listen to our own estate anymore. So I think how to come a bit more attuned to that is actually just listening to these physical cues, like chronic fatigue. I had a very nice Heli up testing yesterday, and it just shows you a little bit about, like, your different chakras, but also about your body, about your nourishment, about how your energy level is actually. And these signals, like, chronic fatigue, consistent headaches, and whatever it is. And now you also talked about it already throughout nutrition, and this also is, I think, a very, very big factor. So we could use nutrition as a huge feedback, but yeah, we really need to listen to those signals. Like, for example, I don't know, when we eat a certain thing and we actually rely on this, or we have stomach issues, or we have a headache and we just do not really know where it's coming from. But when you look at someone's nutrition and you cannot already clearly tell, okay, this person only eats fast food or fat, or just really missing out on so many like ingredients that the body really needs. So it is very important to maybe teach how food also impacts our energy and mood level. And yeah, when people would come or become more conscious about it, and also yeah, know about these different impacts, I think we can understand how to feel better, and also to understand to listen to our body language.
Excellent. Thank you, Valerie. I would like to add this here that even signs of like overeating or binge drinking, like we could be super stressed, and that's what when we start to do that, maybe we usually don't do that. See the changes in pattern in your daily lives, or how you're reacting to certain stressors in your life. And if you can minimize them or eliminate them, do so before it becomes very difficult for you to come back to your healthy self. Having said that, Dr. Dipali, I would like to ask you if you can share an example of how mindful movement, such as Pilates or yoga, can transform not just from a physical fitness perspective, but also mental health. So if you have an example to share with us.
Yes, we see this all the time, right? So I'll specifically tell you about this example that I remember very well in my mind. And this is about a lady who just gave birth, and she had come for postpartum Pilates after her 3 months were done. And she specifically had a ton of, flaccidity in her lower abdomen, and she had a leaky urine symptom. And she had lost all her confidence, and that is the usual story with many mothers, right? When they give birth, until they have somebody who's guiding them to take care of themselves, right? So, so this lady, she came in and she was very skeptical and wanted to do something for herself, and she started doing Pilates. And she was like, okay, fine, this is just going to help me with at least carrying my baby around and sitting straight when I breastfeed and stuff like that. I'm like, okay, fine. Yeah, you can come in and you can start Pilates. And you can see that it's still there on my Google reviews. What she gave us a review is that doing Pilates helped her strengthen her pelvic floor so much so that it strengthened her from inside out, and that gave her strength to stand up for herself. It gave her her confidence back. So, things like that, wherein you are in control of your body, when you have that strength coming from inside out, where every layer of your muscles is communicated and connected to your mind. When you have a control of your body, simply then you are really at a place wherein you're in alignment with your body, and that speaks out in terms of your aura, the way you sit, stand, walk. Everything speaks loudly when everything is in alignment from inside out. And that's what really I feel is, these small success stories are definitely a testament to how amazing mind and body connection can be to an individual.
Thank you, Dr. Dipali. Valerie, so we have spoken about modern lifestyles recently so much. We know that sometimes we can be so busy, or sometimes it can be very sedentary. So we talked about your company, when we connected some days back. What are some creative ways that you can integrate, or you integrate natural, joyful experiences or movements into your clients' day-to-day lives?
Yeah, good question. And I think we already spoke about this all the time. It is as simple as it sounds. Like, it is integrating maybe small stretches, going for a walk, walking barefoot if it's on the grass, or it is in the sand, what we do, for example, in our trips. So for us, it's like really, I mean, people, when they come on our sailing boat, they are disconnected from their daily or from their stress life. So we really try to empower them every day to do all these practices, and you are totally focused on them. So you wake up in this like serene natural area, and then you go on the beach, you do some little stretches or some mindful yoga activities, coming back to the boat, having like a nutritious meal, very well prepared with like local products, and like really bounding as well, like within the community. And so it's not only that I want to bring in everyone on that week to experience it, but these are like practices that we also want people to take home into their daily life back these, just to remember what we maybe did one day. And we also ask those people that we work together, so maybe hand out a few exercises like breathing exercises or meditations, or we just simply send them a picture afterwards and say, hey, do you still remember when we did that? So to just break in your daily life, so just stop for a second and remember on these simple practices to come back to yourself. And yeah, I think this is just like the way where it starts and where we can integrate it. And also I think yeah, being already disconnected when coming, like you are on holidays and you really try, or you really enjoy this disconnection, so back home then you really can think about it, and it helps you to integrate something because you learned it on such a solid ground, with being totally disconnected and experiencing all these little aspects.
Totally agree. I think I just want to build up on this, that when you use the word community. So what do you think, Dr. Dipali and Valerie, that what role does community play in achieving and sustaining wellness? We talked a lot about individualized one, but in your opinion, how can community play a role in achieving wellness?
So definitely, when we talk about fitness, it should not be an individual burden. It should be a collective, thing that you're looking for, because every single person today wants to be fit. Maybe they are diverted right now, but then sooner or later, maybe they will be pushed, or they will realize to get into getting fitter bodies. So we all should make equal efforts. Community-wise, if you see in schools, we should integrate and give importance to mental health. I think that is a big thing. Mental health is invisible. I mean, you cannot have, markers like how we have for inflammation or anemia. So mental health can be very hidden, and we should have proper, stations wherein unbiased help is provided, wherein it is, very natural for anybody to approach a coach, a mental health coach. That is number one, I feel is very important. The second thing is right from the childhood, because when we're talking about children, we are looking at building their blueprint. So they say that by the age of 8 or 7 or 8, they have already got their blueprint ready with which they lead their life. So, a lot of habits are formed during those forming years. And that's where, when we hit it and nip it in the bud, that's the best place to start. So I believe that school will play a major role when we talk about fitness as a cumulative effort. The second thing is workplace. How many of us give it all to our, workplaces, and like we really want workplaces to be really compassionate, to be easy with their schedules, to again have more healthcare support system, and not to forget, they should have some kind of movement. So I am a huge believer. It should not be, and of course, if you're doing some mindful movement like yoga, Pilates, Tai Chi, great. But then if you don't, choose your movement. Do whatever feels good to you, whatever you connect with. But then move, because movement is very integral and very important in today's world. Also, I see many times people confuse with movement and fitness. When I ask this question to any person, oh, what do you do for your fitness? They're like, I play this sport. So playing a sport is a great thing to do, definitely. It's a movement, but then it cannot replace fitness, because fitness is more structured to what your body needs. It is very, very structured that way. And also, when we talk about it specifically, when we talk about people, what do you do for your fitness, they'll be like, oh, I walk. Or maybe I love to gym. Or maybe I do yoga, But then we should not forget that fitness is not just one factor. It is a combination of so many factors, like your stretching, your strength training, your cardio, all of these. Not only that, but then not to forget your agility, your balance, your coordination, your reaction time, speed, power. All of these factors are very important when we talk about fitness. So yeah, integrating all of these in a way wherein everybody works cumulative towards it will be a huge one, I think. When we
Well
talk
said.
about
Well
community.
said. Valerie, do you have?
Yeah, I'd just like to add a bit about this community part. I had a nice chat during lunch, and for example, when coming on the boat as well, as an example, like some people, they don't know each other, so they book separately. So we have 4 shared cabins, and then they book separately, and they really get to know each other. And I do believe in, especially nowadays, kind of we are getting into like this isolated way of living with each other. Like we go to work, we sit 8 hours behind a screen, then we go home, we scroll through Instagram, TikTok, whatever, but we have dinner alone, we also live alone, most of us nowadays. Like family and community is something that is really like missing out, or we are missing out to that point to communicate. And therefore, I believe that community is actually like one of the most important tools. So, to your question, and because you start to communicate, you start to share maybe your personal stories, you start to share, so understanding your own needs, but also listen to others, like where are they coming from, what are their needs, and I think community can really like strengthen us together, like really bound with each other, and it has one, or it is for me like one of the most important tools to use. And I also like being here, all of us together. This is why we come here. This is because we want to exchange, we want to meet, we want to discuss all of these little things, or we want to share. And so this is just a little wrap out about this community.
Thank you, Valerie. So there's a saying, right, that when you replace I with we, the illness becomes wellness. So, or ill with we, then illness becomes wellness. So definitely, community play an integral role in achieving and sustaining wellness. I think we are, just about. It's about time. So I'm going to ask one last question, and if you had to summarize your philosophy of wellness in one sentence, what would it be? You can go more than one sentence, but just, what would be your philosophy?
Yes, a good question. I think wellness in general is like really about finding a deep connection to yourself, to nature, but also to nourish your body and your mind, and as well finding this balance through mindful activities, and living in harmony as well a bit with nature. But just if it's like one sentence, that would it be about wellness.
Thank you. What about you, Dr. Dipali?
So I think 3 things. Number 1, be there for yourself. You take care of your loved ones. You want to give it all to your parents, to your loved ones. But then be there for yourself. Check in with your body, because it is yours to live in, right? And that is only one set that you've got for this life. So be there for yourself, and don't rely a lot on the biomarkers and maybe the tech. It's very important that you are in conversation with your own body and literally talk to your body. Hey, how am I feeling right now? think about what's happening, what is happening to my legs over there, what is happening to the butt that I'm sitting on. You know, have these things running on, what's happening. Keep a check to your body. That's how you can connect your body. And the third thing, most important, is don't shy with your mental health. If there is anything, go ahead and seek support, seek help. Even for that matter, I'm a counseling psychologist, and I check in with my counselor. I don't have any condition, I don't have any kind of problem or crisis, but still I go and check in with my counselor every 15 or 20 days. And it's normal because it gives me a lot of clarity, and I can lead my life with all that I have known. It empowers me. So yes, I want to normalize looking for help and support that way.
Thank you,
in
Dr.
mental
Dipali.
space.
I would just like to add one more thing to it, and we already spoke about it, is like getting your emotions in motion. Because we sometimes harbor so many emotions inside that one day, like they come out and that's not a good picture. So constantly keeping a pulse, keeping a check on your emotions, talking about them. Don't, this is, we are not working in silo. Having a good friend or a counselor, to speak your emotions, that's important. And for me, like something I read, a quote I read, which I totally personally related, so I'm going to just reiterate that here, that your body holds deep wisdom. You must trust in it. You must learn from it and nourish it. And I related to it because food, is nourishment to your body. And when you watch your life transform, um, you be healthy, from your body, mind, and soul. You be healthy. Take pride in what you have, what physical self, and there's no harm, there's no shame. There should not be any shame in the game. Like if we need help, if we need help to take care of a disease, we go to a doctor. So if we need help with our mental health, we need to go see a counselor or be able to talk about our emotions, which eventually will bring us happiness and health in a long term. And not only to yourself, but also to people around you. It's very, very important that we stay healthy, happy, for ourselves as well as for the community. So with this, we would like to open the floor for any questions. And thank you so much for your time and for your consideration for attending this panel.
Hi, panelists. This is Prithviraj. So I just got a thought, and I just want to get a clarification from all you guys. See, like Dipali ma'am, you say Pilates is something important, and Aurora ma'am, you say nutrition is important, and again, I myself say sleep is important. So are we like missing out something in connecting all these things to communicate to the general public, or we are getting lost in focusing only on our expertise or telling them to sleep? Because I heard you told 10,000 steps will help in reducing cardiovascular diseases. I tell even sleeping 7 to 8 hours will help in reducing cardiovascular. Are both should be done together, or is it like someone follows, one will help? So are we missing out anything in this in communicating to our general public? What my question is.
I'll take that. So definitely when we are talking about, specifically looking at some treatment, it's very specifically that you want to enter the door, but then the treatment is always holistic. Similarly, when we are talking about prevention, the preventive measures are always holistic. So we're not talking about any one thing, because one thing will never lead to, a good health. It is always, as we rightly said, that a mind, body, and soul. So, you should do everything that nourishes all the three so that we are in good alignment. Yeah, definitely.
So in your practices, do you connect all these things to them and educate, like how it goes?
Yes. So yes, I'm very big on, I'm an MD homeopath and a counseling psychologist, and turned into a Pilates educator. Well, in my practice over 20 years, that I have integrated minimal medicine and whatever support is needed mentally, along with movement, because neither one is important. all things are, and not only this, we should have minimal medicine and take support of so many beautiful, ancient and newly recognized, medicinal systems like your acupressure, your myofascial release. All of these are beautiful, and we should rely less on these chemicals. Minimal medicine is the way to go. So yes, definitely, we would like to deal with it holistically in today's world, because that is how your future is. And it's more of preventive rather than, treatment. Yeah, thank you.
I would just like to build on that, that I definitely do the lifestyle modification in my practice, because like we say that, if like it's beyond sleep, like, whether your body is rested well. It's not just sleep. Somebody could be laying in bed for 8 to 10 hours and tossing and turning, but might not be rested the next day. So definitely when we do the intake, like we ask about their sleep patterns as well. And sometimes we have even identified patients could have had sleep apnea, and we were able to refer them to the specialist sleep doctor, like, for that reason. So very good question, Prithviraj. I think this is not a cookie cutter approach, like just from the nutrition or the physical exercise or the mental health perspective. I think everything matters when for to make this body like work like a well-oiled machine. Everything is important, from rest to the foods that are worthy of you, like I always say splurge in quality over quantity, and you will see the difference. So that way, same thing goes for rest and sleep as well. Splurge in quality of rest or the sleep that you get. And also, like, if that is an issue, people would know if that's an issue, that they're not getting enough rest or they're not eating healthy, then that's where the lifestyle modification techniques can come in place.
Because I see frequently people coming with sleep problem, and especially sleep apnea you mentioned. I tell them even go to a nutrition and get checked and control your weight and physical activity. They never do it. They're happy with the treatment, what they're getting, and they continue eating a regular basis, and they'll come back again and tell me, I've used for 2-3 years the treatment device, I've not reduced on weight. But the thing is, they miss out the other pattern. So I try to tell them to go meet a nutrition, understand, and then control on that, and then increase your physical activities, which they are not doing. That's why I thought somewhere we are missing all this.
Just a thing over here. The power lies with the person who is prescribing, because the person who comes to us are very receptive to whatever we're going to tell them to do. So it is our responsibility to inculcate those, habits in them, or maybe empower them, educate them in a way which will be effective. Because if they're not taking steps, that means somewhere we are lacking in giving them that kind of measures, or maybe laying that emphasis on that they need to go ahead and do this. It's important for them. So maybe it comes up to us how we're going to communicate, but then yes, the responsibility lies upon the person to whom they are coming and consulting. So yes, I think the true power lies with us, where we need to educate rather than more than prescribing anything. We need to empower them so that they have their mind channelized in a way where they can think for themselves. Many people are very ignorant, and we need to, awaken them from their sleep. That's the best that we should be doing first.
Thank you.
Thank you.
Because again, just share my experience with sleep. So if people come with a smartwatch data saying that I'm having a good sleep, but I don't have any problem, because the topic was 10,000 steps. I had a similar experiences. They say your data is wrong. My smartwatch is telling I'm having a good sleep. So that is why I was trying to connect all this. Thank you.
Thank you.
Hello, everyone. So I have a question to ask Dr. Deepali. So because I was listening to you very carefully, and what I want to know that when you say that you don't have to pay attention to biomarkers, maybe I have missed some point. Because as a neurobiologist, what I understand is that science is advancing very fast, and we have come with so much of research, and that we know that biomarkers are very important in understanding like what's actually going on. We can feel like lot of things when we pay attention, as you say, and I believe it in completely that we have to be very vigilant of our body. But do you think really biomarkers are not important?
They are very important. So my point here was your body is a very important biomarker for yourself to understand your mind, your intuition. You need to be connected well before it's so sensitive that no other biomarker can capture it. Much more earlier than your body yourself, your intuition, like how she said that our body is full of wisdom. Our body is going to signal that. And if we catch it, the signal can be very subtle in terms of feeling fatigue. And you don't know the reason why. Or maybe feeling stressed. Or maybe having tensed muscles. So these are subtle signals which we should not ignore. And of course, biomarkers are the way we advance in science. So, of course, I'm not talking about not looking into them, but then
Because what I wanted to bring into point is that sometimes our body signals us wrong. It makes us put to do things which we are not supposed to do. Taste guides us into something which we would not be doing. So we have to pay attention to what actually is going on in our body rather than just relying on our senses, because sometimes like it may have a like contradicting opinion, but I feel that wellness is very much how not just how we feel but how we should feel actually. So sometimes we should people are there who do not feel what they are supposed to feel, and their body takes us into the direction which they should not be going. They start eating unhealthy because they feel that need for it, that yes, I should be doing this. People fall into addiction traps because of that. So you have to rely on your markers and you have to rely on science. That I want to say. Thank you so much.
very well said, but then that's again stemming from the very basic thing that you're not connected to your mind. Because basically, we as humans, we need to thrive. Every cell of ours wants to live, and it has enough wisdom. Like when we are born out of that wisdom, right? And it doesn't need to be taught by any kind of external things what it needs to do. It needs to do what it needs to do. So basically, we have that intelligence in every cell engraved. So when we are talking about connection, when we are really aligned in a true sense, usually the right thing follows. But then yes, if you are disconnected, and then that's how you come back through biomarkers, that's another way around the thing.
So
but then
the way it goes is that your mind has to be sane, then you take care of whole your being. If your mind is not in place, then it will lead you to different directions.
That's
So
through
you
the
have to
spectrum
take-
going ahead.
Then
But
again, you have
definitely.
to use research and science in order to know whether you are going in the right direction.
Absolutely,
Yeah,
absolutely, that's
yeah,
right.
but I enjoyed the talk a lot.
Thank you so much for your
Thank you,
lovely
Dr.
question.
Hassan. Yeah,
Thank you.
Thanks for the lovely panel discussion. I didn't have a question. I just had a comment with respect to what Nuzhat and Prithviraj had to say. I think all of you come from different disciplines. One prioritizing sleep, one prioritizing diet, one prioritizing movement, Pilates, and I think what is really key and what brings all of these together, what is the unifying factor amongst all these factors, is, and this will also give Nuzhat a response, is I think deep and present awareness. Presence and awareness which goes beyond the impulses and senses of the mind, which will only happen once you start going within, puts you in touch with your intuition. And it's in my experience, I often take people through the elimination diet to identify their allergies, their intolerances, their sensitivities. Now, while there is also an allergy test, we find that the outcome of the elimination diet is actually much more accurate than the diagnostic tests which come up with certain allergens. So I think unifying factor and the key for all of this to bring all these factors, movement, nutrition, sleep into balance, and I think what Dr. Dipali is also talking about, to get in touch with the intuition, is to really go within and be highly present and aware every moment. And I think that would be more of the unifying factor. Those are my 2 cents. Very nice discussion, and thank you very much.
Thank you,
Thank you so
Udit.
much.
I think very well said.
Thank you.
There we go. Let's give the ladies a round of applause.
Thank you, everyone, for your
And-
time and for being here for us.
And ladies, just step to the front
Thank
of the
you.
stage to take a picture, please. All right. Thank you so much, ladies. Mudita, don't go too far, as we'll be we'll be needing you very, very shortly. Exactly. Now, ladies and gentlemen, it's hard to believe that we have come to our final panel discussion, and this time we're going to be tackling diabetes, creating diabetes-friendly meals with nutrient-rich choices. Now, of course, living with diabetes comes with its unique challenges, but that doesn't mean that they should eat or give up flavor, variety, and things like that at the table. So we still have Mudita with us. She's going to be taking the hot seat once again. And of course, I'd like to invite Dr. Nazat Ashan to join her. Please put your hands together for these lovely ladies.
Good afternoon, everyone. So, it is such an honor to be again on the stage with Ms. Mudita on this fireside chat on creating diabetes-friendly meals. But this is the last of the session of the 3-day conference, and I see very few people turning up here. I know that you must have absorbed so much of knowledge by now, but we will make this a very fun and engaging session. We'll try to make it as much interactive as possible, not too much of load on your intellect. But yes, we would like you to engage and participate fully in this. And we'll bring up very light because this will be a tasty one, I must say.
Thank you, Dr. Hassan. So,
So let me first say that to kickstart this session, I must say that in the first place, why we are talking about creating a diabetes-friendly meals, like why it is so important. Because food is such a powerful choice in our lives. It can be the best of the friend and the worst of the enemy. I read it somewhere that if you do not take food as medicine, you will have to take medicine as food. And that is so true, that these days we are gulping more and more medicines just in order to be healthy. So we have to remember that. So, but don't worry, Ms. Mudita and I are here to show you that diabetes-friendly meals need not be very boring, but they can be tasty as well. And as a neurobiologist, I find it very fascinating that what we eat impacts not just our bodies, but our brains, emotion, and long-term health. Did you know that diabetes increases the risk of Alzheimer's disease? It leads to cognitive decline. And diabetes is also called type 3. Alzheimer's is also called type 3 diabetes. That's how deeply interconnected the blood sugar, the brain health, and everything is connected. So today we'll break down this with a little engagement section. We'll where we'll put up questions for the audience, and you will leave the room with better food choices. The first segment will be why nutrient-rich meal matters. Okay, so Mudita, let's dive into the science first. So because poor dietary choices, as from a neurobiological perspective, I should say, that leads to inflammation inside the body. So we should understand that from where the taste comes from, why we have nutrients in the first place. Taste evolved as an evolutionary tool in order to detect between the nutrients and to avoid whatever toxins it is. But now we have a modern mismatch that industries and the people who are selling food, they have exploited our taste buds, and we are getting foods which are not good for our health, and that has created a hell lot of problem. So today, I would like to ask Mudita, like, what are the some ways we can incorporate nutrient-packed ingredients into everyday family meals without making the food feel restrictive or boring?
Absolutely, Dr. Hassan. I think when we incorporate healthy ingredients into our daily meals, this can be a very good way to improve the nutritional value of the diet. We call it nutrient-rich foods, or NRF. So some of the ways how we can do it is, as we all know that, I'm sure we love smoothies. So adding some greens to your smoothies, adding, different color fruits, like, blueberries, strawberries, can add the nutrient. They are packed with nutrients, so they can add the nutrition value to your snack or smoothies. Now, using whole grain alternatives, like instead of rice or pasta that's made up of all-purpose flour. Nowadays, you can get pastas made with chickpea flour or garbanzo beans, or like in Hindi we say chole. Like we can get more high protein pasta nowadays, and that can definitely help reduce the carbohydrate content of these foods as well.
Wonderful, yeah.
Now, exploring different cuisines. We are, I'm sure some of us are adventurous eaters. Definitely, some of us might try to stick to our cuisine like that we are most comfortable with, but exploring other cuisines can add to the nutrient value of your food. Focusing on whole foods instead of just refined foods definitely help. Like with your vitamins and minerals, fibers just constitutes a balanced diet. Uh, I think Valerie in the previous panels talked about seasonal and local produce. Uh, Seasonal and local produce sometimes is most economical, and we don't get some things year round, right? Like in, certain fruits are mainly available in, say, summertime. So take advantage of that. Like when they are available, incorporate that in your diet. I always say, like, spice up, your food. Experiment with different herbs and spices can add flavor and some much needed nutrient profile to your food. And also, it can also help reducing the salt in your diet. If you use some herbs and spices such as lemon pepper instead of using salt, you can reduce the sodium content of your food. Meal planning and prepping ahead of time definitely can help, so that we are not having, like, some things can stay in our refrigerator for days and days because we just, we maybe didn't plan well, or we also forget that when we are bringing, say, a vegetable or a fruit from the grocery store, we do not know for how long it's sitting there. And now we bring it home and it's sitting in our fridge for another 10, 12 days. So it can lessen the nutrient density of those foods. So try to do some meal planning and prepping ahead so that it is, your foods, conserve their nutrients, but also it's good for your pocket as well. That we are not wasting a lot of food that way.
That means you mean to say we have to be very active while thinking about the food we are going to eat. Because in India, we spend a lot of time preparing for the food for the day. We usually prefer fresh and healthy food as you know, that the Indian culture promotes the ladies are busy throughout the day preparing the food. So yeah, we have to strike a balance in how we can preserve the food for a long time, but with the nutrients, do not overcook it or overheat it.
Yeah.
So that is very important also. So do you have a favorite diabetes-friendly recipe that is hit with the families?
Yes, I was just wondering about, that myself, that the winter time is coming and a lot of people like soups or stews in the winter time. So one of my favorite recipes or one of my favorite dish is the spiced ginger carrot soup. It's packed with nutrients such as vitamin A. You have, like a
So how
bright
do you make
color.
it?
Okay,
Just a
so
quick recipe.
just like quickly, if I say, just saute some onions, finely chopped onions, just add some grated ginger to it, very less, like just a sprinkle of salt and black pepper, and put some diced carrots. If you're vegetarian, you can put vegetable broth in it, or if you can take chicken or bone broth, you can add that as well. And once it is, it, sometimes you can pressure cook it, or you can steam it well so that the vegetables are fully cooked. You can emulsify them or blend them, and uh, garnish it with maybe just a dollop of cream or sour cream. And sometimes you can also um, use, say, gorgonzola cheese just as an accompaniment, because the flavor of gorgonzola is complementary to the sweetness of the carrot that
So
brings. So
the reason why I asked her to share the recipe is that experts are always experts. Today we have like number of YouTube channels sharing recipes and different kinds of influencers on the social media where we learn like how to cook and what foods to include in our diet. But I must say that a lot of these, like when I was watching over the recipes of lot of these food, they're not healthy at all. The way the techniques are employed for cooking of some of the, like some are very crazy, like frying, I do not know, frying some items which are like they were frying the grapes in a big pan. You might have seen that video was going viral. So the point we make here is that do not rely everything and anything present on the social media. So we have to be very smart in making the choices, and it is very important to know the technique of cooking and how to eat food properly. For example, me and Mudita were discussing over just before the lunch that spinach, which we usually have as sometimes in smoothies we have.
yeah.
Also, what is the better way to have a spinach? Whether to have it in smoothie because it is very heavy, I came to know from her. So she is a registered dietitian. So I would like to advise, and Mudita also will agree with me, that you have to have, when you are going through a chronic disease or metabolic disorder like diabetes, which we are discussing right now, or any other disease, you should meet a dietitian and then get your meals planned. And that's how you learn, educate yourself, and that's what we are here to discuss about. What do you say, Mudita?
Absolutely. I think I have always believed in investing in your health. Um, for example, we can go out for dinner tonight and we can spend like 700 dirhams and we would not blink an eye. But if it comes to getting a nutrition counseling, we might think few times, like whether it's worth it, whether it's worth my time and money and all. No, like I said earlier too, this body is the most important real estate you'll ever own. So invest in this, go to an expert, uh, ask your doctor. Physicians are very good about referring. If they do not refer themselves, then just say, am I able to see a registered dietitian? And you don't have to go to an extent to have diabetes or a renal disorder or cardiovascular disease. Invest in preventive maintenance as well of your body. So definitely
And
I agree
food
with
is
that.
such an important ingredient that we have to remember that we don't have to do excess of anything, and then we don't have to also cut down on everything, as is usually thought about diabetes. That we have now, Mudita will discuss in detail that how we can swap for healthy ingredients just to make the balance of it, but there is no necessity in cutting any of the foods we love. Even in diabetes also, just if we are mindful of the portions we are having, and we are having a what to say, correct calorie we are consuming, then I think we are doing our job well. And Mudita, tell us more about calorie counting, which you are discussing, right?
Absolutely, Dr. Hassan. So I always say that diabetic diet is a calorie controlled diet. It is essentially a calorie controlled diet. It is not a food elimination diet. We should, this is not about saying you stay away from this, stay away from that, unless until that is needed for some other reason like food allergies or things like that. It's, we use a simple technique called carbohydrate counting. So, and you'll be amazed that carbohydrate counting, carbohydrates can add very quickly. So, one carbohydrate exchange is 15 grams of carbohydrate, which is equal to, say, one slice of bread, or one roti, or half a banana, or half an apple. So, these, they'll start adding very quickly. So, your dietitian can help you know how many exchanges of carbohydrates you need in a meal, which will add up to, say in a whole day, how many carbohydrate exchanges will add up to make up for the calories that are prescribed for you. So now, having said that, those 4 exchanges of carbohydrates, say for your breakfast, try to make the best of them. So rather than just having, say, a slice of white bread, like 4 white breads, or one big bagel that is equal to 4 exchanges of carbohydrates, try to incorporate more whole grains. Not so much refined grains, but whole grains, complex carbohydrates, because they can stay in your system longer. They'll possibly give you a feeling of fullness, and you're not going to get hungry. Like eating a donut versus eating some complex carbohydrates, maybe, it's, yeah, a granola, or, a cereal with high fiber, possibly will be a little bit of more benefit than refined
Definitely,
sugars.
yeah. So I completely believe in that, but we see two extremes of diabetic population. One who is extremely conscious, and that is also not true, because diabetic complications does not only occur from hyperglycemia, which we usually feel that we have a high blood sugar, like if you are taking more breads or for that purpose, like you talk high carbohydrate diets, and we are on junk food or something like that, and the total blood sugar level rises. But in a larger part of the population, where people are too much, I would say, extra careful for that, they go into hypoglycemic shock, and the blood sugar level actually drops and go into coma for that. And I had I remember like there was a condition in my family where one of my aunts, she went into a hypoglycemic, I think, coma, and couldn't recover from that. And this is because like people have the notion that if they get diabetes, they should cut down on everything, and they should be living on minimal means, which is not true. As we can see that we can have very healthy swaps and healthy diet. So can you discuss some swaps which we can do, like in a biryani, instead of the high carb, or in a
Rice,
pasta,
yeah.
how can we just have a healthy meal without
So we
starving?
definitely need to take advantage of the variety of foods that's available to us now. So instead of, say, if you're making biryani, then incorporating brown rice instead of white rice. We might have to get used to the flavor profile, and it might be an acquired taste for some of us, but in a long run it can help. Maybe like another example would be pasta. Like nowadays you can get chickpeas pasta made from chickpeas rather than the all-purpose flour. How about having fruits instead of drinking fruit juices? Like sometimes it takes about 3 oranges, juice of 3 oranges to get just a small change, but it can be helpful in a long run. And these are the baby steps you can take, because if you try to do too much too soon, it's not going to stick. So just know what you're capable of doing, and don't underestimate yourself. You can be capable of doing way more than what you think. Um, so just when we were talking about the fruit juices, like rethink your drinks, like when you, how are you hydrating yourself? Like, so, that can help, like sugar sweetened sodas or beverages, and also like, we don't realize that these sugar sweetened sodas, how do we get these fountain sodas? How do we, when we open the can of Coca-Cola, or, like when we open a can of soda, like what comes, it's like a fizz, right? It's a sugar syrup and carbonation. That's all we are drinking. So I believe that the end product of a carbohydrate metabolism is CO2, but then now we are already adding the carbonation. We are already ingesting so much carbonation. So think about it, how much more work your lungs or your body organ has to do to eliminate that CO2,
But
from your
those
body.
habits, like it is, I must say, like again we come to again and again throughout these 3-day conferences, which I feel the crux of all the talks comes to that we have to intervene early, build habits early, so that later in life it becomes difficult. I don't say it is impossible. Of course, there is never a time not to start something good. But yes, so I'll share just a personal experience, like how do I train. Like I have a 9-year-old son, and yeah, he's too skinny, and perhaps I went too, I will say, uh, I was too conscious not to put him into bad habits of eating, or even for that matter, whatever habits are there for screen or anything. So when he was just 1 year old, some friend of mine, he came and then gifted a packet of chocolates, dairy milk. It was a big packet with 20 or 25 or so chocolate. So, and children are attracted to the colorful packets. So you cannot stop them from not eating. So, but he had never tasted till that time. So, because I was never giving, I have never eaten before him also any junk food. So, I gave him one chocolate each day, saying that chichi bad, you go and throw in the dustbin. And he did it for I think 20 days. And after that, he never had a candy. And after coming to Dubai, here he has tried candy after being 7 years of age. So that was a great success. But then again, it is a difficulty. He doesn't eat out now so much. I have to make him eat little bit. So that's how you have to inculcate the habits early on. And I'm very much like these topics are very close to the heart when we are going to discuss, because everything now will move into the another section where we are going to discuss the brain and gut connection. So whatever we are eating, we just don't have to think that it is satisfying our taste buds and goes into the stomach, gives us some kind of energy, and then we are done with it. No, it's not like the case. So whatever we are eating, it has to do something. It is doing something there, because even our gut has a brain. Now science is saying that gut is having the second brain. So what it is doing there, what food we eat is affecting the microbiome inside our gut. And this microbiome, whatever these bacteria and all these flora and fauna residing in our stomach, they produce some short-chain fatty acids. And these help in insulin sensitivity, improving the insulin sensitivity. So if you're taking the wrong kind of food, you'll agree with me on this, that if you're taking the wrong kind of food, we are disturbing the microbiome of our stomach. And then it goes into producing long-term harmful effects of our body. Just because we don't see it, we don't understand it, we can understand it this way. Like if you are into like freaking cleanliness and you wash your hands like 100 times a day and go and use the sanitizer, after some time you'll start getting fungal infections, I have seen, because you are destroying the normal bacteria on your skin. So if you're washing too much, it's not good. And that's also true for the stomach. Like if you are eating some purgative kind of foods or something, you're doing excess, it is going to destroy the flora in your stomach, and then it leads to bigger complications. So what we have to do is that, as you're saying, that you can add more to it, like how to add probiotics in our diet so that it maintains the microbiome. Do you want to add something to it?
So I just definitely what you said, Dr. Hassan, I agree with that. And I say that, you know, people with diabetes can also experience extended digestive problems because, such as gastroparesis, because it, your stomach can take longer to empty, and that can cause bloating, sometimes even nausea or heartburn. So diabetes has a very good relationship with, relation with the gut. And the poor blood sugar can, if we don't control it, then it can, of course, lead to the poor gut function. But if we watch what we are eating, if we educate ourselves in how we can improve the gut microbiome, like, especially if we are having, blood sugar issues, then ultimately the GI, will improve, health will improve.
So, and it is very alarming. You see, like when you are eating something and the gut microbiome, as I said, is affected, it leads to cognitive decline also. So the more you start eating junk, then you will not be able to think after some time what to eat and what not to eat, because then your gut will be guiding you of eating unhealthy. So that habit, a kind of builds a cycle in itself. So always you have to be mindful when you take that first bite of the best way to stop eating wrong is that always mind your bite, I would say. When you're opening your mouth to take something, just at that point think whether I should take it or not. And that is the point which will decide, no, it should not go into through this, because it kind of retreats into, we fall into a cycle of not eating healthy, and it is interconnected, leading to the cognitive decline, and we will not be able to come out of it so easily. Then we go into treatment kind of procedures, which is not very recommended when we are talking of some kind of getting into a holistic well-being. What do you think?
Absolutely. Like, I believe that a healthy gut may be the missing link between, how we are managing diabetes and how well it can be managed. But also, like, some of the tips for maintaining the gut health with the, if we have diabetes, is we can incorporate some fiber-rich foods in our diet. You'll be amazed that I'm coming from US, and how many of us lack fiber-rich diet. We call it standard American diet. It's SAD. It can be lacking in fiber, so make a conscious effort to add fiber to your diet, like to have those 9 to 12 to 13 servings of fruits and vegetables a day. Whole grains are rich in fiber. They also help you maintain the stable blood sugar levels, like you were talking about the glycemic index, or the how somebody can go in hyperglycemia, so that can help. Another way is like staying hydrated. We'll be amazed to know that how many of us do not drink, enough water during the day or stay hydrated, especially it is with the geriatric population. This is a very big concern. Adding prebiotics or probiotics in the diet. I have some friends from Southeast Asia, some from Southern India, and I absolutely love their practice of eating a yogurt rice or curd rice at the end of the meal. What they're doing is practically adding probiotics in the diet. And last but not the least, it's easier said than done, but manage your stress. If you can somehow find a good, stress management.
And will you
issues.
agree that food helps in managing stress also?
Absolutely.
If you eat healthy, ultimately you will be able to manage your stress also nicely.
Yeah, but Dr. Hassan, when somebody is stressed out, you will be amazed to see how quickly the food habits, the good, even they can default to overeating or binge drinking. Maybe they're just binge watching TV and don't even realize that they have already finished one tub of ice cream or one bag of chips. So portion control is huge with diabetes.
Agree, yeah.
So yes, stress, and that's what I said, it's easier said than done, but it is not impossible.
Yeah, so from this, like the key takeaway is that moderation is the key. So even water, if you say is useful for your body, you cannot drown and die in it. So excess of anything is bad. So that the old saying is true, remains true, that moderation in every sense is going to help you in whatever you do in life, not just in creating this diabetes friendly meal which we are talking about. So let's quickly move on to the engagement section.
Yes,
Okay? So
absolutely.
we'll ask some questions to see what you know or do not know, and it will be, I think, fun. So can anybody tell that whether it is true or false? Sweet potatoes are healthier than regular potatoes for managing diabetes. True. Yes, you know that, yeah. So because you are from a health background, I think the next answer you should not be giving. Udit.
Udit, we love to hear from you,
Yeah,
though.
so why sweet potatoes do you think are healthier than potato?
Just the white potato. You mean the sweet potatoes is
Because
better
it
than
is
the
called,
white
actually
potatoes.
there is a misconception, like in the families I have heard, they consider the sweet potatoes are not good. Okay, they think the sweet potatoes are sweeter and they have more sugar in it, but it's a very big misconception, because sweet potatoes are having lower glycemic index. Okay, so that's why, and it is healthier. So next question.
Yeah. So which type of fat is considered the healthiest for people with diabetes? Saturated fat or unsaturated fat?
Anyone?
Well, we have put, restriction on Udit. So, any takers?
Priyanka, right? Priyadarshini, yeah, yeah, yeah. So you are telling?
So the right answer is unsaturated fats. So foods like olives, avocados, nuts, and seeds, the oils made from them they are rich in unsaturated fats.
So that means you can swap your ghee or butter with olive oil. That is more, yeah. So that is called unsaturated fat usually, yeah.
Yeah, saturated fats usually get solidified at room temperature, but unsaturated will still stay liquid. These fats can improve your insulin sensitivity, and they can lower the inflammation too. I was listening to Udit, on several different panels, and what you do in integrative and functional medicine is amazing. Like, we are just in awe of that. I think in the Western world, we need to adopt more and more of that, but I know it's a very upcoming field. Having said that, we just try to do from a clinical dietitian perspective, like just help and educate our clients to just live healthy, using their resources the best. So having said that, if any fat is getting solidified at room temperature or upon refrigeration, then it has higher saturation that can lead to more inflammation and insulin resistance.
That is a good piece of information, I think. And so I'll go with the last question. I think we have run out of time. Yeah. So eating fruit will raise your blood sugar levels too much for people with diabetes. So what do you think? Eating fruits. No, it's false. So yeah, yeah. Udit, you can add to it. And the choice of fruit is also very important. Like that, you can include lots of berries, citrus fruits, and they're very rich in, as you said, rich in vitamins, minerals. So you cannot cut down on your fruit intake if you are diabetic. You can choose your fruits wisely.
Yeah.
So
yeah, absolutely.
So let's wrap up.
Yeah.
Mudita. So can you give one closing remark or call to action, or whatever you feel like, because we have run out of time and people have also run out.
So this is what I'm looking at. I think Dr. Hassan and I might be standing between you and closing of the conference, so we will make it quick. Thank you everyone for your kind attention, and thanks to Dr. Hassan for making this fireside chat into a great learning opportunity. We clarified few doubts here. And if there's a takeaway that I would like for you to go home with today is educate yourself. Educate yourself appropriately. Google cannot give you all the answers. Please, please ask your physician, your primary care provider, or your GP to refer yourself to the experts who can actually help you manage your diabetes better. In the meantime, you can master your portion control. even a skilled professional can underestimate the calories by 200 or 300 calories per day, and a layman can go up to 600 to 700 calories per day. You can just underestimate them. So think about it. If you're eating 600, 700 extra calories every day, it adds up, in your diabetes management. And then build a balanced plate with carbohydrates, with proteins, and fiber-packed veggies. Indulge in quality. Like I said, eat foods that are worthy of you. So not just anything and everything, but the foods that are worthy of you. And last but not the least, we all snack, at some point of day. So snack smarter. So again, going back to that, educate yourself appropriately. No shame in your game. You don't know something, go ask an expert. And do not hesitate in investing in your health. That's the best thing you can do. So refer to an expert, whether you want to go to a Western, you want to go to the IFM expert, you just integrative or functional medicine expert. Please educate yourself. We always say diabetes is truly like we say it's a disease, it's just a symptom that other things can be going wrong in the body as well. So listen to your body, educate yourself, and spread awareness.
So well said, Mudita. So I would end by saying that balanced diet will definitely keep endocrinologists away, and it will give a power over your body. And because we are closing now, so I would just like to end up with few lines that blessings on science when earth seemed old, when faith grew doting and reason cold. It was she who showed the world was young and taught a language to its lisping tongue. Thank you, everyone. Thank you for having us.
Thank you indeed, ladies. Please just take a step to the front of the stage so we can take a picture. And I'll add my 2 cents as well. You are what you eat. All right, it's the last time you're going to see me for this conference, and let me tell you that it's been an absolute pleasure. I would like to say a big thank you to all of our speakers over the past 3 days. The Health 2.0 conferences has always been a big success. I'm here for the 2nd year in a row, and the technologies and all the discussions just keep getting better and better, and I walk away learning so much more. I'd also like to extend our gratitude to our sponsors and partners, especially our gold sponsor, Invisa Health, and our bronze sponsor, Team Up Corp. Now, as we wrap up, remember that it's not the end, but the beginning, because I'm sure most of us made a lot more connections, and this is the time where we use those collaborations and we help each other to bridge the gaps where before it was a little bit more difficult to just reach out on an email, right? And try hoping that you'll get a response. Also, check out the 2.0 conferences exhibit booths on your way out and the registration desk to find out when the next conference is, which